We are going to reconvene and pick up where we were. We were on agenda item 2, which is our COVID update. We had finished the staff presentation, and we are going to pick up public comment at this time. So ask the clerk to please call forward the public speakers on this item.
Thank you, Chair Fletcher. We have 19 individual requests to speak on this item and 2 group presentations. We also received 5 e-comments on this item. Any members of the public that requested to speak on item 2 by phone, please dial into the conference line now using the instructions that were provided to you. We'll begin with the in-person speakers, and we'll begin with the group presentations. And the first group will include Samuel Plantowski, Audra Morgan, and Mike Bonello. If all those individuals can please come to the podium, and for those that are not speaking, if you could please wait in the hallway until it's your turn to speak to the podium. The group will have 10 minutes to address the board. All individuals in the group must provide testimony during that 10 minutes. And we'll ask you to please state your name for the audio record when you begin speaking, and please self-regulate your time using the timer on the podium. You may begin. Please state your name for the audio record and self-regulate your time using the timer on the podium. You'll have 10 minutes, and all individuals must provide testimony during the 10 minutes.
Okay, thank you. My name is Audra Morgan. I am speaking on behalf of the residents of San Diego County that are here with me today and watching this meeting live. Our mission is to restore our state of California and local community, giving power back to the people. It's been far too long that government entities have failed to represent the electors of this county in the capacity in which we now demand. We have stood back and allowed state and local government to make decisions on our behalf without consideration of what we the people want and need. Instead, state and local government have far overreached their given power, and it is time today that this comes to an end. We are here to watch, listen, and engage in every single decision made on our behalf, and if changes need to be made, we will make them. We are here to ask for your support on our efforts and align with our requests. As we are the electors of this state and county, we have collectively decided to take action to regain our state, county, city, and most importantly, our freedom. We are here today to specifically address points that have recently come to our attention and feel it is imperative we receive a resolution at your Board of Supervisors meeting on July 13th, 2021. We respectfully request that San Diego County pass an ordinance that explains in detail how AB 262, now California Health and Safety Code Section 120175.5 will be implemented within San Diego County. Specifically, we need clarification that Section 120175.5 will never be interpreted to permit the county public health officer to remove citizens of San Diego County from their residence under any circumstances. And that citizens must be afforded all due process rights under the law. We are willing to work with the county on the language to be adopted and even provide them with a draft of the interpretation of California Health and Safety Code Section 120175.5 that needs to be adopted. We submit that if the board members cannot agree to adopt such limitation to present at the July 13th board meeting, given the serious abridgment of freedoms that California has undergone over the course of the past 15 months, then efforts will be undertaken to remove and/or recall those board members who cannot agree to this extremely reasonable request. We know this meeting and all Board of Supervisors meeting are recorded, and we ask that nothing is edited or removed from any recording when uploaded for future review, and that all meetings are conducted in accordance with the Ralph Brown Act. San Diego is the 8th largest city in the United States and 2nd largest city in California. As the first area in California in which Europeans settled, San Diego has been described as the birthplace of California. San Diego is a hub of naval activities. It is a place where the avocados go to grow, a place where people live and others envy to seek and spend their vacation. San Diego is a city charter under California law. By fostering an innovation-friendly environment, charter cities enable better institutions and economic growth. Giving historically legal isolated communities access to better laws is a necessity for long-term economic development. Charter cities provide residents with access to sustainable and efficient legal systems. This makes it easier for them to start businesses, remove barriers to entry, and protect them from corruption and discrimination. San Diego is a place people move from out of state to start a new life, a place where you have oceanfront property and farmlands close by. We must not let the birthplace of California and all San Diego County residents fall victim to these bills and what they intend to bring. You must protect citizens of this amazing county in any and every way possible. Thank you.
My name is Mike Borello. I'm a resident of Carlsbad. I'm a ventilator controls engineer. And I'm also here with the group, We the People in California 1776. We are a large group, and this message is being said across California right now at all Board of Supervisors meetings and across all counties of California today. San Diego County residents believe there is a planned, systematic, I should say most San Diego County residents believe there's a planned, systemic attempt to force residents to get the shot through Assembly Bills 262 and 389, and Patient Access and Interoperability Final Rule CMS 911-5-F. We would like to understand how AB 262 that was passed on October 9th of 2019 is related to the San Diego County 21-22 fiscal budget, which supports CMS 911-5-F. The CMS final rule requires hospitals, counties, and physicians to provide the government patients' medical information, including but not limited to patients' current address, medical clinical notes, and most concerning are immunization records. AB 262's language is vague, but it's clear it gives the local county health officer full discretion and power to issue orders to other governmental entities within the local health officer's jurisdiction. To take any action the local health officer deems necessary to control the spread of the communicable disease using taxpayers' money. Any action can include removing you or family members from your home if the California governor or his HHS local agency deems any person a threat to public health. AB 389 authorizes a fire protection district to enter into a written subcontract with a private ambulance service and authorizes a county to develop an emergency medical services program and requires a county developing such a program to designate a local EMS agency that is required to be the county health department, an agency established and operated by the county. Article 11, Sections 4 and 5 of the California Constitution provide that charter cities and counties may develop ordinances to govern local affairs, and further, that ordinances passed by these entities can take precedence over conflicting state laws as to local affairs, such as the county health officer's decisions surrounding the implementation of Cal HSC 120175.5. We, the people of San Diego County, request you, the San Diego County Board of Supervisors, to pass an ordinance that explains how AB 262 will be implemented within this county. As a consequence of the foregoing, we respectfully request that the county approve, adopt, and ratify an ordinance that clearly interprets Cal HSC 120175.5 as follows. Section 120175.5 will never be interpreted, number one, to permit the county public health officer to remove citizens of San Diego County from their residences under any circumstance unless that citizen's own primary care physician or a physician elected by the resident to be removed has determined that said resident is currently infected with a communicable disease that poses a significant threat to the community. And number two, that citizen must be afforded all due process rights under the law, irrespective of any emergency powers San Diego County purports to be operating under. We are also requesting that the San Diego County Board of Supervisors take our concerns to the State Assembly by submitting our letter that's in the attachment. So requesting the immediate stop on any further action on AB 262. Thank you.
I'm Samuel Dantowski from Santee, a resident of San Diego, California. Also with We the People of California, 1776. Don't have very much time. I reiterate the same points that the previous speakers, Mike and Audra, both gave. And I please urge you to act on this matter and help us. Thank you.
Thank you. We'll now move on to the second group presentation that includes Christina Dahmers, Sterling Moffett, and Brad Brinkman. And again, if you could please state your name for the audio record.
Is it okay if I go? Christina Dahmers. I'm a resident of Del Mar. I'm a wife, mother, and a fellow American, and I feel it necessary to speak to you regarding the future of COVID-19 policies. I'm a product of public schools, whatever that entails, and although I knew the premise of the Constitution, I never actually sat down and read it. But when COVID was thrust into our lives and we lost our business, our savings, and my son ended up in rehab, one of my sons, I started to question just what the heck was going on in my beloved United States of America. And I began, as many in this country did, to realize that I'd been asleep at the wheel. I'd been focused on the wrong thing while my rights were trampled. It's been over a year now, 15 months. Do you guys remember when it was 2 weeks to slow the curve? Well, regarding the vaccines, I'd like to choose for myself whether or not I want a vaccine. It shouldn't be a decision that's based on the fear of me losing my rights or my child being denied an in-school experience. It should be based on my personal and private medical history, the best, most recent information, and my religious beliefs. And I know the consequences for my actions, and I accept those. You choose for you, I'll choose for me. Personal responsibility is a very fundamental foundation of this country, the right to make one's own decision based on all available information, which brings me to my second point. It has been verified through my own research and through Project Veritas that information regarding negative COVID vaccination reactions and deaths are being removed by Google, Twitter, and Facebook on a global scale. Big tech is using a narrative that seems to be coming from Big Pharma with governmental support, and I wonder why that is. How can I make an informed decision if I don't have access to the information? Please break these companies up, take away their tax statuses, and clarify the big role of Big Pharma in our society. If the government or Big Pharma want to give away shots, I know a lot of people whose insulin has just skyrocketed lately. They could use some free shots. These companies have too much power. Masks. The CDC does not have one peer-reviewed study proving that common masks like this keep people safe. I was told to wear something, whatever, just covered my breathing holes to keep my community safe, which I did for over a year without evidence that it made any difference. Corporations required this, grocery stores, restaurants, airplanes still do, and the government approved of it. Now that everyone can get a vax that wants a vax, why am I wearing a mask? If the vaccines work, then it doesn't matter if I wear a mask. It doesn't matter if I get a vaccine because you've covered yourself, right? Which brings me to my fourth point, and this is a final point. Masks are being used to segregate and shame people who, for a myriad of reasons, don't want the untested jab. It singles them out as tainted, dirty, and unclean, and it's un-American to force a person to disclose such sensitive personal information. It's un-American to get the most physically invasive thing, an experimental vaccine, jabbed into you. It's what dictators do to a servile population, to be set apart and shunned. It's shameful. Please stand up regarding this. Please be brave and defend our rights. These freedoms are equally shared among the people. So when we lose a right, you lose a right, your children lose a right, your grandchildren also lose those rights. Because where we go one, we go all. God bless America.
It's a great time to be alive. great number of challenges that we're all facing right now. Darn it, Mr. Fletcher left the building. Okay, anyway, just wanted to go in and say that my name is Brad Brinkman. I'm a resident of San Diego County. I'm a parent. I represent the Let Them Breathe organization, and I'm the voice of the children. Do you all remember the first time that you saw your first horror movie? Remember how scared you were? This is how these kids are feeling. Kids that go into bed at night, won't take their mask off because they say, Mom and Dad, I can't take my mask off because I might die. What do you guys think about that? How about when you go to sleep tonight and you think about that? What do you think when you see little kids on the playground, 3- and 4-year-olds with masks on? How does that sit with your heart? What do you think about putting them in masks in the hot summer heat? You think it's okay for these kids to live in this constant state of fear, this fight or flight? You've got teachers in the classroom, instead of asking them, is there something that you don't understand, something I could help you with? Say, put your mask up over your nose. That's disgusting. Do you think it's a great benefit for the kids when the teachers continue to instill this fear in our kids, concentrating more on telling them to keep their mask up over their nose? Is it good common sense for our kids and our future to continue this insanity that's accepted as normal, these masks? Think about these kids living in this constant fear, this anxiety, this nervousness, and all this emotional damage. You hear about how many kids have committed suicide. One is too many. You hear about all the kids with the mental health problems. You think about that. This is a great time to be alive. It's a great time to be in the position that we're all in because we can make a difference for the future. When I walked in the building, I saw this symbol, and I thought, wow, the noblest motive is the public good. And what could be a more noble motive than to help our kids and take these masks off them now? I'm asking all of you when you go to sleep tonight, put your hand on your heart and think about these questions that I've asked you. Think about the damage, the long-term effects. Our kids are our future. And it hurts me to see them walking around in fear, being forced to wear masks. Thank you.
The name is Sterling Moffett. Good afternoon. Many citizens in San Diego share the concern. Does San Diego have a date to fully reopen? We're talking economy and schools. Is it June 15th? I am concerned, and citizens are concerned, and we insist the lockdowns end and have our civil rights and liberties returned to us. It's my position that there is no emergency within San Diego that warrants these current policies. Mask. The CDC advice has been less than inconsistent regarding mask recommendations, including protection gained from masks. Parents of school-aged children are demanding the masks be taken off, removed from their children. It's discriminatory practice to require masks to be worn in order to enter businesses and social gatherings. Vaccinations. All individuals should have the freedom of choice when it comes to vaccinations. The requirement to show vaccination status to conduct daily business and social activities is discriminatory. There are many, many San Diegans who cannot and should not be vaccinated. They include children under 12, those with the COVID-19 antibodies, and those who refuse to take it for personal reasons. Mandated vaccination ID. Last topic. The idea of mandating citizens to prove vaccine status via identification policy is unconstitutional and discriminatory. Secondly, this policy should not be adopted under any circumstances for the San Diego County. Thank you. Over to you.
Thank you. We'll now move on to the individual.
Thank you.
We'll now move on to the individual speakers. If I call your name, please come forward and line up in the hallway at the physical distancing stickers. Kaylin Knight Alvarez, Sandra Martinez, and Maria Wellner. If I called your name, please line up in the hallway and approach the podium. And please state your name for the audio record. You'll have 2 minutes to address the board.
Hi, my name is Kaylin Knight Alvarez. I'm from Oceanside, and I'm a very concerned citizen. First, before I go on into what I'm concerned about, I want to thank you all for the opportunity to speak to you all today. All of you. My citizens, the people standing on the board, thank you for hearing us today. I hope you will act with all of the people that have come forth with their concerns. I'm appalled by the handling of COVID within San Diego County. You do not know what is best for each person's individual health. In fact, you have done more harm than good. One of my niece's 13-year-old friends wanted to end her life because of COVID lockdowns, and I've lost a cousin-in-law due to overdose during this pandemic. Suicide, sexual abuse, substance abuse, and depression have skyrocketed under your mandates and lockdowns. Only we, the individuals, know what is best for ourselves. We, the people, are taking our body and health autonomy back. No more mask mandates, no more lockdowns, no vaccine passports, no forced or cursed vaccinations. Now, not ever again. It is not you or any of your business to ask for us for our vaccination status or to ask a healthy person to wear a mask, as you have asked us all today. Hence, this. This is discrimination against our God-given rights. Only we, the individual, get the choice. It is wrong for workplaces, schools, or any other public entity to ask for medical information or require masks. You are infringing on our rights and individual sovereignty by upholding any kind of mask mandates, especially with the data we have now. We, as individual families, communities, know what's best for us. No one should be peer pressured to get vaccines, procedures, or wear masks due to government and news influence. The only thing that should be considered is risk to reward for health on an individual basis. Several family members and friends have gotten the vaccine, not because they're concerned with COVID, but because they wanted to keep their jobs, travel, or were peer pressured. You are not considering the reality of the current situation. You and the government have strayed from the facts, truth, and science. In an email from my assembly member, Tasha Berner-Hovoff, I saw a vaccine art competition for children and a state vaccination lottery.
Thank you, ma'am. Your time is up. Move on to the next speaker, please.
Hello again. As a retired medical professional and researcher, I know what I'm talking about, and I have no interest in supporting a false narrative.
Ma'am, I'm going to pause your time if you could state your name for the audio record.
Oh, I'm sorry, Sandra Martinez.
Thank you.
You have taken all sorts of measures to protect people from COVID, but something very important has been overlooked, and I'm sure Dr. Wooten knows the importance of vitamin D for good health. It is the master key for the immune system. How come this isn't advertised anywhere? Following real science, we know that vitamin D levels decrease COVID severity and risk of hospitalization by 90%. Low vitamin D levels increase susceptibility to colds, flus, viruses, along with depression, suicide, and numerous other diseases. Almost all Americans are vitamin D deficient. On January 12th, this board declared racism a public health crisis and wanted to ensure an equitable response to COVID. Do you really want to ensure equitable treatment and care? The darker your skin or further north you live, the harder it is to synthesize vitamin D. It's plain and simple biology. The way to address this health inequity is to educate about vitamin D, as it is the single most important distinction between people who are severely affected by COVID and those who are not. Even the esteemed Dr. Fauci takes vitamin D. So why isn't the Public Health Department talking about this? This simple bit of information will decrease illness and save lives. San Diego County received millions of relief dollars, yet not one penny has been spent to educate people about vitamin D. Why not use a portion of relief funds to educate about vitamin D? Make a genuine and meaningful difference in the fight against disease and save lives.
Next speaker, please.
Maria Wellner, RN, BSN, 13-year critical care nurse in San Diego County and mother of a 2.5-year-old. I'm a little bit concerned and troubled by the 2.5-hour break and allowing us to the public not to speak. I would ask as grievance number 7 that you guys consider we the people's time more appropriately, the public being here to speak in person. So-called public health deity and public officials. Perpetrating evil on a mass scale always requires harnessing good people to do evil actions. Do not excuse an evil result just because the perpetrator meant well. How do you look yourself in the mirrors in the morning, especially you Dr. Wooten? I suspect that all the money from these sociopathic global elites will not save your souls. May God or humanity have mercy on them. If you are human, have a soul, or retain any sense of patriotism to the United States of America, it is not too late. Crimes against humanity are certain acts that are purposely committed as a part of widespread or systemic policy directed against civilians in times of war or peace. They differ from war crimes because they are not isolated or sporadic events, but they are either part of a government policy or wide practice of atrocities tolerated or condoned by a government or a de facto authority as King Gavin. Your house of cards is falling, and you guys need to know that the first lie of the public health emergency of the infectiousness is not the virus, it's the person's susceptibility. I've seen it time and time again. The CDC released numbers on May 5th, 2020. The average person that dies of COVID-19 has 4 serious comorbidities, mostly being severely obese and diabetic. An asymptomatic transmission does not exist. We have never quarantined the healthy. Fraudulent PCR testing, you're never supposed to be used for diagnostic purposes. The death count was reappropriated. I don't know why my time is going down, but other people have more time to speak. How many people of these 280 cases of COVID-19 in the county were symptomatic? I saw mild cases of symptomatic presentations of COVID-like illness in PCR negative patients. What was the cycle threshold set on the PCR test, fraudulent PCR testing? The cycle threshold has been set above 40.
Thank you, ma'am. Your time is up. Thank you. We'll now hear from those that requested to speak by phone.
May God have mercy on all your souls.
We'll now hear from those that requested to speak by phone. We'll be calling speakers by the last 4 digits of their phone number. You'll hear a notification that your call has been unmuted. You will then need to press *6 to unmute your phone. We'll ask you to please state your name for the audio record, and I'll remind the callers that they should mute their TV or live video stream before they begin speaking. And if you could please identify the first caller.
Thank you. Our first caller is 9097. 9097, please press *6 to unmute.
Hi, my name is Anna Torres de Souza, and I'm here to talk about the COVID restrictions. I'm asking the Board of Supervisors to please end this mask mandate and lift it completely in San Diego County. And I want to remind you about California Civil Code 51. I'm going to read it. All persons within the jurisdiction of this state are free and equal. And no matter what their sex, race, color, religion, etc., disability, medical conditions, etc., they are entitled to the full and equal accommodations, advantages, facilities, privileges, or services in all business establishments of every kind whatsoever. The definition of a public accommodation is a private business engaged in commerce. That means retail stores, banks, restaurants, recreation, transportation. Any entity, location, or establishment that is open to the public is prohibited from discriminating against the entry of a member of the public. I'm asking that the board pass a resolution denouncing the requirement of any facial covering by any business establishment whatsoever. This is the law of California that protects San Diego County residents' civil rights from being discriminated against. Many people believe that covering one's face does not align with their sincerely held religious beliefs, or because they simply know how ineffective and even harmful it is to cover the only airways that they have. If these are just words on paper, if we do not have our civil servants helping to uphold the law that prohibits against segregation and discrimination. Furthermore, I too am extremely concerned about the possibility of there being some kind of allowing of businesses to permit in the future checking of
Thank you. Your time is up. Thank you.
Our next speaker is 2703. 2703, please press star 6 to unmute.
My name is Larry Seid, a San Diego resident. I'm over 70 years old. My parents live well past 70. In the past few years, I've made an effort to get plenty of sun, as my parents did. As my vitamin D level is always around 100, I never have colds or the flu. I'm very concerned, as many others, including the We the People California 1776 group, about AB 262 and AB 389. They allow dictators in government to force the vax on healthy people that are no risk to the public. Show me any scientific studies where anyone with high vitamin D levels has been admitted to a hospital. There are none. Mike Adams, also known as the Health Ranger at naturalnews.com, that's naturalnews.com, says there are 5 stages of vax tyranny. I don't remember them all, but they include censorship and bribes, such as the lottery that's taking place right now, which I believe is illegal according to California and federal law. The last stage is forced vaccination. For those listening, change things while you still can. There's still a republic if we can keep it. Lastly, I request that my comments and those of like-minded people are not edited in any way or deleted from the public record. Thank you.
Thank you. Our next speaker is 4253. 4253, please press star 6 to unmute.
Hi, my name is Diane Ake. The California Health and Safety Code 101080 states that a local health emergency can only be called when there's an imminent and proximate threat of the introduction of a contagious disease, and the local health emergency expires after 7 days. The local health emergency was called in February 2020. There is no emergency. There is no imminent and proximate threat of an introduction of a contagious disease. The county health officer said this morning the county wants to stay in a state of emergency to expedite procurement of supplies, get certain funding, help with recovery. You say extending emergency status is done all the time with wildfires and earthquakes in the recovery stage. Are these emergencies extended indefinitely? It's been 16 months. And Wilma Wooten just said in her presentation today the death rate's the lowest it's been. And wildfire and earthquake recovery doesn't require invading people's personal space, dictating personal behaviors on how to operate their businesses, or requiring medical procedures. Whatever benefit you say declaring a false emergency provides is far less than the devastation it causes. Your emergency declaration is literally suffocating children who are in no danger of contracting COVID, making them wear masks all day at school, terrifying kids, causing suicide, substance abuse, allowing businesses to refuse service to people who haven't been vaccinated. You need to end the emergencies orders now. Fully open San Diego with no restrictions and never shut us down again. We are putting this board on notice. We will never consent to businesses or anyone else checking our vaccination status, not on our watch. I'm co-organizer of Reopen San Diego, and we have thousands of members. Don't even think about it.
Thank you. Our next speaker is 7819. 7819, please press star 6 to unmute.
My name is Rich Van Every. I'm a small business owner and homeowner in Carlsbad. I'm wanting to check in with you all as I came there in person last time and kindly requested that you watch the Plandemic movie. Can I get a show of hands? Who watched it? Plandemicseries.com for anybody that needs a reminder. I am a proud supporter of medical freedom and the truth. I support letthembreathe.net and the Reopen San Diego group, freedomkeepersunited.org, and the children'shealthdefense.org. I encourage you all to review the Constitution and remember what it means to be a proud American. There are people unable to speak in person due to these unjustified and obscene restrictions you're placing in these meetings. Sharon McKeeman, the founder of Let Them Breathe, is one of those mothers that does not feel the rightful chance to be heard in person by you. I want you to really think about that. You may remember me wearing my free thinker hat last time, thanks to PragerU. I'm not sure if any of you have progressed your ability to think freely, but I want you to think about this. Just like the previous speaker stated, you are being put on notice. And there is a movie in the works right now, and millions are going to see it, exposing these crimes against humanity. So it's time to stop pretending that you're on the right side of history. And it's time to make the decision that you want to be known as a hero or a villain in this movie, because that's what's happening. The COVID-19 scam is over. We are on to you guys. We are watching you. So my question for you is, are you prepared to be on trial?
Thank you.
I hope you really think about what's coming down the road, because this is not going away.
Thank you.
And ultimately,
Our next speaker is 8866. 8866. Please press *6 to unmute.
Hello, this is Sharon McKeeman. I'm the founder of Let Them Breathe. I was so thankful to see you follow the science and begin to meet in person again, but I was shocked when I arrived at the last meeting and was told by a sheriff's officer that my medical exemption would not be honored. Due to my medical condition and disability, I flew mask-free on a major airline during the height of the pandemic, but this building and board that my taxes make possible will not let me in, even when I offered to wait in a segregated area and stand behind plexiglass. We all know that speaking in person holds more weight and can have a wider reach as we see the nation paying attention to local meetings. It seems you do not want more eyes on what you are implementing here in these meetings. It is censoring, discriminating, and segregation to preclude the disabled, mentally ill, and chronically ill population from speaking in person at these meetings. And it is not based on state guidance, science, or safety, as many California counties around us are allowing speakers without masks. And as we heard from our own Wilma Wooten, we have the third lowest death rate in California. In fact, my safety was endangered when I stood outside to call in my comment because an angry man hurled death threats at me and was physically aggressive. The same officer who denied me entry ended up protecting me from that man. But if that threatening person would have had a weapon, I might not be alive today because I was not allowed to speak in the safety of this building. You may not care about our pleas, but you do care about re-election and liability. You wouldn't make me stand outside the building due to the color of my skin, gender, or sexual identity. And it is similarly unconscionable to practice this medical segregation. As a disabled woman, I have a right to the same access as my able-bodied peers. Disability rights are not overridden by a pandemic, especially now that all can be vaccinated if they choose. Also, our kids need mask choice right now to restore their smiles. I want to state that our young people should have safe indoor spaces and freedom to share their smiles, not easier access to drugs. I know that's our organization is all about choice, but our kids' mental health is in crisis. Substance abuse is skyrocketing, and we need you to act for them.
Thank you.
The next speaker is 7872. 7872. Please press *6 to unmute.
Hello, my name is Allie Hartman. I'm one of the co-founders of Reopen San Diego. You've heard from a few of our members already today, from rallies including mayors, senators, congressmen, to marches with parents that have successfully sued school districts to reopen, to giving out information to local businesses on how they can survive and help keep paying their employees so they don't lose their jobs and they can support their family. We've been doing a lot to try to help end this nightmare for the city of San Diego and our people. You, however, have done everything to destroy lives, from voting to obey Gavin Newsom's completely arbitrary and unscientific policies even after they no longer comply with CDC guidance, to supporting him extending his emergency powers when there is clearly no state of emergency. Nathan Fletcher, Nora Vargas, Joel Anderson, Jim Desmond, and Tara Lawson-Remer, you are our elected representatives in San Diego. It is imperative that you work first and foremost to protect our interests. And you are required by law to end the local state of emergency, the local health emergency, at the earliest possible time. Instead, most of you have voted not to end it, but to keep us locked down. I do recognize those of you on the board fighting for the people and businesses. The Constitution never mentioned a loss of a person's right due to a virus, and yet there were many bad viruses, including smallpox, that devastated the colonies and were far more deadly than our current virus, which has a 99.7% survival rate. The Founding Fathers were very intentional in preventing government overreach and thus didn't include a pandemic provision in the Constitution. In San Diego, COVID cases and deaths are way down. This is great news. It's time to end the state of emergency. You need to vote to end the local state of emergency. You need to do the right thing. And as other people have said, if you do not, then we are going to, we the people are going to either recall you or we're going to have to take action, because we're not going to allow this to go on anymore. We're not going to allow our kids' lives to be ruined. We're not going to allow our businesses to be shut down. It's time for you, the elected representatives, to do what we are asking.
Thank you. And that concludes public testimony on this item. Chair Fletcher.
Thank you. We are going to go to the recommendations. We have two recommendations. One is receive the update on the COVID response, and then the second is take other necessary actions. I will make a motion to approve the staff recommendations. Is there a second to that motion?
Second.
Okay, we have a motion by myself, a second by Vice Chair Vargas. Let me ask my colleagues if they have any comments on this item.
I have a question.
Supervisor Desmond.
Thank you, Mr. Chair. This is a question for Gary Johnson, and it's, I'm getting a lot of calls in my office, and I just want to try to get a clarification on masks, because everybody's asking me about masks, and if we can get a clarification, I guess what we have to be doing for masks now, or what the governor is having us do, and then what happens on June 15th. So I'm just trying to look for a clearer answer on that I can give my constituents on the mask evolution and update. And I know there's the issue with Cal OSHA, but hopefully, that'll muddy the waters. But I'm just kind of curious where we're at on the masks for now and then on June 15th.
Thanks for that question, Supervisor. It is a fairly complex matter with face coverings, predominantly because you have public guidance for face covering, as well as the workforce guidance. The public guidance coming from the California Department of Public Health, and the workforce guidance coming out of Cal OSHA, the Occupational Safety and Health Division for the state. And so what we know, and what I have been communicating with folks that I work with the reopening team at the Public Health Department at the state level, is that updated face covering guidance is going to be released prior to the 15th. Public face covering guidance will be released prior to the 15th. Currently, the guidance that is out is the guidance that we have to fall under per state guidelines. But again, their intent, as it's been indicated to me, is to better align the public guidance with CDC guidance, again, on or about the 15th. When it comes to the Cal OSHA guidance, the emergency temporary standards that's to protect our workforce with respect to COVID response, those updated ETSs were revised again to consider fully vaccinated employees. They went up for a vote on the 3rd of June, and it's currently those updated ETSs are under review, and we expect, again, those to be updated with the intent, again, to better align not only with the state's public face covering guidance, but also with the CDC. The bottom line, sir, is that on or about the 15th, we should be seeing updated face covering guidance coming from two different departments at the state level. That's my hope that will kind of clarify where we are going forward, and that guidance will also better align at the national level, CDC. So I hope that answers your question. If it does not, come back for a request.
Well, it's clear as, I guess, as clear as you can be right now. So new guidance is going to be coming out prior to June 15th. And well, how about just for now? I mean, people outside, they don't have to be wearing face masks. I guess we've still got a few days, whatever. I guess a week before June 15th. What's the mask covering criteria until June 15th for right now?
Supervisor, the current CDPH, or California Department of Public Health guidance for face coverings, is that in an outdoor setting, if you're fully vaccinated, you are not required to wear a face covering unless you're in a crowded outdoor event or space. So again, when you have too many people around you where you can't determine whether or not one is vaccinated or another, they're recommending or requiring us to wear face coverings. In the indoor setting, you're currently required to wear a face covering unless it's at your residence. And these are the areas that I believe are being looked at by CDPH to update prior to the 15th and the end of the blueprint for a safer economy. Does that answer the question, sir?
Yes, that does. All right. Well, thank you very much. Hopefully, June 15th is a magical day. It'll all be clear, hopefully, at that point in time. And hopefully everything's lined up with the CDC. I think that'd be a lot easier. But thank you very much, Gary. Appreciate it.
Thank you. Any other comments or questions from colleagues? All right, seeing none, we have a motion by myself, second by Vice Chair Vargas to approve the recommendations in the report. I'll ask clerk to please call the vote.
Thank you. Supervisor Anderson?
Aye.
Supervisor Lawson-Remer?
Aye.
Supervisor Desmond?
Aye.
Vice Chair Vargas?
Vargas, aye.
Chair Fletcher?
Fletcher, aye.
That motion passes unanimously with all supervisors being present and voting aye.
We're going to move to agenda item 3. This is our ARPA funding framework and strategy. I'm going to give the staff an opportunity to get set. As a board, what we're going to do is get a staff presentation walking through the recommendations that they have for us surrounding ARPA funding. Then we will go to public comment on this item. We will hear from any public speakers. And then as a board, we will come back. If you look at the board letter on this item, for the ARPA funding, what you'll see is a number of recommendations that are in the actual board letter. And what we will do when we come back as a board after public comment, which will come after staff presentation, is essentially take these 13 items or recommendations and do them one at a time. We will do one, we will discuss, we will debate, we will decide. If we have 4 votes for an item or more, 4 or 5, then those funds can be appropriated and they can begin moving forward. If we do not, then via 3 votes, if we have 3 votes for an item, then we will refer it to budget and it will become a part of our budget deliberation in a few weeks. But we will work through these in order with the board having the opportunity to give input and feedback on each item. So that's just a kind of run of where we're going to go. But we want to start with a staff presentation and then we will go to public comment. So at this time, I'll turn it over to staff for their presentation.
Thank you. Good afternoon, Chair Fletcher and Supervisors. I'm Andy Pease, Chief Operations Officer for HHSA. Today's item is to obtain approval for the recommended framework and the use of the American Rescue Plan Act, local relief funds, what we call ARPA, establish the corresponding appropriations, as you just indicated, and to establish a trust fund for holding these dollars. Now, to help put things in context, let's take a brief walk down memory lane. On March 11th, President Biden signed into law the American Rescue Plan Act of 2021, which established funding to provide support to the state, local, and tribal nations for relief in addressing the continued impact of the COVID-19 pandemic. At the request of this board, the county hosted 5 virtual community work groups in mid-March. They gave the public the opportunity to provide input and feedback on the potential use of anticipated funds under ARPA. Close to 400 individuals from across the county participated, and arrangements were made to provide interpretation in Arabic, Chinese, Filipino, Spanish, and Vietnamese. On April 6th, county staff presented a proposed framework to the board, taking the community input into consideration, and the board approved an in-concept ARPA funding framework. It was called in concept as the county had yet to receive the federal guidelines with necessary details on the use of these funds. Staff were asked to return to the board for a final framework once the guidelines were published, and on May 17th, the Department of Treasury issued the interim final rule or final guidelines to implement ARPA. During that same week that the guidelines were published, each board office submitted a memo to the CAO with their list of priorities for consideration when allocating the dollars. And then finally, on May 19th, the county received $324.2 million of ARPA dollars, which is the first of 2 payments to the county of its $648.4 million allocation, and we anticipate receiving the remaining allocation around May of 2022. And so here we are today to seek approval for the recommended framework on the use of these funds. Just a reminder, the general use of these funds include responding to the public health emergency, addressing negative economic impacts, replacing lost revenue, providing premium pay or hazard pay for essential workers, and investing in infrastructure, including water, sewer, and broadband. Now, as I noted, the U.S. Treasury issued interim guidelines in late May. The key word is interim. They have yet to be finalized. It's currently under public review and comment. That means there could be revisions to the guidelines and clarification in the use of these funds. Once the final guidelines are released, probably sometime in July, if there are changes that require modifications to the framework, staff will bring it back to the board. So when drafting the recommended framework, we considered the following: the input provided by the public from the community work groups and from advocates, the ARPA in-concept framework approved by your board, the memos that this board submitted on their priorities. I will note that there were certain ARPA submitted items from the board that were not included today, but will be included in change letter if there had already been a previous referral to budget. We considered the U.S. Treasury guidelines. We looked at the time frame on the use of these funds, which is actually through December 31st of 2026, as the U.S. Treasury defines spent as obligated for December of 2024 and fully expensed by December of 2026. That's 5.5 years. We considered the need to ensure funding is available to cover our county public health COVID-19 response costs, the need to cover the administrative costs to implement these programs. We looked at the sustainability of recommended programs beyond the COVID pandemic and the expenditures of ARPA funds. We recognized the necessity to incorporate an equity lens to support the most vulnerable individuals and communities in San Diego County when allocating the funds. We considered the Legislative Analyst's Office advice on guiding principles when developing a plan, with a priority in identifying gaps and maximizing the long-term benefits. And finally, we recognize that there will be significant additional funding coming to the county from the state and federal governments. The state has prioritized billions of dollars for programs contained within our framework, areas such as childcare and direct payments to individuals and families, homeless services, and behavioral health services. In addition, the federal government is likely to pass legislation allocating billions and potentially trillions for investments in infrastructure, including broadband. So if significant additional federal or state funding is received by the county, or as I stated, if there are changes to the interim final guidelines that materially impacts the recommended framework, staff will return to the board as appropriate to suggest changes to the framework and the use of these funds. So let's take a look at the components. Overall, the framework allocates $653.5 million of ARPA funds. That's our allocation as well as assumed interest earnings, and it's in 11 components. The component categories and the dollar amounts for each component remains the same as the approved in-concept framework from April, except for $4 million, which is being shifted from premium pay to COVID response efforts. The reduction in premium pay is because the in-concept allocation of $40 million for hazard pay included $4 million for stipend payments to staff who teleworked. However, under the ARPA guidelines, telework is not a permissible use of ARPA funds for hazard pay, so this was reduced and shifted to COVID response efforts. You'll note that in recommendation 3 in today's item is to cover the $4 million of telework stipends using prior year available general fund balance. Details on the breakdown of the various components can be found in the board letter, but I'll briefly go over them at a very high level. The first is the COVID prior and ongoing costs at $311.5 million. This covers the range of costs for our response efforts from T3 to vaccination efforts, PPE, supplies, outreach, media, public health, administrative costs. It also includes maintaining $75 million for COVID response efforts past September if needed. There are a couple factors that influence the prior and ongoing response efforts component that we will need to monitor and adjust accordingly. First is the trend of the virus and the efforts we'll need to make in the coming weeks and months to deal with the pandemic. We may find that as we get in front of the pandemic and we achieve herd immunity, that we may not need as much funding for this component down the road. The other factor is the timing and the use of the funds. We originally assumed we could use ARPA to cover costs earlier than March of 2021, specifically for January and February, and this component included ARPA set aside for these costs. If we can't use ARPA or other funding for that, then we're going to need to rely on general fund balance for this time period. We are currently looking at mitigation strategies as well as potentially challenging the U.S. Treasury on the guidelines that set the coverage period beginning at March 2021, so more to come in that area. On the next one for premium pay, I already mentioned that hazard pay for county essential workers is set at $36 million. For mental health, we have $30 million. Behavioral health needs have been identified as a high priority, especially for children and youth of all ages. Behavioral health will work with schools and First 5 San Diego Child Welfare Services, our community members and other stakeholders to develop and implement a plan to address the needs of students, children from 0 to 5 years of age, teenagers, transitional age youth, and their families. Next is homeless services for $85 million. Many in San Diego County are currently experiencing or at risk of homelessness. Funds will be invested in shelter housing resources, including acquisition of facilities, wraparound and supportive services, housing vouchers, local rent subsidy programs, and housing programs prioritizing the LGBTQ population. Our newly formed Department of Equitable Communities and Homeless Solutions will lead in developing a plan on the specific use of these funds in collaboration with other county departments. Food assistance is at $20 million. It was one of the top priorities that resulted from the community work groups. Incorporating their feedback and the board priorities, the majority of the funding is earmarked for food distribution programs, such as food banks and other food delivery programs, as well as nutrition incentive programs for low-income individuals and families. For senior and youth services, we have $10 million. The funds will be used to provide no-cost transportation for seniors and youth, such as transportation vouchers, as well as be invested toward exploring career pathways for foster youth by augmenting child welfare services, independent living skill programs and such, and providing funding for the San Pasqual Academy Promise. In addition, a one-time grant program for youth sports and youth camp tuition in partnership with foundations and other community agencies will be developed. Childcare we have at $10 million. As the community and regions reopen, there is significant need for access to childcare. The dollars within this component will be used to provide vouchers to families in need, grants to child care providers, and investments in child care facilities, including looking at the County Operations Center for on-site child care. We have direct payment stimulus payments at $40 million. With the stay-at-home order to be lifted in the coming weeks, the current COVID-19 income stipend program is recommended to end at June 30th, as we see that winding down. And the direct stimulus payment component is being recommended to support populations disproportionately impacted by COVID-19. A pilot program for cash transfers for families at risk of entry into foster care, and stimulus payments for low-income immigrants not eligible for federal or state benefits will be developed. Each of these programs will require additional evaluation to ensure that design elements are allowable under ARPA and are returned to the board for follow-up. For legal services, we have $15 million, and these funds will be used for tenants facing eviction to provide services which supports the most vulnerable tenants in San Diego. The funding is intended to help prevent eviction through community outreach and education and connecting tenants who may otherwise not have access to or be able to afford legal representation to existing resources that will help them understand their legal rights. Small business and nonprofit stimulus payments at $50 million. The Small Business and Nonprofit Stimulus Program has been a helpful resource for the community during the COVID pandemic. It's recommended that $31 million in ARPA funding be used under the existing program parameters, distributed through the prior board-approved equity methodology. Additionally, funds would be invested in restaurant fee waivers, special event fee waivers, rental assistance for small landlords, and for $5 million to go to the board's community enhancement program, specifically to address the needs for arts and culture. For infrastructure, we would recommend allocating $46 million in funds for our, infrastructure investments in the unincorporated area, including stormwater, water, sewer, broadband. Also, funds are recommended for EV replacement and infrastructure and for local independent fire districts. It's recommended that staff return to the board with options for use of these funds, such as the need for community needs assessments or specific projects in these categories. For rental assistance, no ARPA funds are recommended under the rental assistance component, as there is already significant federal and state funding for these programs. So in closing, today's item requests the board approve the recommended ARPA funding framework and establish appropriations for the various components totaling $653.5 million, as well as establish appropriations for telework stipends totaling $4 million, and to establish a trust fund for the ARPA funds. Once the framework is finalized, staff will work on the implementation of these components, incorporating input from this board and various stakeholders. Many of the components just presented will require staff to factor in future state and federal funding when developing plans for areas of investment. Some programs will require additional evaluation to ensure design elements are allowable, and we will return to the board for follow-up actions as warranted. Chair and Supervisors, this concludes my presentation.
Thank you, Andy. And I want to thank everyone. There's been considerable work, which Andy outlined at the beginning, the public engagement, the multiple community forums, where we heard from folks the priorities and needs of the community, obviously individual board offices. There is no amount of money out there that could meet everyone's need to do everything that they would like done. But I think what we have before us is a wide-ranging and very balanced approach. I also just want to reiterate that there will be state and federal funds that come down for various components. And so when we adopt this, staff has the flexibility to come back to us and say, hey, you adopted this for this much. We got funding here to do the same thing. And then we as a board can consider what we would like to do with those funds, either commit them to the same purpose or perhaps do something else. And to reiterate the point that half of these funds will not even arrive in the county for a full year from now. And so this really is the beginning of an ongoing process where we will continue to assess and monitor what we're doing and how we're moving forward. And so with that, let me go to our public speakers, and then if it's okay with the board, we will begin with the first recommendation and work our way through them. But let's go first to the public speakers.
Thank you, Chair Fletcher. We have 97 requests to speak on this item. There are 6 speakers in person and 91 individuals that have requested to speak by phone. Also note for the record that we received 326 e-comments on this item. Any members of the public that requested to speak on this item by phone, please dial into the conference line now using the instructions that were provided to you. We will begin with the in-person speakers, and we'll start with the group presentation in opposition, and that group includes Tom Kelly, Virginia Morrison, and Tim Parker. If you're present, you may come to the podium, and the group will have 10 minutes to address the board. I'll ask each individual to please state your name for the audio record, and please self-regulate your time using the timer in the podium.
I'm the CEO and one of the co-owners of Second Chance Beer Company, as well as the San Diego Brewers Guild president. And first, I just want to say thank you to all of you. After having watched this process for several hours, really like the service that you do, and your patience is to be commended. I'd just be curious to know who here loves craft beer? You boys better raise your hand, right? Yeah, a lot of us do. Yay. So what we're here to talk about is to please ask for the help that we requested through a letter submitted to the Board of Supervisors back in March, which is specifically that $3.82 million be allocated directly to San Diego Brewers Guild members. Second Chance has a 12,000 square foot tasting room in Carmel Mountain Ranch community, as well as a 1,800 square foot tasting room in North Park. With me today is also Tom Kiley from Thorn Brewing and Tim Parker from Chula Vista Brewery. San Diego craft breweries need your help. We're asking you specifically to address the negative economic impact that our members have had, which is certainly within the scope of the, I'm going to use that ARPA acronym. And for our members, the pandemic is far from over. So I would like to speak to you a bit generally about kind of the ongoing struggles of San Diego breweries and some of the effects of 2020, and then specifically about the experience of Second Chance Beer Company. First, I want to clear up a misconception, though. You see a lot of news headlines, especially last year and continuing into this year, about how much alcohol consumption has increased. What I can tell you specifically about craft beer is consumption was actually flat from 2019 to 2020. And while we're hoping, really hoping to see an increase in tasting room visits this summer, I can tell you from my brewery that has not really materialized yet. What had changed was how and where people were drinking. So they were drinking from package that we bought at Costco and grocery stores, and if we were lucky, buying it directly from us breweries. But what we saw, and what you know to be true because we were shut down about, 85% of last year, was people were not able to come onto site and drink pints at our tasting rooms. That's significant because that line of revenue is about 7 to 8 times more profitable for us. And when we have to sell our beer to a distributor who then resells it to a retailer, those two other lines of business take about 30% each. So you can do the math. The numbers just don't pair out. And what we've tried to emphasize, and I think has been lost, is that craft breweries, while we do have some similarities with restaurants and other hospitality businesses, we are manufacturers. That means we have significantly higher costs, the vast majority of which are fixed. For example, craft breweries in San Diego saw 20% reduction. This is data provided by the Brewers Association. And we're still seeing costs of all of our packaging materials significantly increase. Pactex, cans, aluminum. At Second Chance Beer Company, we're seeing at best 65% of our tasting room business returning, and that's on a weekend. We are, at least in Carmel Mountain, in amongst a bunch of light industrial commercial businesses, and they haven't returned. Our rent on that particular place is $15,000 per month, and we are still facing a situation where we owe back rent from last year and earlier this year. So this money would be substantially significant in helping us to cover some of those costs. And while we had, we are back to, I should say, close levels of pre-pandemic as far as employment. We had last fall 5 of our 16 team members leave all at once because they could no longer afford to be in San Diego. Right now, we have about 3 positions I'd love to hire for, but I can't afford to without some additional help. So I will let both Tom and Tim speak, and I'll just say in closing that please save San Diego craft breweries and the chubby unicorns.
Tom Kiley, Thorn Brewing Company. Thank you very much for your time. Supervisor Fletcher, we actually had the privilege of speaking with someone from your team about a week or 2 ago about some of these concerns, so we appreciate the opportunity to talk to everybody else as well. To highlight on some of the things that Virginia talked about, I kind of wanted to give a few examples of how difficult it's been for Thorn Brewing ourselves. So we started in 2012 as a brew pub in North Park. We were the first brewery in North Park. And then we opened a production brewery in Barrio Logan in 2017. So we are very similar to Second Chance, about 12,000 square feet, very similar in size, and very similar geographical footprints where we sell our beer. We were a growing brewery going into COVID, and we made $550,000 less than we did the year prior, from 2020 to 2019. We got about $320,000 in PPP, which I'm very grateful for, but that's still $230,000 short. But that's just income. To what Virginia just mentioned, my expenses shot through the roof. I get paid whether we sell 1 case or 100 cases. They don't really have a choice, unless we want to break employment law, which we don't. Thorn Brewing respects the law. Let that be on the record. Cans, there's been discussion about aluminum shortages. When we get a painted can, when you go to the store and you see a painted can, that can cost us 10 cents. When we buy a blank can, that costs us 16 cents because we can't just buy it directly from the people that make it and paint it. It has to go to a third party and then go to us. And then I can't legally sell a blank can. I have to buy a label and apply the label on. So I went from 9 cents a can to 25 cents a can. When you guys see a $10 6-pack in the store, that means they're selling the pack for $40 because there's 4 of them. I sell that to my distributor for $19.60. They get 30%, the store gets 30%. So the difference between a 9-cent can and a 25-cent can is 16 cents per can, 24 cans in a pack. We're talking about $4 out of a 1960. We're talking like 20 to 30% of my packaging costs, significantly increase. And because nobody was able to consume draft because restaurants were closed, almost everything I had to do was in package. And the people that were shopping in during COVID to buy beer were buying it from grocery stores. I don't know if you guys have been to really used an eye when you go into the grocery store, but you're going to see way more Bud, Miller, Coors than you are compared to your local bottle shops. That's because Bud Miller and Coors create the shelf sets at these stores. It's much harder for us to get in there and sell beer. So where we do really well is in the local restaurants, because that's a lower barrier of entry to us. So all those places were taken away, and I blame nobody in this room or even outside it for that. It's what happened. But it is a reality of running the business that is a hurdle that we had to face. So I do want to save a little time for Tim Parker over here, the veteran. Thank you very much for your time, guys. I appreciate it, and I hope you consider our request. Thank you.
Thank you. I'm going to keep it short. So my name is Timothy Parker. I'm the owner of Chula Vista Brewery. I'm actually the only black-owned brewery in San Diego County, and I'm a veteran. I'm a Navy chief, 20 years, 6 days, and I know Fletcher will know that I need to count those 6 days. But yeah, so this shutdown has greatly affected us. I think we lost $342,000 over the course of COVID. That's how much we lost in income. Like he said, we had to transition the cans. For small breweries, we are mom and pop. It's just me and my wife, so we had to transition. That was a huge loss. And we actually, whatever money we got for grants actually went right back. It was already gone before it even came into paying rent or keeping payroll. We was always running behind. So basically, it was already lost. So any help that you guys can provide us, sorry, ladies as well, would be greatly appreciated. Like I said, it's been very hard. You know, with the shutdown, we are a brewery, a manufacturer, so we just had beer. So when the shutdown happened, we wasn't able to stay open with the food requirement. So that greatly impacted us as well, where we like 150 breweries, you got to think a lot of us is just like me, where it was direct to consumer, and that was just taken away. While I support everything you guys did, we still are trying to come back, and now I want to focus on how we continue to move back into the norm. And I think you guys providing that help will help us move back into that normal and keep craft beer as the #1 craft capital in the world. So thank you so much. I give you 20 seconds of your time back.
Thank you. We'll now move on to the individual speakers in favor. I'd like to invite forward Paul Downey, Louise Monton Adams, and Fred Cox. If I've called your name, if you could please line up in the hallway outside the board chamber. And you may come forward in any order. I'll ask you to please state your name for the audio record, and you'll have 2 minutes to address the board.
Good afternoon, Board of Supervisors. My name is Luis Montella Adams, pronouns he, him, his, and on behalf of the San Diego LGBT Community Center, I'm here to urge the Board of Supervisors to approve item number 3. As a member of the Invest in San Diego Families Coalition, we support the American Rescue Plan Act funds used for no-cost tenant education, direct stimulus payments, and hazard pay for county employees who have been on the front lines of the COVID response. The center also specifically supports allocating $5 million from Arpa funding to LGBTQ homelessness services and housing. As a health and human services provider, we have seen the inequities within our communities of color, as well as our unsheltered and incarcerated individuals. We are now being hit hardest by the pandemic. San Diego is amid a housing crisis, and our LGBTQ community is significantly impacted. 40% of unsheltered youth identify as LGBTQ, and 1 in 5 transgender adults report experiencing homelessness within the past 12 months. There's a critical need to increase funding to better serve the specific needs of the LGBTQ community, and we believe allocating $5 million from ARPA will be an important investment. Once approved, we look forward to working with the newly formed Department of Equitable Communities and Homelessness Solutions and developing a plan for specific use of the funds to best serve the LGBTQ community. Thank you for your time.
Thank you. Next speaker, please.
Chairperson Fletcher and Honorable Board of Supervisors, good afternoon. My name is Fred Cox, and I'm the Fire Chief of the Rancho Santa Fe Fire Protection District. I'm standing here today to represent the 13 fire protection districts within San Diego County to seek assistance from the American Rescue Plan Act of 2021. While each district has a different story, I'd like to share ours. When COVID hit, we incurred the typical operational costs such as purchasing PPE, sanitizing equipment, and other protective measures. The Families First Coronavirus Response Act and its Senate Bill 95 were also enacted, which required employers to provide additional paid leave for our employees. This was an unreimbursed mandate, and we had to pick up the cost for overtime. We had 7 of our firefighters contract COVID during their course of work. One of them was Fire Captain Chris Mertz. When Chris got sick, I regularly checked in with him. On day 6, he was admitted to the hospital. I still have the text on my phone telling me he was fighting hard so he could return home to his family. On day 10, Chris was placed on a ventilator. That was our last communication. On January 21st, after 10 days being on a ventilator, Chris lost his fight and died from complications of COVID-19. Chris started on my crew 31 years ago. He was 54 years old. The point being, fire district personnel have served tirelessly on the front line as responders working side by side with our neighboring cities protecting the public during this ongoing pandemic. The only difference is cities have had access to 2 rounds of COVID relief, while fire districts have received none. The cost to our agency will be north of $600,000, costs which would have not been incurred if COVID did not happen. We are all in this together. I'm asking for your support with Arpa funds to make fire districts whole so we continue to provide the high level of service that the residents of San Diego expect and deserve. Thank you.
Next speaker, please. Looking for last call for Paul Downey. All right, with that, we will begin with we'll hear from those that requested to speak by phone. We'll be calling speakers by the last 4 digits of your phone number. You'll hear a notification that your call has been unmuted. You will then need to press *6 to unmute your phone. We'll ask you to please state your name for the audio record, and I'll remind the callers that they should mute their TV or live video stream before they begin speaking. And if you could please identify the first caller.
Our first caller is 6862. 6862. Please press *6 to unmute.
Hi. My name is Dr. Greg Robinson. I'm a sociologist out at Grossmont College. I'm on the County Board of Education and also Vice President of AFT Guild here in San Diego. But right now, I don't want to speak for those organizations. I want to speak largely as a sociologist in support both of this larger initiative, this issue 3, but specifically in regards to Superintendent Lawson Reamer's innovation in foster care, and in general, those supports for foster youth. Those of us in education know the most challenging responsibility we have in education is educating foster youth. They come with such a pile of disadvantages. We know they come from at-risk families. They face poverty, racism. Many are homeless. They come from crowded living conditions. And what Supervisor Lawson Reamer has proposed is to treat at a core one of the most important reasons for that. And that is the economic instability that resonates both through family structure and their educational outcomes. I can't emphasize more strongly how important this kind of effort is to truly address the core reason for these families' needs. And what I'm also impressed by as a sociologist is her provision for a rigorous evaluation of that outcome. Anytime you have a policy, it should be looked at with the most objectivized possible. And she has provided for random assignment for control groups in a way that we so seldom see in public policies. And for that reason alone, let alone her attempt to help these very vulnerable youth, it demands support. So thank you so much for everything you're doing. And thank you in particularly to Supervisor Lawson-Remer and for her efforts around foster youth.
Thank you. Our next speaker is 5441. 5441.
5441.
Sí, buenas tardes.
Buenas tardes.
Soy Delfina Álvarez. Vivo en San Diego, en City Heights. Pertenezco al Distrito 9 del señor Fletcher y soy miembro de la iniciativa de la obesidad infantil en San Diego.
Un segundito, por favor, señora. ¿Me repite otra vez su nombre, por favor?
Delfina Álvarez.
Gracias. Good afternoon. My name is Delfina Alvarez. I live in City Heights. I belong to Supervisor Fletcher's district. ¿Y el nombre de la organización?
Iniciativa de la obesidad infantil de San Diego.
And I belong to the Initiative for Childhood Obesity in San Diego.
Y yo les pido a todos ustedes que por favor apoyen con más dinero al programa Más Fresco para que toda nuestra comunidad pueda tener acceso a comida saludable.
And I ask for your support for additional funds for the program that allows us to have fresh food in our homes.
Desafortunadamente, este excelente programa solo se limita a las personas que reciben CalFresh y necesitamos de manera urgente que llegue a todas las personas que padecen hambre y pobreza, sin importar si califican o no a algún tipo de programa.
Unfortunately, right now, these types of funds are only given to those that qualify for CalFresh. However, we ask that they be expanded to anyone despite their ability to qualify for those programs.
Si los supervisores expanden el programa a más tiendas, en las clínicas, en los hospitales, más gente tendrá acceso a comida y se eliminará el hambre de una manera justa y con equidad.
If the supervisors were to expand this to different stores, clinics, hospitals, more people would have access to fresh foods and hunger would end and it would help our communities.
Si nuestras comunidades tienen más acceso a comida saludable, nos evitaremos una catástrofe en salud pública para nuestro futuro inmediato. Gracias.
If people had access to healthier food, we could avoid a future catastrophe of public health. Thank you.
Thank you. Our next speaker is 8046. 8046. Please press *6 to unmute.
Good afternoon, supervisors. This is Noah Harris, policy advocate with Climate Action Campaign. We applaud the proposed $3 million allocation of Arpa funds for youth opportunity passes, no-cost transit passes for youth 24 and under, and thank Supervisor Vargas and staff for their leadership on this bold policy, as well as the local organizations and community members who have been advocating for YOP for years. Transit-dependent youth and seniors living in communities of concern have been disproportionately impacted by the COVID-19 pandemic. YOP is a critical investment in our youth and a key investment in the region's economic recovery and stimulus by increasing access to everything from jobs, internships, and schools to shops, medical care, and parks. Plus, we know that young transit riders become adult riders, and as such, this investment is a great strategy for MTS and NCTV to recover from the significant ridership losses seen over the course of the pandemic, which is key to reducing emissions from the transportation sector. Thank you for supporting YOP and helping to build a more sustainable, equitable transportation future.
Thank you. Our next speaker is 0109. 0109. Please press *6 to unmute. 0109. Please press *6 to unmute. We'll come back. Our next speaker is 6872. 6872. Please press *6 to unmute.
Hi, my name is Grace Martinez, and I'm the director of San Diego ACE. I'm calling in support of our ISDF priorities and also, the partners who've been pushing to make sure that people who have been disproportionately impacted by the pandemic have an equitable recovery. I'm calling in support of hazard pay for many of our county workers who have been the frontline workers and have put themselves at risk to make sure that the county continues working. Direct stimulus payments for undocumented families throughout San Diego, and specifically also the expansion and investment in tenant education, counseling, and legal resources. And I'd like to really thank Supervisor Chair Lawson-Remer for being the leader in this to make sure that there's committed $15 million really for the next 3 years, investing in expanding legal resources for tenants throughout San Diego County, making sure that for all these protections and rights that tenants have, that they don't matter unless there's real education and commitment to make sure that people know about what their rights are and also have a place to go. And we urge, all supervisors, and thank you to the supervisors who have made this a priority in their budget demands. But please, we urge you to support the ISDF demands, but also really consider putting $15 million to make sure there's real tenant protections, tenant counseling, tenant resources, and education so that everyone can know about what their rights are and have a place to go when their rights have been violated. Thank you very much.
Thank you. Our next speaker is 5187. 5187, please press *6 to unmute.
Hi, good afternoon. My name is Chris Olson, Chief of Staff at Jewish Family Services San Diego, and we are calling in support of the ARPA recommendations for item 3, and specifically Supervisor Lawson-Remer's proposal to allocate funds for the Foster Youth Conditional Cash Transfer Program. There is a significant body of research indicating that basic income and cash transfer programs are highly effective at preventing child abuse and neglect, improving health outcomes such as vaccination rates and visits to healthcare, and promoting regular school attendance by children, including and also improving child nutrition. This program aims to prevent youth from entering foster care, entering the system by providing economic resources necessary for families to care for their children. JFS thanks you all for your commitment to youth and families, and we urge support of item 3. Thank you.
Thank you. Our next speaker is 8429. 8429, please press *6 to unmute. 8429, please press *6 to unmute.
Good afternoon, Board of Supervisors. My name is Christopher Hines, and I am calling I've been employed with the County of San Diego as a protective services worker in the CWS agency for 2 years, and I'm part of the SEIU and the Invest in San Diego Families Coalition. And so today I just wanted to speak a little bit about my experience and my coworkers throughout the pandemic and our work experience. And so throughout the pandemic, myself and my other coworkers have been working tirelessly to ensure the safety and well-being of vulnerable children here in San Diego County. We are in hospitals, COVID wards, jails, and homes throughout the county where some of the families are positive for COVID. As a worker in the investigations unit, we do not have the ability to assess risk and safety through video chat, as we cannot assess the true safety of the child using that method. So it requires an in-person response despite the family's COVID status. Additionally, as an emergency response social worker, we are having to respond to true crises where those situations themselves are hazardous, depending on whether or not there's weapons involved and the high emotions that are involved with some of the decisions that are made to protect children. I myself fell ill to COVID in June of 2020 and was able to safely recover. Once I recovered and was medically cleared to return to work, I was right back out in the field, continuing to ensure that children were safe and families were given resources to ensure they were stable and living well. When I returned to work after being ill from COVID, there were a significant amount of workers in my region out due to circumstances surrounding the pandemic, which left me and others at the agency to take on a significant increase in child abuse referrals, where we were seeing more severe abuse in the referrals we were receiving. It has been a tiring year, but my coworkers and I have continued to give our everything to ensure that children in San Diego County are safe and living well. And with that, we want to ask that you do finish the job and fund hazard pay for county employees with ARPA funds. So please vote yes on this item and vote yes for county employees. Thank you.
Thank you. Our next speaker is 9358. 9358, please press *6 to unmute. 9358, please press *6 to unmute.
Hi, my name is Angelina Corsani from the Center on Policy Initiatives and the Invest in San Diego Families Coalition. I'm calling today in support of the ARPA and stimulus funding framework being put forward, and in particular to urge the board to support the following critical investments. First, $40 million to support hazard pay for county employees on the front lines of COVID response. During this unprecedented pandemic, the responsibility of ensuring the health and safety of our communities has been upheld by our local governments. How county workers have been sacrificing seeing their families and loved ones, putting themselves at risk, and even putting their lives on the line in order to serve our communities in San Diego. These workers should be compensated for their absolutely essential work. $15 million to support no-cost tenant education, counseling, and legal services for renters across the San Diego region. The pandemic has made it clearer than ever that housing is a form of healthcare. Yet in the San Diego region, we have few resources to support the significant portion of our population who are renters. All too often, tenants facing eviction are displaced from their homes despite having legal protections. By providing legal assistance to renters facing eviction, the county can help stabilize households and address the issue of rising homelessness. This allocation is critical now and will continue to be critical in the future to ensure our communities understand and have access to their rights as tenants. Lastly, this framework allocates $40 million for direct stimulus payments. We ask that a minimum of $10 million, if not more, be set aside specifically for low-income immigrant communities who have been excluded from most state and federal aid. Every individual and family in San Diego has felt the impacts of this pandemic, but not everyone has received the same forms of support. It is essential that our county prioritizes individuals in the distribution of our local stimulus funds. I urge the board to vote in support of this framework and these items that will provide our communities with much needed assistance. Thank you for your time and your efforts.
Thank you. Our next speaker is 9665. 9665, please press *6 to unmute. 9665, please press *6 to unmute. We'll come back. Our next speaker is 1898. 1898, please press *6 to unmute.
Hi, my name is Ariana. I'm a resident of District 4, and I'm calling on behalf of Mid-City CAN and Invest in San Diego Families Coalition. And I urge you to vote in support of the following items for the ARPA framework, which include $40 million for the hazard pay for county employees, $15 million to support no-cost tenant education, counseling, and legal services for renters across San Diego and the region, $40 million to provide direct stimulus payments for those that have been impacted by COVID-19, and then $3 million for youth opportunity passes. We need to make sure that we are actually intentionally supporting young people and their families. Thank you for your time and your consideration.
Thank you. Our next speaker is 0109. 0109, please press *6 to unmute. 0109.
Hi, my name is Maria Mingalone, Executive Director of Oceanside Museum of Art. I want to first thank Supervisor Jim Desmond for his support of the arts of Oceanside Museum of Art and the Oceanside California Cultural District, among the many other cultural assets in our district. I am calling in support of the proposed $5 million ARPA funds for arts and culture. The creative sector is among the most impacted industries in the state, and as an industry, the arts are uniquely positioned to positively impact both the social and the economic fabric of our community. The arts are uplifting and especially important really at this time. They're a means to heal and a way for people to connect. And the arts also build destination status for our cities by bringing visitors from near and far to visit cultural venues and to experience the arts. In this way, the arts also make economic sense. When art patrons come to town to see a play, go to the theater or the museum, they also go to restaurants, they stop for drinks, they get gas, and they visit other businesses. This ancillary spending amounts to over $100 billion annually nationwide, and this helps to support local businesses who also need that now. A recent study by the San Diego Regional EDC, which includes non and for-profit businesses, states that the creative economy is an $11.1 billion industry employing over 100,000 people in San Diego County. So when you fund the arts, not only are you helping to support a healthy and a thriving community, you're also supporting non-for-profit cultural organizations. These are businesses too, and I know because I run one, and you also support local business owners who benefit from our cultural patrons. So let's hope the pandemic is in the rearview mirror, and please support the arts as we rebuild. Thank you very much.
Thank you. Our next speaker is 1795. 1795, please press *6 to unmute. *1795, please press *6 to unmute. All right, we'll come back. Our next speaker is 1627. 1627, please press *6 to unmute.
Good afternoon. I am UDW Executive Director Doug Moore. As you know, our union represents tens of thousands of family child care providers and IHSS providers in San Diego County. And on behalf of our members and the San Diego Serve, we ask to approve the proposed Arpa funds for child care. We also ask that you amend this proposal to include telehealth mental health care for special populations like IHSS clients, as proposed by Supervisor Tara Lawson-Remer in her priorities memo. Mental health care is critical for all of us to thrive, but the seniors and people with abilities who can't easily leave their homes, this vital care is inaccessible. A telehealth program to address mental health concerns for these San Diegos will benefit all other aspects of their care. I strongly urge you to amend the proposal to include telehealth mental care. Thank you.
Thank you. Our next speaker is 7568. 7568, please press *6 to unmute. 7568, please press *6 to unmute. We'll come back. Our next speaker is 5870. 5870, please press *6 to unmute.
Yes, my name is Jim Bleisner, City Heights resident, District 4, former adjunct faculty in urban economics and design at UCSD and former director of the City County Reinvestment Task Force. A major research project we did was looking at the informal economy in City Heights. It's the largest employer in City Heights, and artists are a major part of it. In fact, it's a major element in the informal economy countywide, a subclass, an economic subclass, if you will. They need support to enter the economic mainstream. These funds could help do that. I encourage your yes vote for the $5 million allocation to arts and culture and commend Supervisors Fletcher and Vargas for including it. I also strongly encourage the formation of a county arts commission as a part of a comprehensive economic development strategy. And thank you very much for your time and your work.
Thank you. Our next speaker is 7554. 7554, please press *6 to unmute.
Thank you, Chair Fletcher and esteemed Board of Supervisors. My name is Erin Hogeboom. I'm Senior Director of San Diego for Every Child. We are a countywide initiative of organizations and individuals committed to cutting the experience of child poverty across our region. In the spirit of our mission and as co-lead of the Early Care and Education Advocacy Coalition, we fully support the inclusion of comprehensive funding for child care within ARPA funding. Without reliable, quality, and accessible child care, parents cannot return to work, which continues and exacerbates food and housing insecurity, mental health crises, and the experience of child poverty. facility. To the extent that it is possible, we also ask that child care providers be specifically and additionally considered within small business and mental health funding allocations as well, given that they are the essential workers to our essential workers and oftentimes the first to come into contact and respond to child and family trauma. Additionally, San Diego for Every Child would like to demonstrate support for Supervisor Lawson Reamer's proposal to allocate $15 million for a basic income program to facilitate innovations in foster care. There is a significant body of research indicating that basic income and cash transfer programs are highly effective at preventing child abuse and neglect, improving health outcomes, promoting regular school attendance, and improving child nutrition. This program aims to prevent children from entering the system by providing financial resources necessary for families during this continued economic crisis. Thank you for your consideration for both of these critical proposals.
Thank you. Our next speaker is 2039. 2039, please press *6 to unmute. 2039, please press *6 to unmute. We'll come back. Our next speaker is 6789. 6789, please press *6 to unmute. 6789, please press *6 to unmute.
Hello? Hello?
No, we can hear you.
Hi, my name is Patricia Mendoza, and I'm a member of ACE and ISDF. Please support Super Board members. Please support the ISDF priorities, investing $15 million in the more legal services and education for tenants. And I can only tell you from experience, if we didn't have this legal aid helping us tenants right now and advising us what to do with all of these eviction notices and 60-day tenancy to quit, I wouldn't know where I would be right now. So I'm really grateful and thankful that legal aid has been there for a bunch of us. But we also do need, have free and dedicated legal counseling for undocumented tenants as well when they need to go to court. Always being, if we're well represented, we'll have better chances. So I just really want to encourage you to please support this. It really makes my heart happy that you guys are thinking of us. Thank you. Thank you so much. And thank you so much for your time. Bye-bye.
Thank you. Our next speaker is 7957. 7957, please press *6 to unmute.
7957, por favor,
Buenas,
okay.
Buenas tardes. Mi nombre es Delia Contreras y mi supervisor de área es el señor Fletcher. Estoy muy emocionada de estar aquí porque quiero hablar de lo que es las más frescas, ¿verdad? Este programa es un excelente programa, como he escuchado anteriormente, y yo quiero decir a mi supervisor que, por favor, a todos los supervisores, ¿verdad?, que nos ayuden a aprobar que pase para más comunidad este programa, ¿verdad? Yo como comunidad de City Heights, yo soy muy chilletas, caramba. Yo como comunidad de City Heights, a mí me afecta que yo, siendo una buena ciudadana y haber pagado toda mi vida mis impuestos, no puedo calificar para comer comida saludable. Y así como yo, esta pandemia nos afectó a muchísima gente, ¿verdad? Estamos viviendo en pobreza. Ojalá que nuestro supervisor y todos ustedes, los supervisores, por quienes votamos, nuestras comunidades, aprueben este programa, que se extienda más a clínicas, a tiendas, a hospitales, para que sea una alimentación justa y saludable para todos. Y hay más de 2,000 personas que reciben ayuda mensualmente de $50 a $100 para comer más saludable. A mí me gustaría que apoyaran este programa para todos en general, para que sea una equidad justa.
Muy bien.
Muchas gracias.
Un momentito, por favor. My name is Delia Contreras, and I belong to the county with Mr. Fletcher. And I am just calling for CalFresh. I would like you to approve that program for the community. I live in City Heights, and that really does affect me. I'm a very good citizen. I also pay my taxes, and this pandemic has really affected me because I don't qualify for a lot of the programs. I'm living in poverty. And I would like just to go ahead and approve this program for hospitals, for food, so we can have healthy habits. A lot of people receive money, $50 to $100, $2,000, and I don't receive any of that. Adelante, señora.
Y hay más de 2,000 personas. Y yo quisiera que esas 2,000 personas que viven saludablemente en este momento y que reciben ese apoyo, quiero que tomen en cuenta que habemos más de 500,000 de personas que vivimos en pobreza. Y ojalá que aprueben más fresco, porque es muy importante para todos nosotros. Muchas gracias.
There's over 2,000 people who are living very healthy because of their eating, and I really would like your support. There's about 500,000 of us who live in poverty, so I really would like you to approve this program of CalFresh, and healthy habits. I really want to thank you.
Gracias.
Thank you.
Thank you. Our next speaker is 0111. Please press *6 to unmute.
Hi, my name is Jose Lopez. I'm the Deputy Director at ACE San Diego and a proud member of the Invest in San Diego Families Coalition. I'm calling in support of the Invest in San Diego Families priorities and investing $15 million in legal services and education for tenants. We have heard time and time again from ACE members throughout the county about the abuses they have faced from their landlords and the difficulties they've had due to the lack of protections and resources for tenants in the county. Tenants need a place to go when they need a legal support and or representation. Investing $15 million to expand legal services for tenants is a great start. By making sure county residents have access to free legal services and counseling, we will help keep many families safe in their homes. Thank you, and I hope we can count on your support.
Thank you. Our next speaker is 9665. 9665, please press *6 to unmute. 9665. I can see you've unmuted, but you may also have to unmute your cell phone.
Hello, can you guys hear me?
Yes.
Good afternoon. My name is Maria Cano. We have been advocating for hazardous pay for the county, San Diego, and for San Diego Families and Coalition. My coworkers and I wanted to share for our experience here at Edgemore. And for the past few years, we had rough times with staffing, and it had varied here a lot, enough for other workers to notice. We are also looking for better pay, even though, to tell you, we just feel like it's a stepping stool. For others, places to offer better opportunities in the county doesn't have a chance to hold them here, and for us that stay here, we need better pay. Why not just to say that? We are here because we care for our residents, even if COVID-19 has just put a hardship on all of us, mentally and physically. Closing units due to exposure, moving staff around because of shortage or because of the need of N95 and PPEs. The stress and the fear increases day by day. And even with this in our minds, we still show up to work, not knowing if we're putting our residents, our family, and ourselves at risk of contracting COVID-19. The impact has been intense, and that is brought to coworkers closer and closer together. However, some of us have 2 jobs to make ends meet, and it still may not be enough to cover the cost of living. And that's one of the reasons we don't even think about retirement, and many others have 15 or 20 years unable to retire.
Thank you.
Now we have to worry about.
Our next speaker is 4284. 4284, please press *6 to unmute.
Thank you, Chair Fletcher and honorable supervisors. My name is Gaby Millan with the YMCA of San Diego County. As our county looks forward to a transition into recovery from the pandemic, we enter a new era of reconciling our collective trauma and the disparities of what individuals have experienced for the past year. Being from an agency dedicated to youth development, healthy living, and social responsibility, the Y realizes whole person health and supports for children, youth, and the families is critical. Thank you for recognizing the importance of increased funding to address the critical need of mental and behavioral health support. Increasing family protective factors through systems like childcare, as well as increasing social and emotional connections for youth through sports activities are a good start. But more sustainable funding for evidence-based solutions are needed. It cannot be stressed enough that prevention and early intervention for 0 to 24 years old with flexible family-centered approaches must be part of intentional planning and policy decisions moving forward. I thank you for your time and consideration.
Thank you. Our next speaker is 5427. 5427, please press star 6 to unmute.
Hi, can you hear me?
Yes.
Perfect. My name is Sofia Rodriguez. I'm a Health and Human Services Specialist with the County of San Diego. I'm also a union member with SEIU 221 and with the Invest in Families Coalition. I'm just calling in to support the hazard pay for county employees. But while I'm listening to all the other testimonies, because this is literally my third time testifying for hazard pay for county employees, what frustrates me the most is that county employees have to be competing with businesses, with people who are struggling, with people who can't pay their rent, with people who are asking for literal food. And it's just frustrating to me that an employee is competing and feels like competing with all these, with the city and the county itself. And all we're asking for is some type of reconciliation with that, the fact that we were exposed to COVID just by doing our jobs. And we love our jobs. We bend over backwards for our jobs. And it's frustrating and heartbreaking to hear, especially with the testimony of a señora that just spoke a couple of turns ago, asking for just literal food. And so this is, for me, this is unacceptable. We as county employees are doing our best to help our community, to lift up voices, and here we are on the same page as these people. I don't see sheriffs asking for hazard pay. I don't see other law enforcement and other cities asking for hazard pay and competing with its community for it. So and again, this is literally my third time testifying for hazard pay for county employees, and it's just frustrating. I really hope that the Board of Supervisors approve this measure, show that you care about your employees, and we give back to our own community. And that's all that I want to say. Thank you.
Thank you. Our next speaker is 8855. 8855, please press star 6 to unmute.
Good afternoon, Chairperson Fletcher and the board. My name is Natalie Merritt, and I'm a county worker, a constituent of District 2 and an SEIU 221 member. A fellow union member made an excellent point in the e-comments. Hazard pay is not a bonus. It isn't just extra money given to us for no reason. As a protective services worker, my job is to keep kids safe. This requires myself and my coworkers to enter homes, which caused consistent exposure. We weren't afforded adequate PPE for months. Because of my employment and repeated exposure to COVID-19, I missed weddings, the birth of my brand new nephew, and other important events. Despite all of this, myself and my coworkers continued to work to keep children safe. My job is already a very high-risk job, and we are already severely underpaid in relation to other counties in California. And not only do we deserve, but we are entitled to this pay due to the repeated risk we have put ourselves in. I myself was exposed over 6 times. But guess what? All of those children are safe right now. So thank you for approving funds to cover this pay, and I'm here to ask for the approval of the item 3 to use the American Rescue Plan Act to fund this. Thank you.
Thank you. Our next speaker is 9674. 9674, please press star 6 to unmute.
Good afternoon. My name is Mustafa Albaid. I have worked for the county for over 7.5 years as a human services specialist at Del Cone Family Resource Center for the Health and Human Services Agency, as a proud SEIU Local 221 union member, and Invest in San Diego Families Coalition. We have been advocating for hazard pay for county employees at our workplace, at these meetings, and at the bargaining tables. my coworkers and I sacrificed during the pandemic by accepting and processing an overwhelmingly large amounts of applications for public assistance programs like CalWorks, CalFresh, Medi-Cal, and other programs offered by the government during hard times for County of San Diego community members that were unprecedented in size and urgency prior to the pandemic, and for as long as I have worked for the county. And at times having to come in dangerous close contact with the most vulnerable members of the public, like the aged and disabled and the homeless. We ask you to fund hazard pay for county employees with the ARPA funds. So please vote on this item as yes. And for county employees, respect us, protect us, and pay us. Thank you.
Thank you. Our next speaker is 6435. 6435, please press *6 to unmute. 6435, please press *6 to unmute. We'll come back. Our next speaker is 9444. 9444, please press *6 to unmute. Looks like that caller dropped off. Our next speaker is 9702. 9702, please press *6 to unmute.
Hi, my name is Avery Ware. I am an adult protective services specialist, and I am a member of the union representing those employees. I'm calling to advocate for hazard pay because me and my coworkers throughout the long months of the pandemic, and particularly at its height, knew that we were putting ourselves at risk. A lot of my coworkers who work in the South Bay, where infection rates were very high, found themselves unable to screen in advance. Even during those times where there were limitations on home visits, they found themselves in the midst of visits where they discovered that there was a COVID infection in the home or involving the person that they were interviewing at the time. And all of this, as we went through it, knowing that we weren't being compensated for this thing that we had taken on, that we were required to take on and that we wanted to do because it needed to be done, but that we weren't compensated for the extra risk, for the stress. We know that there have been tragic outcomes for some, including among our fellow county workers. And I think we should have been paid at the time. Now there's the opportunity to make us whole with the ARPA funds. So I want to advocate for that. And just to say that there are those who argue that it is something, giving hazard pay to county employees damages other people in the county. And I think that's a wrong-headed view. This is a historically low-paying county, not just the county, but all employers across San Diego. And the county board can take a positive lead and change that direction and can set a different standard. And this would be a great way of starting to do it. It'll be good for all people who participate in the labor market if we improve the compensation for San Diego County employees. Thank you.
Thank you. Our next caller is 3892. 3892, please press *6 to unmute.
Good afternoon. My name is Sylvia, Silvia, and I have worked for the county for the last 20 years. I'm a legal support assistant, and I'm a proud SEIU Local 221 union member. We have been advocating for hazard pay for the county employees at our workplace, this meeting, and at the bargaining table. My co-workers sacrificed during the pandemic by going to work every day in public transportation. They usually take 3 to 4 buses to get to work, and they risk their safety for the work. The extremists are seeking to divide frontline workers and our communities, but we thank you for seeing through that. We ask you to finish the job and fund hazard pay for the county employees with the ARPA funds. Please vote yes on these items and vote yes for county employees. Thank you. Good afternoon.
Thank you. Our next speaker is 0139. 0139, please press star 6 to unmute.
Buenas tardes. My name is Blanca Melendres. I am a resident of the city of Chula Vista and the executive director for UC San Diego Center for Community Health. I am also a mother, a wife, and a social justice advocate. I appreciate Supervisor Vargas, Supervisor Fletcher, and the Board of Supervisors' leadership, and for considering the Food Insecure Nutrition Incentive Program known as Más Fresco, More Fresh in San Diego. This program benefits our most vulnerable San Diego County families. Más Fresco is a program that's close to my heart. I came as an immigrant to this country, and growing up, I experienced hunger, and I know what it is to be a minority in this county and not have access to basic needs like healthy food. To me, Más Fresco is a social justice program. To end hunger and food insecurity in San Diego, we must apply a racial equity lens to the causes and also to the solutions. And Más Fresco is a solution, and it does that. It puts the needs of communities of color at the center and provides an immediate solution, a financial incentive to buy fruits and vegetables to end hunger and increase access to nutritious foods. We are calling to expand and institutionalize in our county Más Fresco program and make it available at hospitals, health clinics, farmers markets, community markets, and to not have eligibility restrictions on individuals. Many of the restrictions on federally funded programs hurt and exclude communities of color and would contribute to more racially equitable outcomes if we make sure that this program is available to anyone who is deemed food insecure. Más Fresco is a program that is created by the community for the community. Our resident leaders like Delia and Delfina, who spoke previously, have been part of this program, supporting and advocating for this program in our communities. With the adoption of Más Fresco Food Incentive Program, our local businesses and farmers will benefit, and thousands of families would be able to afford fruits and vegetables for their kids. Thank you.
Thank you. Our next speaker is 6687. 6687, please press star 6 to unmute. 6687, please press star 6 to unmute.
Good afternoon. My name is Drusilla Willis. My pronouns are she, her, hers. I am the proud SEIU 221 County Employee Chapter President for all union employees. I have worked with the county for 19 years. We're here to ask you to finish the job and fund hazard pay for the county employees with the Arpa funds. My coworkers and I have been advocating for hazard pay for the county employees at the bargaining table till now. My county employees and I have worked tirelessly to keep this county running, but everything was shut down. We were not. You have thousands of employees that continue to work and put their lives and their family lives at risk in locked facilities as well. You had numerous employees still going in COVID-infected homes with just a mask that they had to purchase. I get tired of hearing, what about the community? Because what are we? Are we not the community? Are your constituents not your community? So please don't forget this. Don't try to punish us because we are your employees. We are punished enough with the current leadership. The Republicans have been running hate campaigns saying everyone should get hazard pay, not just county employees. Well, guess what? The essential workers outside of the county, they have been getting hazard pay. The county employees have not. We deserve retro pay instead of a payout because COVID wasn't a one-time thing. It's still happening right now. Just like we work every day to deliver the best customer service to our communities, I ask you, Board of Supervisors, can you show your employees the same sentiment? So remember, never forget how you got there and never forget where you came from. Respect us, protect us, and pay us. Thank you.
Thank you. Our next speaker is 9408. 9408, please press star 6 to unmute.
Good afternoon. My name is Mylena Buon, and I've worked for the county for a little less than 3 years with my current position as a health information specialist at Public Health Services. I am a proud SEIU Local 221 member and part of the Invest in San Diego Families Coalition. And during the time of the pandemic, I was secretarial support for the community health engagement team at the start, while primarily supporting what once was the East Region Administration. And this small but mighty team has been deployed beyond stretch to support different sectors while having to juggle their regular priorities day in and day out, facing restraints in staffing without a permanent team to provide consistency and structure to the communities they serve. I've also been one of the employees coming into the office every day under a new structure for eligibility operations beginning in June 2020, with multiple staff changes to try and provide the services our staff and communities need, in addition to voluntarily providing support to help create the hygiene kits to give out to the homeless. Your employees, my brothers and sisters, have stood resilient and ready to serve at all costs, even if it meant sacrificing their overall health and well-being. We thank you for recognizing our efforts to making sure our county stays healthy, safe, and thriving. And we ask you to finish your job and fund hazard pay for county employees with the ARPA funds. Your yes to hazard pay for county employees and in support for this item lets us know that you see us, you hear us, and you're willing to take care of us like we continue to help take care of your constituents. Thank you.
Thank you. Our next speaker is 6796. 6796, please press *6 to unmute. 6796, please press *6 to unmute.
My name is Amy McCall, and I've worked with the San Diego Housing Commission for 24 years as a senior housing assistant. As a proud and passionate SEIU Local 221 union member, I have advocated for the hazard pay for the county employees. At the San Diego Housing Commission, we have negotiated successfully a hazard pay contract, a side letter, which started all the way back in April of 2020. And now I am completely in supporting of my fellow workers at this time in regards to the county table and the meetings and so forth. We have sacrificed during the pandemic, not by having adequate staff to do the increased workload, no overtime, limited resources, access for training, and delays with our technology, and also not having the complete support and helpful management of supervisors. So we have several extremists who are seeking to divide the frontline workers and our communities. But I thank you very much for seeing through all this. Now is the time that we ask you to finish this job and to really fund that hazard pay for the county employees with the ARPA funds. Please vote yes on this item, and please say yes to the county employees. My friends, my brothers, my sisters, respect us, protect us, and pay us. Thank you and good day.
Thank you. Our next speaker is 3540. 3540, please press *6 to unmute.
Good afternoon, Chairman Fletcher, board members, and CAO. My name is Marlon Mitchell. I have worked for the county for 23 years as a child support officer. As an SEIU 221 union member, I have been advocating for hazard pay for all county employees. During the pandemic, my co-workers and I have risked our own health by showing up for in-office work to continue to provide essential services to our community. In our child support department, our IT staff, clerical support staff, legal staff, call center staff, child support case managers, and fraud investigators have been the heroes during the pandemic. These heroes have adjusted on the fly to a constantly changing work environment, while in most cases meeting and exceeding the goals of our department. We ask you to complete the task and fund hazard pay for all hardworking county employees. Please vote yes on this item and vote yes for county employees. Thank you.
Thank you. Our next speaker is 3849. 3849, please press *6 to unmute.
This is Leslie Maslin, County Librarian for 7 years and proud SEIU member and steward. SEIU has been advocating for hazard pay for county employees at the bargaining table since February. I'm at the table and I see the bald-faced unwillingness to bargain in good faith or accurately report back to the board in closed session from the Labor Relations team. We have sacrificed so much this year. I didn't see my mother for a year. We canceled all birthdays, holidays, or minor celebrations because I was working with the public and then reassigned to COVID testing at the height of the holiday crush. We have had county staff get sick, even die on the job due to poor PPE distribution.
even malicious misinterpretation of guidelines and California law by county HR departments. The library already operates on a skeletal crew pre-COVID and had many vacancies, and then had many more staff reassigned to COVID response. And those left was charged with reopening the library for business as usual with an increasingly violent and angry public. Staff have children and needed time off of virtual schooling for elder care, but we did it. Physically, emotionally, and psychologically exhausted, but we did it. The county would not have had public service or COVID response without the sacrifice of county employees this past year. We ask you to finish the job and fund hazard pay with ARPA and general fund. Vote yes for county employees. Support us. Finally, please. Respect us, protect us, and pay us. Thank you.
Thank you. Our next speaker will be 6536. 6536. Please press *6 to unmute.
Good afternoon. My name is Stephanie Benvenuto. I'm Vice President of Public Affairs for the San Diego Regional Chamber of Commerce, and I'm pleased to have the opportunity to speak in support of the additional funding for small businesses as well as the funding for childcare. Our business community is still in recovery, much like every other industry, and that recovery is uneven, unequal, and it is different for every business across the board in San Diego. The additional funding for those businesses can make sure that they can continue to keep their doors open as we approach this reopening at such a critical point. The child care funding is equally as important, as those businesses will not thrive and will not have an opportunity to reopen if they can't get their staff back. And staff right now are facing a huge deficit in regard to finding child care that is accessible and affordable for their families. So we thank you so much for considering these issues, and we ask for your support. Thank you.
Thank you. Our next speaker is 1421. 1421, please press *6 to unmute.
Hello, my name is Joe Prickett. I'm the Senior Director at the University of California, San Diego School of Medicine, the Center for Community Health. I would like to start today by thanking each of the supervisors for the great work that you all do. Thank you for the opportunity to provide information on the significant social and economic benefit that the expansion of nutrition incentive programs represents for San Diego County. Nutrition incentive programs like the Mas Fresco More Fresh program provide financial incentives directly to community members for the purchase and the consumption of healthy foods. As such, these programs provide relief from both hunger and from food insecurity. Furthermore, these programs support farmers, so they support retailers, and they provide economic stimulus and job growth for the local economy. This funding will leverage existing resources and infrastructure to enable the expansion of nutrition incentives from 1,700 San Diego County households to approximately 10,000 households. This will include produce prescription programs where healthcare providers they provide patients with prescriptions for fresh fruits and vegetables that are then filled at participating grocery stores and farmers markets. To date, the Mas Fresco More Fresh program has demonstrated a significant increase in food security levels among program participants, while also demonstrating a significant increase in the purchase and consumption of fresh fruits and vegetables for better health. We've received numerous testimonials from program participants regarding the beneficial impact of Mas Fresco, and just a few of these testimonials are as follows. Testimonial 1, this program has been of great help for low-income families with children because everything is very expensive. In my case, my kids eat a lot because they are boys. Thank you, Mas Fresco. The next testimonial, thank you for helping us give our kids a healthier life. Thank you so much for the opportunity to share this information today.
Thank you. Our next speaker is 7283. 7283, please press *6 to unmute.
Hello to Chairman Fletcher and the entire board. My name is Robin Booker, and I'm an SEIU 221 member. And I just want to thank you for this space to speak to you today about hazard pay and the year that county employees faced in light of COVID. We worked 10 to 12 hours in lockdown facilities, wearing N95 masks. We still do. We enter strangers' homes into unknown situations, but continue to service our fellow San Diego residents during this scary moment and the fear associated with the coronavirus. You will never fully understand the risk taken to keep our county operational. So hazard pay is just the smallest of acknowledgement to show that you support and appreciate the risk we took and we still take during this pandemic. Thank you for your time.
Thank you. Our next speaker is 8754. 8754, please press *6 to unmute.
Hi, good afternoon, Chair Fletcher and Supervisors. My name is Chelsea Walbeck-Burks, and I'm the Senior Community Impact Director for the San Diego American Heart Association. I'm also a resident of San Diego County and specifically the city of San Diego. I want to thank the board and staff and their leadership in creating this robust spending plan, especially for including SNAP incentives and produce prescription programs. SNAP incentives and produce prescription programs will help the county's most vulnerable residents access healthy foods and promote local economic growth. These programs help families stretch their food dollars to buy fruits and vegetables. And meanwhile, children are taught healthy behaviors, establishing lifelong habits that will support their overall health and wellness long into the future. SNAP incentives and produce prescription programs will also help grow the local economy by increasing spending on fruits and vegetables in grocery stores, farmers markets, corner stores, and other small businesses. In fact, every $5 spent using SNAP generates as much as $9 in economic activity. These programs have been shown to generate job growth and support local agriculture by helping farmers markets thrive. SNAP incentives have a direct impact on revenues for local merchants, especially farmers. Store owners benefit from increased sales and when they participate in the programs too. The SNAP incentive and produce prescription programs will be central to the county's transition from acute emergency relief to long-term community and economic recovery. We appreciate the board's leadership in providing these critical programs to San Diego County families. Thank you so much.
Thank you. Our next speaker is 2078. 2078, please press *6 to unmute. 2078, please press *6 to unmute.
Hi, thank you for the opportunity to speak today. My name is Kim McDougall, and I am calling on behalf of the Early Childhood Advocacy Coalition, as well as a mom from District 3 who has relied on an incredible group of early care educators over the last year to get my family through the COVID pandemic. My kids and my family have been profoundly privileged to have access to childcare this last year, and many families did not have this privilege of being able to be fully present at work, knowing their children were safe and loved. Our childcare providers play an incredible support role in this community, and I'm so grateful that they're recognized in the Arpa framework. I do fear that more families will not be able to access care in the coming months as the economy reopens and people return to work if we don't bolster our childcare industry even more. So I would like to thank the county for this initial investment, and I look forward to working with the county for future investments in childcare and collaboration to leverage state and federal dollars. Thank you.
Thank you. Our next speaker is 3742. 3742, please press *6 to unmute. 3742, please press *6 to unmute. We'll come back. Our next speaker is 1848. 1848, please press *6 to unmute.
Hello, hi there. Dear Board of Supervisors, my name is Max Disposti, and I am the ED of the North County LGBTQ Resource Center. Thank you so much for the consideration of item 3 in the agenda, and in particular, the proposed funds of $5 million for the LGBTQ homeless housing and services. In pre-pandemic, LGBTQ and families have been struggling with systemic disparities that years of discriminatory practices have created. And we now know that 40% of the homeless youth between the age of 14 and 24 happen to be LGBTQ, that access to health, wealth, and representations are just some of the disparities that we know of. In District 3 and District 5, we have only one LGBT non-profit provider, which is us, that serves and supports the LGBTQ population, and 0 LGBT housing for youth or adults. At the North County LGBTQ Research Center, we could not close a day during the pandemic. We have continued to serve a 300% increase in demand for mental health, human trafficking prevention, substance abuse, and of course, homelessness. So we did so with minimal resources, yet we were able to prevent young adults from falling into homelessness and to provide life-saving services. As the only LGBTQ service and homeless provider in North County, we thank you for your vote in favor and for your consideration. And thank you to Supervisor Tara Loza-Raymer for taking the lead on this issue. Thank you so much.
Thank you. Our next speaker is 0916. 0916, please press *6 to unmute. 0916, please press *6 to unmute. We'll come back. Our next speaker is 3488. 3488, please press *6 to unmute.
Hello.
Hello, we can hear you.
Hi. Yes, Shane McCool. I'm bothered that supervisors would give $40 million in bonuses to any employee who did not work in a high-risk situation but received their paycheck for the last 15 months. Do you realize there are still people in the state who have never received their unemployment? Unless the county employee was around others in close proximity when at work, it isn't right to give them hazard pay when there are people who lost their jobs, good chance they are still not back to work and have never gotten their unemployment money. Claims waiting for certification and backlog claims are still over 1 million in California. Claimants are despondent, calling their elected politicians for help because they can't even get live help with the EDD, while you have the gall to entertain giving people who never lost a paycheck a bonus. I'm sure you know that most employees who work in offices were given the choice to work at home, schedules were staggered, or if they work in an office, it was only under safe conditions. Looking at your hazard pay by department, I find it ridiculous to give any extra money to anyone who did not work face-to-face with strangers. If you are giving hazard pay to people who are teleconferencing, working at home, going into an office where they have their own area away from others, that's disrespectful to those still waiting for their unemployment benefits. And if anyone in the county worked the way some of the supervisors' offices have the last 15 months, they certainly don't deserve extra pay. I left so many messages at Fletcher and Gaspar's offices in 2020 with not one call back. I have continued to call all of your offices and get the voicemail. Desmond's office was the only one to answer this past week. If this is an example of how county employees work, where's the hazard in that? I'm a public school teacher who started working with a small group of students 2 months before my district formally opened. I know of a tiny group of teachers who did the same. None of us have asked for hazard pay, nor did we receive it for that time for working with our neediest students because we were already getting a paycheck. Please use common sense with who gets the hazard bonus money when you vote. Thank you.
Thank you. Our next speaker is 3742. 3742, please press *6 to unmute.
Thank you, members of the board. I'm Eric McDermott, Oceanside property owner. My tenant stopped paying rent in April of 2020, and it's been 14 months of non-payment and counting. I own one house and only one house. In 2002, my wife and I scraped together enough money to buy our first home in Oceanside. We grew our family in this home. A few years later, I was offered a job that required we move. At the time, needing a down payment for a house to move into, I looked for selling my house in Oceanside, but it was the Great Recession. My home was worth less than the outstanding loan. I suppose I could have done a short sale like so many people at the time, but I felt the payments were my responsibility, not the bank's, not anyone's but mine. So we rented out our Oceanside house, moved closer to my new job, and became renters ourselves. I became an unwitting landlord. A decade later, I have no other properties. Because home prices have increased so much, it's still difficult to afford the 20% to put my own family into a house we own. So I'm still a tenant, but I'm also a distressed landlord. SB 91 came out, but the relief is tied exclusively to the tenant situation and cooperation, and they were declined. So I'm powerless to access any state relief. We continue to pay the mortgage and our rent, but we have new financial expenses. I have 3 children, one who just started college and 2 more soon will. And this January, my wife was diagnosed with a rare form of aggressive breast cancer and is currently undergoing 6 rounds of chemo, having surgery in July, and continued infusions for 52 weeks after. So here I am. What would have been rental income I've had to take out of my retirement account just to make sure I could take care of my family. The amount of lost rent so far, if left in my retirement account for the next 20 years, could have easily become $250,000 of retirement savings, and that's gone. When people hear the word landlord, it paints a picture. I hope this helps paint a different picture, a real picture of a small landlord, and I'm not alone. At a time when no one's addressing our situation, I can't thank you enough for your leadership in considering some relief for us small landlords, and appreciate your time.
Thank you. Our next speaker is 1987. 1987, please press *6 to unmute. 1987.
Good afternoon. My name is Fiona McMillan. I stand as a SEIU Local 211 union member and part of the Invest in San Diego Families Coalition to advocate for hazard pay for county employees. I have worked for the County of San Diego as a protective service worker for child welfare for 3 years. I am a frontline child abuse investigator and carry a caseload of high to very high risk cases. Our jobs require working in close proximity with the public on a regular basis in homes, hospitals, shelters, and jails. Over the past year, my coworkers and I have been keeping children safe from abuse and neglect in the midst of a deadly infectious disease the world is still trying to understand. Over the past year, my coworkers and I sucked up our fear every day and marched on carrying out our duties, not knowing whether today would be the day we would catch the virus and become ill. Over the past year, on top of the daily stress of exposure, we spent our own money as we bought our own protective equipment to supplement the 1 or 2 masks, gloves, and antibacterial wipes we were given per shift. We did this in an effort to protect ourselves, the public, and highly vulnerable children. Hazard pay is not only a morally reasonable investment to mitigate the harms we have endured, it can alleviate the potential future harms, protect the public, and ensure the well-being of children. We respectfully ask you vote yes to fund hazard pay for the county with ARPA funds. Recognize us, protect us, pay us as we serve to protect children under all conditions. We love our jobs. Thank you for hearing me today.
Thank you. Our next speaker is 1243. 1243, please press *6 to unmute. 1243, please press *6 to unmute.
Hi, I actually called for item agenda 10, but I do support this initiative paying hazard to those who put their lives on the line. But yeah, I actually called for item agenda 10.
Can you state your name for the audio record, please?
My name is Alina June. I'm calling from CARE San Diego.
Thank you.
Our next speaker then is 8142. 8142, please press *6 to unmute. Please press *6 to unmute.
Hello, my name is Teresa. I'm a county worker. I work at Edgemoor. I've been at the county for 7 years now, and I'm a proud member of the SEIU union, and I'm invested in San Diego Family Coalition. I am the clinical educator, better known as the in-service education coordinator and director of staff development here at Edgemoor. I am speaking to you today because I'm concerned for my fellow nurses and CNAs at Edgemoor, as well as county-wide first responders. Being a nurse in the year of COVID has made our duties increasingly harder. The care of the patients and residents here at Edgemoor have become increasingly complex with comorbidities. It increases the risk of contracting COVID, and yes, we have had COVID cases. We have had to add more precautions to keep them safe, to keep us safe, and to keep our families safe. There was a time when we had to work with a very shortage of PPE in the beginning, but then the county came through and provided us with adequate PPE. Our residents are not only physically, but they are mentally challenging as well, and this past year has been really hard on them. And in case you didn't know, there is a nursing shortage globally and locally. Therefore, many of my coworkers have been working short, taking on extra patient assignments without complaints because they are dedicated county workers and they are dedicated to Edgemoor and the residents here. Edgemoor is a 5-star facility. We are the best in the U.S. the last 3 years running. We should value our employees and we should pay them what they're worth. So, you know, you will hear more from me during negotiation times when raises come up. But right now, I'm asking the board to please vote on the county hazard pay for the county-wide first responders that really need it. Thank you.
Thank you. Our next speaker is 9281. 9281, please press *6 to unmute.
Thank you very much. I'm Llewellyn Crane, and I am calling on behalf of the Old Globe. I live in District 2. The Old Globe is located in District 4, and we'd like to thank you for your support of the nonprofit's arts and cultural ecosystem, which provides employment, brings tourism to San Diego, and contributes to the quality of life we all enjoy. I am speaking in support of the $5 million of ARPA funding for the arts and culture. In a normal year, the Globe serves 250,000 people annually, with 50,000 receiving free programs. We issue over 700 W-2s and have an economic impact of $37 million. When COVID hit, we furloughed 70% of our staff, lost all ticket revenue, which is over 60% of our income, and we went from a $30 million organization to a $15 million one. But throughout, we continued to serve the public good. We now face deep uncertainty as audiences return, and we are making investments in safety for our patrons. An infusion of funds to manage these losses would be significant and go a long way towards mitigating the damage of the last 15 months. Thank you so much for your support.
Thank you. Our next speaker is 1590. 1590, please press *6 to unmute.
Hello, my name is Bertha Rodriguez, calling on behalf of Climate Action Campaign, which is a member of the San Diego Green New Deal Alliance, to allocate $3 million of the ARPA funding for youth opportunity passes, a campaign that has been driven by the City Heights community and supported by our alliance. No-cost transit passes for youth 24 and under and seniors is key investment in the region's economic recovery that will connect youth to schools, work, and other opportunities, and create a new generation of transit riders, which is critical to meeting our climate goals. I also urge the county to allocate $5 million for LGBTQ+ housing and homeless services. We need to create an affordable and inclusive, bikeable, walkable, transit-friendly communities, and housing and transit are key components that need to be funded in order for all of our communities to prosper. Thank you.
Thank you. Our next speaker is 8970. 8970. If you'd like to speak on this item, please press *6 to unmute.
Hello, my name is Courtney Baltiski with the YMCA Child Care Resource Service and the San Diego Early Care and Education Advocacy Coalition. The County of San Diego commitment to the child care sector is greatly appreciated and timely as working families and child care providers navigate pandemic recovery. With 480 child care providers currently closed in San Diego County and many parents returning to work, the child care crisis has to have an all-hands-on-deck approach to solutions. The county cares funding for the sector passed by Chair Fletcher, Supervisor Desmond, and the past board helped significantly. But as the pandemic continued, the chasm of need has grown for children, providers, working families, and employers. Without reliable, quality, and affordable childcare, parents cannot return to work, food and housing insecurity persists, child poverty is exacerbated, and the resulting family stress increases the incidence of child maltreatment and family fracture. Supporting access to childcare is a critical prevention and recovery investment in family and their economic well-being. Strengthening our sector through vouchers, provider grants, facility enhancements, and workforce development is critical. Coupled with these opportunities, dedicated funding to support caregivers, providers, and children 0 to 5 in mental health supports cannot be stressed enough. Thank you so much for your consideration. Have a great day.
So our next speaker is 1795. 1795, please press star 6 to unmute. 1795, please press star 6 to unmute.
Hi, my name is Ana Laura Martinez, and I'm calling on behalf of the Center on Policy Initiatives and the Invest in San Diego Families Coalition. I'm also a constituent of Supervisor Anderson living in El Cajon. I'm calling to uplift the need for American Rescue Plan Act funding to go to communities most impacted by this ongoing pandemic, specifically low-income immigrant residents and their households who have been excluded both from federal and state benefits due to their immigration status. Research from UC Merced shows that nearly 1 in 4 pandemic job losses in California hit non-citizen immigrants as immigrant workers the most, as immigrant workers are the backbone of the most impacted industries. The workers who would benefit from this assistance do some of the most important work in their communities, preparing our food, maintaining our homes, and taking care of our loved ones. These are jobs that simply were not able to be done remotely. Many of us have had the privilege to quarantine safely because of workers like them. We're asking you to again support immigrants in the County of San Diego by creating a direct cash aid for low-income immigrants excluded from both federal and state benefits. Thank you. Have a good day.
Thank you. Our next speaker is 6844. 6844, please press star 6 to unmute. 6844, please press star 6 to unmute. All right, we'll come back. Our next speaker is 5085. 5085, please press star 6 to unmute. 5085.
Hello, my name is Heno Getana, and I'm calling with the United Women of East Africa. I'm calling to urge you to support the creation of an Office of Immigrant and Refugee Affairs. Relying on federal funds alone is not sufficient to ensure refugees successfully build their lives in the United States. Creating an Office of Immigrant and Refugee Affairs that is appropriately staffed and that provides information in their preferred language would help refugees learn about services available and how to obtain them. Once again, I urge you to support Chair Fletcher and Vice Chair Vargas' measure to create the Office of Immigrant and Refugee Affairs in San Diego County. Once again, I urge the Board of Supervisors to provide necessary support to immigrants and refugees by establishing the office. Thank you.
Thank you. Our next speaker is 9598. 9598. If you would like to speak on this item, please press star 6 to unmute. 9598. If you'd like to speak on this item, please press star 6 to unmute.
Hello, can you hear me?
Yes.
Thank you. Thank you, Chair Fletcher and County Board of Supervisors. My name is Gilberto Vera, and I'm a senior attorney of the Housing Team of Legal Aid Society San Diego. Please support item number 3, investing $15 million of ARAP funds for legal services and education for tenants. Our organization has experienced firsthand how tenants have been disproportionately affected by COVID-19. The pandemic has highlighted how many San Diegans suffer from housing instability and are at imminent risk of homelessness. By investing in legal services and education for tenants, we can work together to prevent at-risk tenants from adding to our homeless population and give families time to recover from the pandemic. Thank you all for your time and efforts to get our county back on track. Thank you.
Thank you. Our next speaker is 0396. 0396. If you'd like to speak on this item, please press star 6 to unmute.
Hello, Chair Fletcher and board members. My name is Karina Gonzalez, and I'm with Hammond Climate Solutions. I'm calling in to support allocating $3 million of the American Rescue Plan Act to fund youth opportunity passes. No-cost transit passes for youth are the key to creating the next generation of transit riders, which will result in less traffic, less emissions, and overall a healthier San Diego. No-cost transit passes for youth 24 and under and for seniors is a key investment in the region's economic recovery. Thank you.
Thank you. Our next speaker is 5059. 5059, please press star 6 to unmute.
Good afternoon, Board of Supervisors. My name is Stephanie Hernandez, and I'm a program manager at City Heights CDC. I'm excited to see that the no-cost transportation to youth and seniors on the recommended ARPA funding framework. Connecting youth to school, work, and internships and other early career opportunities will be life-changing. As a previous youth transit rider, I know the difficult decisions youth and their families are making in order to pay for transportation. In an effort to continue funding no-cost transit beyond ARPA, I also urge the Board of Supervisors to support the no-cost transit in the 2021 Regional Transportation Plan, as your collaboration will get us closer to creating an equitable transportation system. Thank you, and I appreciate the Board of Supervisors investing in the current generation of transportation riders who are hungry for opportunity.
Thank you. Our next speaker is 8222. 8222. If you'd like to speak on this item, please press star 6 to unmute. 8222. Please press star 6 to unmute.
Hello, good afternoon. My name is Janae Halton. I have worked for the county for 2.5 years as a records clerk. As a proud SEIU Local 221 member, we are advocating for hazard pay for county employees. My coworkers and I have sacrificed during the pandemic. My personal experience is I am at risk daily, having multiple sclerosis and working in an office that has not closed during the pandemic and having no possibilities for me to telework. I also work in reception, working daily with clients face-to-face, many of whom have come into the office admitting to actively experiencing COVID-19 symptoms. We ask you to finish the job and fund hazard pay for the county employees with ARPA funds. Please vote yes on this item and vote yes for county employees. Thank you.
Thank you. Our next speaker is 5362. 5362. If you'd like to speak on this item, please press star 6 to unmute. 5362. If you'd like to speak on this item, please press star 6 to unmute. Recalling 6435. 6435. Please press star 6 to unmute. 6435.
Good afternoon, Chair Fletcher and members of the board. Chris Duggan on behalf of the California Restaurant Association. Before I begin, I just want to take a moment to thank the entire Board of Supervisors, every team member in both the Department of Environmental Health and Quality and the Department of Public Health for your continued support and commitment to San Diego's restaurant industry. So thank you. I testify today to register CRA's full support of the proposed ARPA allocation framework before you, specifically the $7.5 million appropriation that was presented by Supervisor Desmond at the May 5th board meeting. This proposes waiving all fiscal year 2021-2022 food facility permit fees for all San Diego restaurants. CRA firmly believes this funding allocation will provide immediate financial relief in helping reverse the devastating impacts of COVID-19 on San Diego's restaurant community. As we are all aware, over the past 15 months, the hospitality industry, including our restaurants, have been one, if not the hardest hit by the prolonged mandated closures. And while CRA was excited to hear from Chair Fletcher announcing the transition out of the orange and into the yellow tier, full reopening coming June 15th, it must be noted the restaurant industry faces a long and slow road towards recovery. Today, the restaurant industry, along with other sectors, continue to face serious challenges, including bringing back our team members and increased food costs driven up by recent commodity price increases. It is for these reasons that we must remain vigilant as a community in monitoring San Diego's restaurant industry as they begin to fully reopen to the dining public. Again, CRA is very thankful for our continued partnership with the county and fully support the $7.5 million proposed allocation to waive all food facility permit fees in 2021 and 2022. Thank you.
Thank you. Recalling 0916. 0916, please press *6 to unmute.
Hi, good afternoon. My name is Jacqueline Rose, and I've worked for the county for nearly 2 years as an occupational therapist for California Children's Services. The SIU Local 221 has been advocating for hazard pay for county employees at our workplace, at these meetings, and at the bargaining table. I wanted to share with you my personal experience. I learned in early December that our unit would be returning to on-site work, and I was justifiably perplexed to the timing took for that decision. The pandemic was in the midst of an aggressive second wave, and the county was experiencing record highs. So I was uneasy at the prospect of putting myself in harm's way each day, and even more terrified of the possibility that I could infect my husband and other family members. So throughout the pandemic, we worked hard to constantly adhere to social distancing, mask rules, and only spending time with our bubble. And now I would be required to put myself and many others at risk. Since returning on site as the only occupational therapist, I've been asked to take on significantly increased workload due to the other therapists being able to treat as many clients through telehealth. And in addition to treating clients throughout each week, I was also responsible for completing all evaluations, many durable medical equipment orders, critical care services, and bringing the county back into compliance with its core mission after 9 months of underserving our clients. Despite increased workload, my productivity has at times been double of what my peers. I understand that these are unprecedented times, and I'm very glad I'm able to serve our clients and their families. However, I also firmly believe that the additional risk needs to be compensated appropriately. It's my understanding that the medical therapy program has never closed their medical facilities, which serves as a stern reminder that this pandemic is clearly above and beyond the assumed level of risk I accepted when joining the position at the County of San Diego. It is appropriate that I was required to work on site as the only OT during the delicate period and remain ineligible for any form of hazard pay, especially while my other colleagues remained remote.
One final call for 5362. 5362, if you'd like to speak on this item, please press *6 to unmute. 5362.
Chair Fletcher, we're not seeing any movement with that caller. That appears to conclude public comment on this item.
Thank you. Thank you to everyone who called in. So here's what we're going to do. We're going to work through, we essentially have 13 votes to take. The easiest way to follow along is if you take the board letter, you'll see under the CAO recommendations, there are 13. We're going to take them in the order outlined there. Once we complete these 13 items, then we will continue on. We have 7 remaining agenda items before our board and approximately 4 to 4.5 hours of public comment associated with those 7 items. So once we get through these 13, then we will continue on with our 7 additional agenda items and approximately 4 hours of public comment. Before we get into item 1, I just want to reiterate for both the board and the public, this is an ongoing process. We're gonna start making some decisions about categories, but again, there will be constant evaluation and monitoring as other funding streams come available, and 1/2 the funds will not be here for another year. And so my guess is for several years moving forward, given the length of time we have to spend these funds, we can continue to assess and monitor and adjust as we go forward, particularly as we get a clearer picture of what the world looks like as we begin to come out of COVID. So with that, let's just take up right now recommendation number 1. This is approve the use of the Arpa funds. This is the public health response. The only funds that are included in this are things directly related to the Health and Human Services Agency response, things around vaccines, testing, all of those types of items. And it includes the $75 million that will be held back in reserve for us to consider at a future date what we would like to do. In order to get us started, I'll go ahead and make a motion to approve the recommendation in agenda item 1. Let me ask, and we have a second by Vice Chair Vargas. Let me ask my colleagues if there's any comments or questions on recommendation number 1. All right. Not seeing any. Let me ask the clerk to please call the roll.
Thank you. Supervisor Anderson.
Aye.
Supervisor Lawson-Remer.
Aye.
Supervisor Desmond.
Aye.
Vice Chair Vargas.
Vargas, aye.
Chair Fletcher.
Fletcher, aye.
The motion passes unanimously with all supervisors being present and voting aye.
So now we're going to go to recommendation number 2. This is approve the use of the American Rescue Plan funding, premium pay for government essential workers, appropriation in the amount of $36 million for this item. I will go ahead and make a motion. Is there a second?
Second.
We have a second by Supervisor Lawson-Remer. Let me ask my colleagues if there are any comments or questions on this item.
Yes. Anderson and Desmond.
Okay, we'll go Supervisor Anderson, and then we'll go to Supervisor Desmond.
Thank you, Chair Fletcher. I just, look, I want to be on record saying our employees are fantastic. They did an incredible job over the last year, and that my no vote is no reflection of how I feel, how fondly I feel about our county employees. But at the same time, I represent the second poorest district. I've got people who household income is $60,000. They lost their jobs because the restaurant that they worked at, where they served tables at, where they cooked at, closed, and they were unemployed. And they're unemployed during that whole time. Every time the restaurant opened or shut, they were either working or not working. And I can't in good conscience take their tax dollars when I know that many of these people are going to be homeless once the rent is due, once the economy picks up. And I'm happy that there's other money in this budget to help those folks, but I just can't in good conscience give COVID bonuses to those who never missed a paycheck, have a guaranteed outcome with their retirement, and have the best health care. However, I do feel that our employees worked awfully hard and they're just wonderful people, and this is no reflection of how I feel about them. So thank you.
Thank you, Supervisor Anderson. Supervisor Desmond.
Thank you, Mr. Chair. I too share Supervisor Anderson's feelings on hazard pay, but I understand, and I do also on the fact that our employees have gone above and beyond in service to the county and putting themselves in harm's way. And I understand it takes 4 votes to allocate these Arpa dollars or federal dollars for hazard pay to the county employees. And if this doesn't get the 4 votes today, then it's going to be sent to county budget for a vote where only 3 votes are going to be required. So hazard pay, in my opinion, I'm counting it up here, is going to win. Hazard pay is going to happen. And so to me, it comes down to, well, if that's the case, where should the money come from? And if it's a 3-vote item, it comes from our county general fund, and potentially it's the reserves. If it's a 4-vote item, then it comes out of the federal dollars. So I think it's a better use, since it's going to happen anyway, and it's going to win either with 3 votes or 4 votes today, that it comes from the federal dollars and not our general fund dollars in San Diego County, our local dollars. I'm also, this supports law enforcement and first responders who risk their lives every day, protecting San Diegans, and more than half of this money goes to the Sheriff's Department and probation, who certainly have served on the front lines. So I'm going to be supporting the item today because I want to protect the county's reserve. It's no longer an issue of hazard pay if it's going to happen or not. It's a question of what pot of money is it going to come from. And I think using federal dollars is better use than the county's general fund, where the federal dollars requires a 4 votes. I'll be in favor of using the federal dollars and not the local reserves for hazard pay. So I'll be supporting the item today.
Thank you. Supervisor Desmond, I just want to clarify, thank you for that and for those comments. If we appropriate on 4 votes today, that appropriates the ARPA funding today. If we do it on 3 votes in the budget, this would still be ARPA funding. It would just be during the normal budget process. And so on this item, regardless of whether we do it today with 4 votes or we do it in the budget with 3 votes, it is still ARPA funding that is being used for. So I just want to make sure we're clear on this item number 2.
It's ARPA funding that would have been part of the general fund, though, is my point. And so thank you for that clarification.
Thank you. All right, we have a motion and a second to approve recommendation number 2. With that, let me ask the clerk if I see any additional comments. Supervisor Lawson-Remer, I'm sorry.
Yeah, thank you. I just want to say, from public safety officers to foster care workers, our county employees found themselves at the center of this pandemic. And at the height of the crisis, all of us saluted their service. We said, thank you. We said, we will never forget. And what is on order today, or what's the question presented today is, did we forget? Because the time to show is that gratitude is now, not with words, but with actions. We have the funding, and the question is, do we really believe in our county workers? For over a year, they had our backs. They protected our constituents, working long nights and helping those in need. This is about treating our essential workers with respect and appreciation that they've earned. And I use those words deliberately because they've earned it. So I would be very proud to support this today, and I hope we can prove that this board has not forgotten what our essential workers have done, because they will not forget this vote today. Thank you.
Thank you. Thank you, Supervisor Lawson-Remer. I just want to echo those comments. It has been a very long year and a half, and even in the earliest days of the pandemic, we saw our county workers showing up often at great risk to themselves. Not just our law enforcement folks and not just our public health, but our social workers who were looking out for our kids, our folks that were helping our seniors. Those were taking care of the least among us, the most vulnerable, and I think this is an appropriate action for this board to take today, and I'm pleased to support it. With that, we have a motion by myself, seconded by Supervisor Lawson-Remer, to approve the recommendations in number 2. I ask the clerk to please call the roll.
Thank you. Supervisor Anderson?
No.
Supervisor Lawson-Remer?
Aye.
Supervisor Desmond?
Yes.
Vice Chair Vargas?
Proud yes.
Chair Fletcher?
Fletcher, aye.
That motion passes with Supervisor Anderson voting no, all other supervisors being present and voting aye.
We're now going to move to recommendation number 3, establish appropriation of $4 million and finance other general miscellaneous expenses, other charges for telework stipends based on prior year available general fund balance. This is the second part of the $40 million proposal for hazard pay for essential county workers. I'm happy to make a motion to approve. I see a second by Supervisor Lawson-Remer. Let me ask my colleagues if there are any comments or questions. All right, seeing none, I'll ask the clerk to please call the roll.
Thank you. Supervisor Anderson?
Nope.
Supervisor Lawson-Remer?
Aye.
Supervisor Desmond?
I'm going to be no vote on this one, primarily, again, because of the same reason. I don't want to be using the general fund dollars, just for the same reason in item number 2 on this item. So I would no vote.
Vice Chair Vargas?
Vargas, yes.
Chair Fletcher?
Fletcher, aye.
That motion fails due to the lack of required affirmative votes.
Thank you, Mr. Clerk. I'm going to make a new motion to adopt the recommendations in number 3, but instead of an immediate appropriation, to refer to budget an appropriation of $6 million, not $4 million, $6 million in finance, other general miscellaneous expense, other charges for telework stipends. I'm happy to make that motion. Is there a second? I see a second by Supervisor Lawson-Remer. Any comments or questions from my colleagues?
I have a comment.
Supervisor Lawson-Remer.
Yeah, I just want to comment how difficult and taxing it has been for so many of our county workers who went above and beyond, working from home, and I think the least we can do is to ensure that their contributions and sacrifices are compensated and recognized, particularly given all the additional expenses that they incurred on their own personal time and our personal accounts. And I'm proud to support this motion for $6 million as a refer to budget item. Thanks.
Thank you. Not seeing any additional, Vice Chair Vargas. I got you. I see you.
Working. So anyway, I just want to say thank you to county staff. I'm proud to vote on this item since we've been fighting for this for over a year and a half, even before all of us got here. So I am honored to thank our county staff for all of it that they have done. So we really appreciate it.
Thank you, Vice Chair. Supervisor Anderson.
I think they did a stellar job, and I'm really happy that they were there. But I can tell you, when I walk through my district, there are a lot of people that didn't have any work, didn't know where their next paycheck was coming from, didn't know how they're going to keep their family together. And, you know, we mustn't forget the poor people in our community, the working poor who get up, show up to work when work is available. All those people went through a lot more crisis, fearing that they're equally exposed, and at the same time, they had no money and no health care. You know, when you're not employed, you don't necessarily have health care. And when you're thinking about where your next meal is, you're not spending money on health insurance. And yet, every one of the people that are receiving the bonus today had full health care, had extended benefits so that they got paid to take care of people in their family that were sick. When you divide the total dollars by the number of employees, it's over $124,000, and yet they're all getting bonuses with benefits. So I don't want to take away from our county employees, but if their job was open, people in my district would jump at all those jobs in a heartbeat. That's far better. They're far better off financially and consistently than where these people are that I represent. So, I'm not, look, we all have different districts. We all need to represent our district to the best of our ability. But I think it's disingenuous to paint it as they're the only ones that went through a tough time. Every grocer that served the public, every person that was out there who was in contact with the public had equal risk, but they didn't all have the same benefits. They didn't have the same guarantees. And this is a tough time for everyone. And I just don't want to see poor people being swept under the rug when, you know, they still have great needs that we have to fulfill. So thank you.
Thank you, Supervisor Anderson. Supervisor Lawson-Remer, did you have additional comments? I see your mic is on. Okay.
I'll let it go.
Okay. All right. Thank you for that. See no additional comments. I'll ask the clerk to please call the roll.
Thank you. Supervisor Anderson?
No.
Supervisor Lawson-Remer? Yes. Supervisor Desmond?
No.
Vice Chair Vargas?
Vargas, yes.
Chair Fletcher?
Fletcher, aye.
That motion passes with Supervisor Anderson and Supervisor Desmond voting no, all other supervisors being present and voting aye.
Thank you. We're now going to continue to recommendation number 4, approve the use of Arpa funding for mental health services, establish appropriations of $30 million for the programs outlined in this item. Let me ask my colleagues if they have any comments or suggestions on this item.
Yeah, so thank you, Chair Fletcher. On this particular item, I want to just kind of highlight, particularly since January, I've met with our superintendents and school board members and have heard that our youth, particularly, there's a lot of need for access to healthcare. So I'm glad to see that $30 million is proposed to support mental health care services for children and youth. I'm looking forward to seeing a partnership between our school districts and the county behavioral health services. I'm also supportive of the $2 million allocation for IHSS participants for telehealth services. And I am happy to support this item.
Thank you. Supervisor Lawson-Remer.
Yeah, I have a clarifying question. It would appear from what I see that the $2 million for IHSS is not included in this current allocation. And if we would like to ensure telemedicine services and mental health services for our IHSS providers, that we would need an additional $2 million in this bucket. Is that, am I reading this correctly?
That is correct. What I think we could do, I mean, one thing it would be up to the board to decide, but given the significant investment we are expecting in broadband coming down both from state and federal funding, if we wanted to move $2 million to fund the IHSS mental health, behavioral health program, we could move $2 million from broadband into that category.
Got it. So the basic idea would be, because we will be having so much additional funding for broadband, take $2 million out of that broadband bucket and put it $2 additional million in this bucket. So we have $32 million total, and $2 million of that is for the IHSS and telework.
That's right.
I would like you to turn that into a motion,
All right.
Fletcher. Thank you.
So what we'll do is make a motion to approve the recommendations in number 4 with the addition of $2 million in funding to fund a telehealth behavioral health program for our in-home supportive services clients
and providers.
And providers, and to move that from broadband, so that would lower the broadband total to 18.
I'll second the motion.
Okay.
You second the motion.
We have a motion by myself, seconded by Vice Chair Vargas. Let me ask my colleagues if there's any comments or questions. Supervisor Desmond.
Yeah, on the broadband issue, I understand that we are potentially getting other broadband dollars. However, these broadband dollars are specifically for the unincorporated areas. So I hope we don't take any more out of broadband. And if we do get broadband dollars for the county of San Diego, that the unincorporated areas get that benefit as opposed to them being spread out. At least they get back up to the 20 million for the unincorporated area instead of spent county-wide. That's my major concern for taking any dollars out of broadband.
Thank you. All right, not seeing any additional requests to comment. We have a motion by myself, seconded by Vice Chair Vargas, for $32 million in recommendation 4. Ask the clerk, please call the roll.
Thank you. Supervisor Anderson.
Aye.
Supervisor Lawson-Remer.
Aye.
Supervisor Desmond.
Aye.
Vice Chair Vargas.
Vargas, aye.
Chair Fletcher.
Fletcher, aye.
The motion passes unanimously with all supervisors being present and voting aye.
So now we're going to move to recommendation number 5, approving ARPA funding in the amount of $85 million for homeless-related programs and services as outlined in the recommendation. This is, I think, an important program. I'm very pleased to see us move forward on this. I appreciate the work of staff. I know we have a lot of work to do to meet the immediate need that we're seeing, along with wisely investing these funds to try and get systemic change in what is a very significant public policy issue facing our region with homelessness today. And so I'm happy to make a motion to approve the recommendations in item 5. Is there a second? We have a second by Supervisor Lawson-Remer. Let me ask my colleagues if they have any comments or questions on number 5. Vice Chair Vargas.
Thank you, Chair Fletcher. I just want to make sure, and I think, thank you, that I obviously I think it's extremely critical that we are investing in our homeless population, both through services and housing opportunities. I do want to emphasize the $5 million that's being set aside to support our LGBTQI communities with housing and services, because I think this is very important. I also would like us to really make sure that all of these funding allocations and the work that we're looking at today, I want to emphasize that I think it was shared earlier today by our presenters that we are doing this work from an equity lens, and so I want to make sure that we continue to use that model of equity as we're looking at the disbursements of these funds throughout the rest of the items. Thank you.
Thank you, Vice Chair. And as a board, we did adopt a guiding principle or policy surrounding all of the ARPA funds to make sure that they are spent via an equity lens. And so it is good to reinforce that and reemphasize that, and for us to remind ourselves of the importance of that as well. Okay, with that, not seeing any other comments, we have a motion by myself, seconded by Supervisor Lawson-Remer to approve recommendation 5. I'll ask the clerk to please call the roll.
Thank you. Supervisor Anderson.
Aye.
Supervisor Lawson-Remer.
Aye.
Supervisor Desmond.
Aye.
Vice Chair Vargas.
Vargas, aye.
Chair Fletcher.
Fletcher, aye.
The motion passes unanimously with all supervisors being present and voting aye.
So now we're going to move to recommendation number 6, approve the use of ARPA funds for food assistance in the amount of $20 million. I want to highlight and say how much I appreciate the investment in community gardens here. Community gardens give us the opportunity to invest in a sustainable food program that can provide long-lasting, multi-generation expansions of the ability of individuals to create their own community gardens, both at their homes and in their neighborhoods and communities. There's not only food security issues here, but there are also environmental issues that we can see, and really the expansion of agriculture into our communities. And so I appreciate this, in addition to all of the other things that we're doing. Let me ask my colleagues if they have any comments. Let me go to Supervisor Lawson-Remer first.
Thank you. First of all, I very much appreciate the effort that went into putting this together. I think I just would like to highlight that I think there's one thing I'd like to see added to this bucket, which would be $1 million to support county staff in implementing sustainable equity and local sourcing procurement guidelines. The agricultural sector here in San Diego County is worth nearly $1.8 billion. And with a small $1 million investment, we can really do a lot to transform sustainability and equity in food production across our county and our region. So in this section, I would like to advocate that we add $1 million for food system sustainability procurement guidelines development. And I think we could take that out. Right now we have 10 million for food distribution and food banks and move that down to 9 million. So that would be my proposal, would be to move this forward with that amendment.
Okay. Any thoughts, comments from other members? We could make the adjustment of lowering food distribution programs to 9 and adding in 1 million for the development of food system sustainability, equity, and local sourcing procurement guidelines for county staff. I'm happy to make that motion with those adjustments.
Happy to second it.
All right, so we have a motion and a second on this item on recommendation number 6.
So I got a question on that, on the amendment. Understand you're moving the food distribution to 9, and is that a new line item that you're adding under food assistance, or is that one from another area to spend the $1 million?
It is
a new line item. So the county staff has been working pretty hard with the food systems sustainability procurement guidelines, building off of a national and international effort. But they do need funding to continue that work and to implement those guidelines. And so that this item would give them the support they need to implement those guidelines across all of the county's food procurement moving forward, so that our investments don't just have benefits today, but have long-term implications into the foreseeable future. I think we all know you can give a person a fish or you can teach a person to fish, and I'd like to invest $1 million in teaching us to fish.
Well, could you restate the line that you want to add, or where the $1 million goes to? I understand what you're trying to do, but I just want to, hear it again.
$1 million for the county to develop sustainability, equity, and local sourcing procurement guidelines based on the food system sustainability guidelines.
Okay, so they'll come back with a program for that? Is that the understanding? Okay.
All right. Anything else, Supervisor Desmond?
No, thank you.
Okay. So we have a motion by myself, second by Supervisor Lawson-Remer. Not seeing any additional comments or questions, we'll ask the clerk to please call the roll.
Thank you. Supervisor Anderson.
Aye.
Supervisor Lawson-Remer.
Aye.
Supervisor Desmond.
Aye.
Vice Chair Vargas.
Vargas, aye.
Chair Fletcher.
Fletcher, aye.
The motion passes unanimously with all supervisors being present and voting aye.
So we're now going to move to recommendation number 7, establish the use of Arpa funding for senior and youth services in the amount of $10 million. Appreciate the work that has gone into this and the compilation of fundings. Let me go first to Vice Chair Vargas.
Yes, Chair Fletcher, I would like to make a motion for us to support this particular item, and would like to see that no-cost transportation will support youth and seniors, right? And I would hope that we can include students up to 24 years old, to be eligible for these no-cost transportation passes. And would like to ask that we actually work closely with SANDAG to help administer transit pass programs for youth and seniors in our communities through the transit agency in the San Diego region.
All right, so noted. I'm happy to second that. Let me ask my colleagues if they have any comments or questions. Supervisor Desmond.
Thank you. We have one of on item 3 here, I guess the third bullet under senior and youth services, is grant programs for youth sports and youth camps. And we get $2 million for that, which I think we're going to burn through fairly quickly. And I know it's very important that we all, want our kids back, to youth sports opening up. I heard many horror stories about families who couldn't afford to send their kids or all their kids to youth sports or to youth camps this summer, primarily because a lot of them their jobs, they didn't have them all last year. And so they're hurting there. I'd like to, ask a friendly amendment that we take the $4 million that was, reduced from the hazard pay from $40 million to $36 million. Instead of putting it towards the reserves or towards the reserves in the item number 1, which would be the county dollars, if we could take $4 million and add that to the youth sports and youth camps program, to make it $6 million for youth sports and youth camps.
Yeah,
That would friendly amendment.
Yeah, so I'll go to the maker of the motion with that, but Supervisor, to do that, those funds are still accounted for in terms of the overall framework of what we're trying to do. So it's not that there's just $4 million floating out there.
I get that.
We would
come
have to cut something else.
25 million reserves.
Yeah. So let me ask the maker of the motion if she would like to accept that friendly amendment.
No, actually, I think that I appreciate your request, Supervisor Desmond, but I think at this time that $2 million is a good opportunity for us to assist. And I actually, one of the things that I failed to share is that I would like to make sure that those dollars, the $2 million, are actually prioritized in the 39 health equity zip codes to make sure that our kids that are mostly in need that were impacted by COVID, which was what Arpa is for, are the ones that receive these resources. So, yeah.
Okay.
Well, if I may.
Please, Supervisor Desmond.
Thank you. Yeah, then what I'd like to do is make either a separate motion or a substitute motion that we take for the grant program for youth sports and youth camps to add $4 million and refer it to budget to make that $6 million for the grant programs in youth sports.
Okay, so we have a substitute motion by Supervisor Desmond to do $6 million for grant programs for youth sports and youth camps and refer that to budget. Is there a second to that?
I'll second it.
Okay, we have a motion by Supervisor Desmond, seconded by Supervisor Anderson, just on the youth sports efforts to take that from $2 million to $6 million and to refer that to budget. Not seeing any comments or questions, I'm going to ask the clerk to please call the roll.
Thank you. Supervisor Anderson.
Aye.
Supervisor Lawson-Remer.
No.
Supervisor Desmond.
Aye.
Vice Chair Vargas.
Vargas, no.
Chair Fletcher.
Fletcher, no.
That motion fails with Supervisor Anderson and Supervisor Desmond voting aye, all other supervisors being present and voting no.
We're now going to return to the original motion, which is on the table by by Vice Chair Vargas, seconded by myself, to approve the recommendations in number 7 with the clarity that the grant programs be allocated in 39 health equity zip codes as a priority. We have any comments or questions on this item?
I have a question on the health equity zip codes. Sorry, I didn't look carefully at them. But I do know we have some high equity zip codes in Escondido, and I'm wondering if you know if those are included in that list.
Maybe we should turn it over to staff, but my understanding is that they are.
I believe they are. Okay. That is correct.
Great, thank you.
All right. We have a motion and a second. I'll ask the clerk, please call the roll.
Thank you. Supervisor Anderson.
Aye.
Supervisor Lawson-Remer.
Aye.
Supervisor Desmond.
Aye.
Vice Chair Vargas.
Vargas, aye.
Chair Fletcher.
Fletcher, aye.
That motion passes unanimously with all supervisors being present and voting aye.
So we're now going to move to number 8, child care subsidies. I think that this is a wonderful investment that we're making in child care. I think that similar to broadband, this is an area where we know that there is significant funding that is coming both from the state and federal government that's going to give us a great ability to draw down additional funds. I just want to highlight one issue is that where we have a shortage, like we do in other fields, behavioral health and others, is we have a shortage in workforce in terms of trained quality child care providers. And as we anticipate the arrival of additional state and federal funding for vouchers and for other services in San Diego County, it's going to be vital that we have a well-trained local workforce that is able to be deployed to meet that need. And so I'd like to recommend, as a part of a motion, that we adopt the child care subsidy, we adopt the recommendations in this, but just reducing the child care voucher program from $4 million to $2 million and the child care grant program from $4 million to $2 million. And that would free up $4 million. And then I would like to propose that we take $6 million from broadband and put it into workforce development training efforts. There's a variety of components we can do to significantly increase our workforce development And I think this will give us a great opportunity to have funding available for subsidies, to have funding available for a grant program, to have funding available in this for child care facility development and improvements we know is vital, important, but also to be in a position to make a $10 million investment in workforce training, in particular for child care workers. And so that would reduce our broadband total down to $12 million, and we would add those funds here. So it would be $2 million, my motion would be $2 million for child care voucher program for targeted populations, reduced from 4 to 2. $2 million for child care grant program, reduced from 4 to 2. Leave the $2 million for facility developments improvement, and then by adding $6 million from broadband and the $4 million we save from the other, that would be $10 million that we can invest in workforce centers and training programs designed to increase our availability of locally well-trained child care workers. And so that would be my motion on this. Is there a second to that?
I'll second that motion. And I would like to emphasize, I think, Chair Fletcher, that as we're thinking about economic recovery, particularly in some of our communities like District 1, having been on the board of Southwestern College for 7 years, and looking at our child care program and what a difference it makes when someone gets their certificate and their training and they're able to open up their own child care center, which becomes a small business, right? And what we're looking at is different ways of reinvigorating the economy. I think this is the perfect way to do so, so I'm happy to second that motion.
Thank you. Thank you, Vice Chair Vargas. Any other comments from my colleagues? Supervisor Desmond.
Yes, I don't know. The programs you're offering, I think, are good programs. But what I need to point out is you keep whittling away here at the broadband in the unincorporated area. And the broadband in the unincorporated area is predominantly the key to for the broadband in the unincorporated is to serve kids. Kids that are going to school, kids that get sent home with iPads and don't have a broadband at home to do their homework, to do the things that they need, they don't have that opportunity. And you've already whittled away, now this will be $8 million from the broadband in the unincorporated area, which is greatly needed. You're basically taking away internet from children is what's happening here. And so I'm not gonna be able to support this because throughout COVID and even moving into the future, technology is huge in education. And if we can help these kids, in the poorer areas of the county, get a better education and have that access to broadband, it's going to be crucial for their development in the future. So I'm not happy with the whittling away here at broadband effort, and I won't be supporting the motion because basically this is taking the internet from kids.
Thank you, Supervisor Desmond. Supervisor Lawson-Remer.
I want to reiterate the importance of childcare. Considering how long this meeting's going, we might all be childcare here tonight because Ava Kai will be here at about 6 o'clock. It's really vital, and there's no question that broadband investments are also incredibly important. But we do know that there's very, very likely going to be additional sources of pretty significant funding for broadband. And what I really appreciate about this approach to childcare is it's plugging a gap that we don't see funding coming from other sources to catalyze a more sustainable childcare ecosystem here in our county. Which is absolutely essential for all working parents. So I'm proud to support this.
Thank you, Supervisor Lawson-Remer. Not seeing any additional questions or comments from my colleagues, we have a motion by myself, seconded by Vice Chair Vargas. Ask the clerk to please call the roll.
Thank you. Supervisor Anderson.
Aye.
Supervisor Lawson-Remer.
Aye.
Supervisor Desmond.
No.
Vice Chair Vargas.
Vargas, yes.
Chair Fletcher.
Fletcher, aye.
That motion passes with Supervisor Desmond voting no, all other supervisors being present and voting aye.
We're now going to move to recommendation number 9, approve the use of ARPA funding, direct stimulus payments, establish appropriations of $40 million. Let me go to my colleagues, see if they have any comments or questions on this item. I'm happy to make a motion to approve recommendation 9. Is there a second?
So moved.
All right, second by Supervisor Anderson. We have a motion and a second to approve the recommendations in agenda item 9. Let me ask my colleagues if you have any comments or questions on this item. Seeing none, I will ask the clerk, please call. Oh, I'm sorry. Vice Chair Vargas.
Yes, I was trying to make sure I have the right number on here. So I just want to emphasize that direct stimulus payment was something that especially District 1 folks are really interested in. And so through the various community budget hearings that we had, this was a priority for so many. And so I'm pleased of the allocation of the $15 million in direct cash assistance to support those most impacted during the pandemic. You know, when you think about what this direct cash assistance means to folks, it really is making sure that we have dignity for our communities, because you know, not having access to resources doesn't mean that we get to direct where you spend your resources, or you having the capacity to make the decision about how you're going to spend your funding. And when we did an assessment of on our communities last year, that was one of the things that people really brought forth, and they said, let us make the decisions of where we could actually spend the money and where we need it. So I am grateful to my colleagues and hope that we can support this. Thank you.
Thank you. Supervisor Lawson-Remer.
Sure. I really appreciate Vice Chair Vargas's comments. I just want to build on that. You know, it's people report how important this is, but the data also shows that people use their money the best. They know what they need, and that's why this is so important, because it's empowering of people to make choices that are in their own best interest. So very proud to support this as well.
Thank you. All right, we have a motion by myself, seconded by Supervisor Anderson, to approve the recommendations in number 9. Not seeing any additional requests to speak, I'll ask the clerk to please call the roll.
Thank you. Supervisor Anderson.
Aye.
Supervisor Lawson-Remer.
Aye.
Supervisor Desmond.
Aye.
Vice Chair Vargas.
Vargas, aye.
Chair Fletcher.
Fletcher, aye.
The motion passes unanimously with all supervisors being present and voting aye.
We're now going to move to recommendation number 10, approve the use of ARPA funding for legal services, establishing appropriations in the amount of $15 million. Happy to make a motion to approve these recommendations. Is there a second? Second by Supervisor Lawson-Remer. Let me ask my colleagues if they have any questions or comments on this item. Supervisor Desmond.
Thank you very much, Mr. Chair. On this one, I think it's good as far as counseling and outreach and helping tenants if they're facing evictions. The other side of the coin is also landlords. And, I was just wondering if I would like to ask for a friendly amendment to also include landlords in the counseling and outreach and potentially legal services. For them, I mean, they may not know about the rental assistance. They may not know that they have to have their tenants sign documents and things like that. So, so I'd like to include also in this, not only tenants facing eviction, but landlords facing, the eviction process as well, that they can get counseling and the prevention services as well. So maybe we can prevent it if we're working both sides of the equation. So I'd like to add small landlords, 5 units or less, to also be available to the legal services, counseling, and prevention services.
Can I make a comment?
Please, Supervisor
I think the idea
Lawson-Remer.
of supporting small mom and pop landlords is really thoughtful and really wise. I'm happy to support that. I think the point here is to make legal services available to people who can't otherwise afford them. So, clearly we're not going to be providing free legal services to big landlords and big companies. But when we're talking about small mom and pop shops, that's the lifeblood of our economy, and I'd be happy to support that.
Thank you. So the friendly amendment would be for tenants and landlords in financial need facing eviction, counseling, outreach program, preventive services. And the in financial need will be determined by staff to determine that they have no other ability to pay for legal services.
Small landlords, 5 or less.
Small landlords, 5 or less, right, who are in financial need. All right. Motion by myself, seconded by Supervisor Lawson-Remer. Not seeing any. Supervisor Anderson.
When we went through the eviction board item a while back, I did a lot of research, and over 50% of San Diego landlords are fewer than 10 units. And if you have fewer than 10 units, it could be that you have a couple duplexes. It would open it up significantly to those in need. And these, even if you have 10 units or fewer than 10, that's not very many. When I think of corporate folks, we're talking about hundreds of units. And I would just like to make a friendly amendment saying fewer than 10 as opposed to 5, because the significance of the mom and pops who are on retire, who invested everything they had early on in a duplex. And now, you know, we're not talking about a bunch of rich people that are on corporate. We're talking about small folks that really got hurt. Would the original motion be willing to accept that?
I'll check with the second of the motion, Supervisor Anderson. I appreciate your sentiment. I think 5 is a little bit of a stretch to begin with. I think 2 is a good number. I think if you have 5 rental properties, you're probably doing okay. 10 is quite a ways from 5, so I'd prefer to stay at 5. But let me ask the seconder. I'm open, but I would prefer to stay at 5.
Similarly. I think, you know, usually when we think about small mom and pop landlords, we're thinking about a duplex, a triplex. You know, 5 already feels like a stretch. You know, and fundamentally thinking as an economist, right? I mean, if you have 10 units, you're able to diversify risk. You're usually able to access, you know, other sources of capital. And it's a pretty sophisticated player to be able to, you know, run a 10 unit rental business. So I want us to be, you know, squarely focused on helping the people in our community most in need. And, you know, those are our tenants who are facing unfair eviction and our small mom and pop landlords who don't have other recourse or other places to turn. And 15 million, frankly, isn't that much over 3 years. And I certainly would be concerned that by expanding this pie beyond the folks that are most in need, the people who don't have access to resources will get squeezed out. So I don't want us to squeeze out the people who need the help the most.
Okay, fair enough. So we got landlords included, but it looks like we're sticking at 5.
Okay.
And just for clarification, for clarification, we're talking about providing landlords the outreach and education so that they understand what the process and systems are, not necessarily providing legal assistance so that we can get people evicted, right?
Yeah.
That's right.
I just want to make sure I put that on the record.
That is correct.
Thank you very much. I'm happy to support that.
Okay. So we have a motion by myself, seconded by Supervisor Lawson-Remer, to approve the recommendations in number 10 with the addition of small landlords, 5 or less, who can demonstrate financial need. With that, let me ask the clerk to please call the roll.
Thank you. Supervisor Anderson.
Aye.
Supervisor Lawson-Remer.
Aye.
Supervisor Desmond.
Aye.
Vice Chair Vargas.
Vargas, aye.
Chair Fletcher.
Fletcher, aye.
The motion passes unanimously with all supervisors being present and voting aye.
We're now going to move to recommendation 11, approve the use of ARPA funding for small business and nonprofit stimulus payments and establish appropriations in the amount of $50 million. I think we all are aware of the need, the multiple rounds of funding and support that have been available, with the recognition we need to continue to do more. I think this is a good item. Let me go to my colleagues, starting with Supervisor Anderson, for any comments or thoughts on this item.
I think this is terrific, and I would just, I'd like to amend it though, to take $2 million from broadband and shift it to small business. Right now we're at 31 million going to small business. I'd like to increase that. I know that there's more broadband money coming in, and I'm hoping to get a bite at the second round of broadband money moving forward. So I'm not as worried about losing the money out of that. My district is highly impacted by the broadband, but I think getting businesses stimulated and getting people back to work as quickly as possible is going to have a huge impact moving forward. So I'd ask that we make that adjustment.
All right, so that would be a motion by Supervisor Anderson to approve the recommendations in item 11 with the change of going from 31 million for small business and nonprofit stimulus programs to 33 million, and reducing broadband in number 10 and number 12, I'm sorry, reducing that to $10 million. I'm happy to second that motion. With that, let me go to Supervisor Vargas.
Thank you, Chair Fletcher. I was interested in looking at a creation of a security deposit assistance program as part of this particular item, just to ensure that, you know, it's really right now difficult for many of the low-income renters to secure funds to pay for security deposits if they are displaced. And so these initial costs present a significant burden and add to housing instability. And so I'd like to request that county staff explore this opportunity to see if we're eligible under ARPA funding to extend feasibly by law incorporate security deposit assistance for renters that qualify under Arpa. And our recommendation is for $4 million from the ARPA funding to be designated to create this program.
All right, so it would be, can you just restate for us, Vice Chair Vargas?
$4 million from the ARPA funding to be designated to create security deposit assistance program for those impacted by COVID.
Okay, give me just 1 second, Supervisor Vargas. We know that we have significant broadband funding coming. We have lowered that to 10 million. I also believe that we have significant stormwater funding coming as well. And so what I would propose is that we would drop stormwater from 17 to 13 and add 4 million into this program in ARPA to provide the security assistance deposit projects. Let me ask the maker of the motion if he is okay with that as a seconder. I'm comfortable with that.
I'm fine with it.
Okay. All right. We have a motion and a second. We'll now go to Supervisor Desmond.
I just want to reiterate, we've eliminated the broadband that I thought was secure by my actions, but apparently not. But I just want to make sure that when this broadband comes back in some other form, that the unincorporated area doesn't get spread thin throughout the county. It can, but I think we need to replenish, the $10 million that's being divvied up here away from broadband, that it goes back, at least another 10 million goes back into the unincorporated area of the county, because we've got many needs out there, particularly for school children and their education. So I would strongly advise that we do not, sell our kids short in the unincorporated area with not enough broadband. Thank you.
Thank you, Supervisor Desmond. And I just want to say how much I do appreciate your commitment to broadband. I'm old enough to remember our budget deliberations last year, where I proposed $10 million for broadband, and you led the effort to whittle it down to $2 million. I think we are getting to the 10 million I had hoped to get last year, and I think that is a wonderful step, and I'm very committed to working to get additional funding for broadband in the future as we move forward. So with that, we have a recommendation, a motion, and a second to approve the recommendations in Agenda Item 11, but adding in $4 million for securing deposit assistance program. So that would take the total of this to 54 million, reducing stormwater from 17 to 13 with an absolute commitment by myself and I know other colleagues on this board to go find additional stormwater funding. We know how vital that is, but I do think there will be infrastructure dollars coming for that like there are. So with that, we have a motion by myself, seconded by Supervisor Anderson. Let's go to Supervisor Lawson-Remer.
Thank you. A couple of comments. First of all, I think Supervisor Vargas has identified a really important need in terms of security assistance. I hope we can figure out how to make that program work. I think the only request I would add on, I guess, would be a request to the makers of the motion is that if this doesn't work, if you investigate and it's not possible to implement this program, that we get a report back and we reallocate the funds at that time. So they're sort of not stuck in limbo. I certainly think this is an important program, but we aren't sure that we're going to be able to use ARPA funds for that. So that would be my only caveat. I do want to just make a couple comments around our investments in stormwater.
Do you want to do that one on number 12?
Okay, great.
Wait, does that work? Okay. I want to make one clarification. I misspoke. The motion and the second on the table will be $56 million for small business and nonprofit stimulus programs, increasing from 31 to 33, the small business and nonprofit stimulus program, and adding in the $4 million for the security deposit assistance programs. With all this understanding, all these programs are going to come back for review, not necessarily for votes, but it's an ongoing process as we work to implement this. All right, we have a motion and a second. Let me ask the clerk to please call the roll.
Thank you. Supervisor Anderson.
Aye.
Supervisor Lawson-Remer.
Aye.
Supervisor Desmond.
Aye.
Vice Chair Vargas.
Vargas, aye.
Chair Fletcher.
Fletcher, aye.
That motion passes unanimously with all supervisors being present and voting aye.
Now we're going to go to agenda item 12. This would be our infrastructure items. approving the use of ARPA funding. This dollar amount now will have been reduced by 14 million. So I believe that puts us at 32 million, with 10 million for broadband, 13 million for stormwater, $5 million for electric vehicles, and the $4 million for independent fire districts. That is presently where we are. I'm happy to make a motion to start us, but let me go to Supervisor Wasson-Reamer.
Thank you. Yeah, I just did want to take a moment to talk a little bit about these investments in stormwater, sewer, and drinking water, particularly for the unincorporated areas. I'm sure we all know that when it rains, our beaches are polluted. You can't use our most precious natural resource because we're deluged with stormwater runoff that's toxic, that's killing off our algae, that's killing off our entire seabeds, that's making it an environment that if you walk along some of the wetlands across the coast, you see die-offs in the exact areas where you see runoff. So this is an investment that is so vital for the future of San Diego County. Enormous part of our local industry is driven by tourism. And if we want to think about rebuilding our economy post-COVID, we have to acknowledge and recognize how important tourism is. But just beyond that, the beaches, the coastlines, our open spaces is protecting our natural environment is part of what makes San Diego such a special place. So it is incredibly important for our communities, for people who live in our communities, from all the way from IB up the coast to Carlsbad, to do the work to rebuild our sewer systems and our stormwater systems. 13 million, I think, is what's on the table right now. It really is just a drop in the bucket. We are looking at a need of $80 million a year for a number of years in order to just catch up with the degrading and decaying stormwater system here in San Diego. More important than that, well, not more important, but just as important as that, building these stormwater systems are good jobs. These are good jobs for working families here in San Diego County. And when we think about building back better, it's not just about spending money for today, it's about creating jobs for tomorrow. And the investments in our stormwater system are investments not only in our ecosystem, but are investments in good jobs, in jobs that will sustain our San Diego economy for people who are working hard every single day to put food on the table for their families. So I can't emphasize enough how important I think that this investment is. I'm happy that there's a proposal on the table for 13 million, but I have to tell you, I think this is woefully inadequate. I think that we as a board need to commit to prioritize stormwater investments for the foreseeable future. And as we look at other sources of infrastructure coming, I should certainly hope that this is our #1 priority moving forward in terms of investing and building back better for San Diego County.
And I want to echo those comments, Supervisor Wasson-Reamer, that the stormwater needs, the water quality needs are very severe, and the absolute commitment to fight for state and federal funding and to prioritize this as we have other areas and pockets come available that might not get spent in another area to recognize the need to do this. I'm very committed to that. So thank you. Vice Chair Vargas.
Yes, I think no one understands better than I do the need for this infrastructure, particularly in District 1. But I also wanted to ask if, as part of the motion, if we could ensure, as it relates to broadband, if we could include it countywide, not just in incorporated areas. And let me tell you why, because 23% of households earning less than $50,000 do not have access to broadband subscription, while only 42% of people who live in unincorporated areas of San Diego County have fixed broadband, compared with 97% of people in urban areas. Between 20 and 40% of students in many of our local districts are underconnected and lack home internet access. And so using that model of the equity zip codes, I think it would be really important that broadband, we begin to look at, in my ideal world, we actually have connectivity available for everyone in the county, and one of these days that'll be the goal, that'll be what we achieve. But for now, as we have these resources, that we actually allocate some of these to be available countywide, not just in unincorporated areas.
I think you made a compelling argument for why that should be, and as the maker of the motion, I'm happy to accept that friendly amendment. Let me ask the seconder.
Yeah, happy to. And I just want to note that, you know, this is something I hear from so many students as well. And, you know, if we're really committed to equity, we need to be looking at our entire county, including in the unincorporated areas, but all of our county where broadband is woefully inadequate. So happy to accept that.
Thank you.
All right. So we have a motion by myself, second by Supervisor Lawson-Remer. Let me just restate the motion. We'll see if anyone has any additional comments to dedicate $10 million for broadband in San Diego County, $13 million for investments in stormwater, sewer, and drinking water, with the understanding we have to find a way to do more. $5 million for electric vehicle, $4 million for our local fire districts. Let's go to, I see Supervisor Desmond.
Yeah, I'm going to be bifurcating my vote. I'm in favor of the stormwater, the electric vehicle, and the investment in the fire districts. I'll be voting no on the broadband going countywide at this point in time. Thank you.
Supervisor Desmond, it's not, we've already bifurcated them into 13 different categories. I don't know that I think you have made clear I think you've made clear your position, and I think certainly understand that, but I think we're going to do an up or down vote on these items within this one category.
That's fine.
Great. Thank you, Supervisor Desmond. All right, now seeing any additional questions, we have a motion and a second. I'll ask the clerk to please call the roll.
Thank you. Supervisor Anderson.
Aye.
Supervisor Lawson-Remer.
Aye.
Supervisor Desmond.
Except I do not agree with the broadband being whittled down to 10 million and then going countywide. I think the unincorporated area is getting cheated here dramatically. So thank you.
Vice Chair Vargas.
Vargas, aye.
Chair Fletcher.
Fletcher, aye.
The motion passes unanimously with all supervisors being present and voting aye.
Recommendation 13 is just authorizing the auditor and controller to establish a trust fund for the American Rescue Act programs, an administrative function that we need in order to move forward. I'm happy to make a motion to approve recommendation 13. Is there a second?
Second.
We have a motion by myself, a second by Vice Chair Vargas. Let me see if we have any comments or questions from my colleagues. Nope. All right. Ask the clerk to please call the roll.
Thank you. Supervisor Anderson.
Aye.
Supervisor Lawson-Remer.
Aye.
Supervisor Desmond.
Aye.
Vice Chair Vargas.
Vargas, aye.
Chair Fletcher.
Fletcher, aye.
That motion passes unanimously with all supervisors being present and voting aye.
We're now going to carry on to agenda item number 4, receive update on comprehensive county substance use harm reduction strategy. I really appreciate and am looking forward to this as our folks get settled in. This has been a lot of work over a considerable amount of time as a county as we move forward, and I'm really excited to hear from Dr. Bergman and Dr. Wooten provide us an update on the action steps that will realize our board's direction that we provided in January to incorporate harm reduction strategies in our continuum of behavioral health and public health services. In order to truly realize this vision, we must lead with facts and evidence, not fear and blame. We need to invest in new types of workforce and training, housing opportunities, interventions to build trust, linkages to services. The goal is to have individuals heal and recover in a appropriate and way. We have to tackle the stigma of this issue and really move forward with our harm reduction interventions, including syringe, availability of naloxone, strategies that we know will save lives. And so I'm very excited that we are here today, and I'm very much looking forward to this presentation. And now that I've talked long enough for you all to get set up, I will turn it over to staff and let you carry it away.
Your board took action to prioritize evidence-based interventions through the expansion of harm reduction strategies to protect and support the health of our region. This work has been developed through a strong partnership by our county's public health services and behavioral health services divisions, and will establish countywide services that will enable us to robustly respond to community need. Today, we'll be providing an update on the comprehensive county substance abuse harm reduction strategy, inclusive of a syringe service program action plan as requested by your board. I'll turn it over now to Dr. Luke Bergman and Dr. Wimmu. Luke?
Thank you, Nick, and good morning. I'm so sorry, it was morning once. Good afternoon, Chair and members of the board. I've shown this slide to you before. as a means to indicate the terrible surge in overdose deaths over the last year and in the midst of the COVID pandemic. It shows a 200% increase overall and the quadrupling of the number of deaths with the super potent opioid fentanyl involved. If we look at these numbers in aggregate and annually, we see that just for 2020 alone, nearly 1,000 people died of drug overdoses in San Diego County. That's around 3 lives lost every day, many of them young, most connected to families that are still reeling, each of them sorting through what is for them a catastrophic, incalculable, unimaginable loss. And compounding these tragedies is the compelling reality that all of these deaths right here in San Diego County could have been avoided. Eliminating drug overdose death wouldn't be easy. Substance use has been one of our most vexing public health challenges for years, and we spend hundreds of millions of dollars across multiple agencies trying to address it. Historically, though, we know we haven't used all of the tools available to us. As a nation, we focused over the last 50 years on trying to curtail supply, which has proven nearly impossible. And more recently, we've begun making more serious investments in addiction treatment in efforts to diminish demand for substances, both licit and illicit, that are intoxicating. But despite our huge strides here, our challenges remain profound. The Substance Abuse and Mental Health Services Administration estimates that 90% of those with a diagnosable substance use disorder never access treatment. And partly because of this, we see massively disproportionate physical illness among those with histories of substance use. People with substance use disorder are 3 times more likely to wind up in the emergency department and 5 times more likely to be hospitalized than those without a substance use disorder. And as with so many other health metrics, we see stark disparities among communities that we know are disproportionately impacted by the social determinants of health. In 2018, Black residents had the highest rates of ED discharge associated with substance-related disorders in the county, 3.3 times higher than the county rate overall. Why aren't people accessing care? The reasons are complex, but experts who've considered this question are certain that part of the explanation lies in that our health systems, care systems meant to treat addiction, haven't sufficiently embraced the lower threshold expectations of a harm reduction approach. The fact is that at the population level, expecting people with substance use disorder to begin a course of treatment by making a commitment to sobriety hasn't worked. Conversely, a harm reduction approach establishes that a first priority is keeping people alive and helping them to get well, and that on the path toward increased wellness are opportunities to address addiction. And we already know that this works. Over 30 years of evidence from around the world has shown that harm reduction approaches reduce the spread of hepatitis C and HIV and reduce overdose deaths. These approaches lead to 5 times greater engagement with treatment, with no increases in substance misuse. It's with this evidence and these principles in mind, and with an understanding for the necessity of a broad interdisciplinary approach, that we've created an organizational structure, a population health steering committee, co-chaired by myself and Dr. Wooten, that has formulated a harm reduction strategy and syringe service program action plan for your consideration, and in response to the board's request from staff, dating back to late January of this year. The plan that we're presenting is divisible into 4 discrete but related strategic domains, which establish mechanisms for interinstitutional collaboration that account for key social determinants of health, and that take a health integrative approach with ongoing data evaluation woven into every domain and through every tactical intervention. Indeed, meaningfully reducing harms associated with substance use will necessarily be an interdisciplinary collaborative undertaking and will have to be built on a foundation of cross-sectoral convenings of County of San Diego business units, as well as health networks, community-based organizations, physical health entities, family and community voices. Integration across behavioral health, physical health, and community-based services is a key component of addressing the well-being of people at risk of harm. Treating the whole person and ensuring access to best practices and reducing harms guide this focus area. Substance use and homelessness often overlap, with homelessness exacerbating the harmful effects of drug use and vice versa. Being on the street and pushed to the margin increases all health risks, including those related to substance use. Housing, therefore, is a key pillar of a comprehensive harm reduction strategy. Finally, we are prioritizing the development of a workforce that is trained and skilled in the philosophy, approaches, and interventions of harm reduction. To move work forward in each of the strategic domains, we've structured the harm reduction strategy around immediate, intermediate, and long-term tactics. These are things that we are already doing, things will begin over the next year, and things that we will be planning for now that will have concrete implementation milestones in years to come. Through the rest of this presentation, and with acknowledgement that we are right in this moment in the midst of an overdose death crisis, Dr. Wooten and I will be focusing on some of the immediate tactical steps that we've taken or that we will be taking in the weeks to come. First, cross-sectoral convening. San Diego County has been a national leader in addressing drug and addiction-related issues through an interdisciplinary approach. In 1996, decades before the recent opioid epidemic gave rise to community collaborations across the nation, the meth strike force was established here. And a little over 10 years later, with prescription OxyContin use leading to massive upticks in ED visits and overdose deaths, the county established the Prescription Drug Abuse Task Force, or PDATF. These have been life-saving institutions and the settings for some of the county's most important responses to drug-related harms. Just last year, we worked together through both MSF and PDATF to launch a county-wide fentanyl warning campaign, which was received over 31 million impressions through physical and web placements. With the county's commitment to a harm reduction approach and with the opportunity to reset and best configure our work for the future, we're proposing the unification of these bodies formally into a single substance use harm reduction task force. This will make a structure more congruent with the ever-shifting nature of substance use in our communities, where polysubstance use predominates and where differently shaped substance use epidemics with different combinations of substances at play are constantly overlapping. A key feature of this newly established convening structure will be evenly shared governance between public health and public safety so that we can leverage all of our resources, personnel, and data in coordinated ways. A first order of business, for example, will be a collaborative effort to do real-time mapping of overdoses across our county. With contracts already combined, current executive leadership has already been working to harmonize these two venerable institutions, and in the coming months, we'll be creating a unified governance and committee structure aligned with harm reduction principles. While this new convening will enable the better coordination of public safety and public health, of law enforcement and healthcare, will also better enable the erosion of long-standing silos between care for addiction and mainstream healthcare. Our work within the drug Medi-Cal organized delivery system has done a lot to bring addiction treatment and mainstream healthcare closer together. Our strategic approach here will accelerate this with more attention to the use of medications for addiction and medications for the reduction of harms associated with substance use, along with proven public health practices like syringe service programs. To take a deeper dive into our immediate term work in this domain, I'll hand it over now to Dr. Wooten.
Thank you, Dr. Bergman. Chair Fletcher, members of the board. This slide provides an overview of the healthcare integration and access strategic domain and its activities and deliverables, which includes the naloxone distribution program and standing order, a community readiness assessment, and the syringe service program implementation plan. The first deliverable of this domain includes implementation of the naloxone distribution program. Naloxone is an emergency medication which reduces and reverses the effects of opioid overdoses. It is commonly utilized by first responders, law enforcement agencies, and community-based organizations that serve people who may be at risk of drug overdose and others who may know people at risk for overdose. There is an urgent need for naloxone to be distributed widely in our local community to prevent fentanyl-involved and other overdose deaths. Public health research reflects that broad community distribution of naloxone is a proven strategy to reduce overdose deaths. Broad distribution, coupled with training, helps ensure those who are using substances are carrying this life-saving medication in case it is needed in the event of an overdose. With the recently signed standing order for naloxone and the HHSA request to receive a free supply of naloxone from the State Department of Healthcare Services via its naloxone distribution project, the county is building on existing efforts to curb the local rise in overdose deaths. Among these efforts are the Emergency Medical Services Program Leave Behind Naloxone. This program enabled EMS agencies, first responders, and community organizations in California to contribute to reducing deaths associated with opioid overdose by distributing naloxone to those who would benefit following an emergency patient contact. Naloxone success depends on the level of saturation within the community. To achieve broad saturation, potential distribution sites and distribution methods are being evaluated in the context of population health data and operational efficiency. Information from this initial distribution effort will be used to inform any longer-term plan for expanding and sustaining broad community distribution. The Syringe Service Program Action Plan is shaped by 4 major activities, which will enable the county to realize this critical service locally. The first step will engage San Diego County stakeholders and residents so that the county ensures program planning and implementation efforts are shaped by community input. It is essential to convene the county enterprise around planning and implementation as well, including identification of any resource needs. This set of activities will bring together representatives of county leadership and business groups to meet, collaborate, and identify key operational and policy decisions. Critical to the program will be developing policies and procedures for citing, implementing, and monitoring syringe service programs. The work in this area will form the operational blueprint for the establishment, monitoring, and evaluation of this program. The final and fourth step is implementation and ongoing evaluation. The county will identify key measures associated with any permitted service, or rather syringe service programs, and collect data that can be used to assess effectiveness, including operational, program, and outcome measures. As this work progresses, staff is committed to providing ongoing updates on implementation and evaluation efforts. In the immediate term, staff will prioritize engagement with San Diego County stakeholders and residents through a community readiness assessment. The assessment will provide insights into residents' knowledge of syringe service programs, identify organizations and groups to support program development, and help the county to understand community concerns and objections. We are taking a very deliberate approach with this work, ensuring that the community is engaged along the way. We are committed to doing this right. To do this right, we must take the right amount of time. The procurement for the community readiness assessment is underway with the aim of having a contract procured by August of this year. We anticipate the readiness assessment activities will run through March of next year. Operationalization of service provision is estimated to occur from July 2021 through June 2022, with the establishment of the syringe service programs occurring in fiscal year 22-23. Thank you. Please welcome now back to the mic, Dr. Bergman.
Thank you, Dr. Wooten. The measures that Dr. Wooten describes will be critical for saving lives and improving wellness in cases where risks of harm are particularly immediate. We know that our longer-range efforts to make the greatest difference for those most at risk will be through housing, as we are now accustomed to saying housing is healthcare, health is housing. But traditionally, housing resources have not gone to those with primary substance use disorder. Worse still, it's been customary for people struggling with substance use to be explicitly excluded from housing services and permanent supportive housing programs. In order to make serious progress, we have to change that. Our immediate term work on this front has been focused through a collaboration with the city and has taken shape in the context of an ad hoc leadership council jointly led by the chair of your board and by the mayor of the city of San Diego. In this context, we have focused on a cohort that is often perceived as most difficult to reach and most in need of help, people with severe chronic substance use disorder who are chronically street homeless. And we have formulated a plan set to be implemented over the next 2 months that will create a combination of new outreach and engagement resources, which we call community harm reduction teams, or CHART, along with the establishment of safe haven transitional housing sites organized around harm reduction principles with a lowest threshold accessibility, with variable lengths of stay and focusing on the basic elements of wellness promotion: food, hygiene, connection to healthcare, and navigation to permanent housing. We plan to establish safe haven beds across 3 sites within the city in the coming months that will be coordinated with our CHART teams, which, with the city's collaboration, will be deployed in areas of intense need in the city where we've seen the rapid and alarming expansion of homeless encampments with reports of significant street drug use, including injection drug use. As intermediate and long-term investments create permanent supportive housing for people with primary substance use disorder or people with co-occurring conditions, these efforts will accelerate our movement of people in need toward these resources. Making these initiatives work, making them successful, will require us to be immediately active in a 4th domain: workforce. We've long been in something of a workforce crisis in behavioral health, with shortages in virtually every caregiving and clinical category. And with no previously established system of harm reduction services, we will face additional challenges in building up service capacity. Some of this we can achieve by threading a harm reduction orientation with and into the specialty care addiction system, where there's already profound knowledge and expertise. Recently, we in behavioral health have invested especially in developing peer support services within the drug Medi-Cal organized delivery system, provided by those with lived experience who explicitly reference points of common experience and identity between themselves and service recipients. We've done this through a contract with a local training entity and through the establishment of a county peer support FTE to work with providers in coordinating peer-driven services. Peer work is absolutely fundamental to a harm reduction approach, situating client and caregiver in the least difficult power dynamic and making it demonstrably easier for clients to engage earnestly in working with caregivers. Key here also will be a peer workforce that looks and talks like the people they're working with. Important points of common identification are not just experience with drug use, but cultural and demographic connections as well. As part of the CHART and Safe Haven launch, we will be devoting resources to harm reduction trainings for all staff, and learnings from this will become the foundation for future harm reduction workforce development. Finally, we look forward to opportunities to create a harm reduction emphasis in the Behavioral Health Workforce Conference that the chair has proposed for later this year and that will be restaged annually in the future. Over the next year, we aim to accomplish a great deal across the 4 strategic domains that we've discussed today. As our immediate work is realized in the coming months, we'll be simultaneously continuing to flesh out plans for additional intermediate and long-term tactics. And we'll look forward to reporting back to this board on the future successes of these efforts. Again, today's action is that you receive an update on the comprehensive county substance use harm reduction strategy, inclusive of a syringe service action plan, and we're now happy to take any questions. Thank you.
Thank you, Dr. Bergman, Dr. Wooten, and Nick Mascione. We appreciate that. At this point, we'll ask the clerk to call forward the public speakers on this item.
Thank you, Chair Fletcher. We have 17 requests to speak on this item, 2 in person and 15 requesting to speak by phone. Also note for the record that we received 8 e-comments on this item. Any members of the public that requested to speak on item 4, please dial into the conference line now using the instructions that were provided to you. We will begin with the in-person speakers. I'd like to invite forward Laura Beatles and Tara Stamos-Biseg. You'll have 2 minutes to address the board, and I'll ask you to please state your name for the audio record.
Thank you for having me. 20 years ago, my first job at San Diego Youth Services after graduating from UCSD was a street outreach worker. The program was funded by the state to address intravenous drug use amongst transitional age youth experiencing homelessness or commercial sex exploitation. At the time, the hepatitis C endemic, as well as HIV, was one of many concerns. Without an above-ground safe syringe program for youth not ready for treatment, we could only provide public health awareness. We encourage youth to rotate their injection sites, attempt to clean their sites and needles, and to not share their needles. We spent a lot of time trying to coach the youth so that they would hopefully feel comfortable calling 911 if a buddy was overdosing. 20 years later, I am grateful that Narcan resources are more readily available and that you all today are considering continuing to support a more comprehensive substance use harm reduction strategy to include syringe service programs. I am now a director of behavioral health services at San Diego Youth Services, 20 years later, and I'm a licensed clinical social worker. Then and now, I strongly support comprehensive public health models that include harm reduction, where when you work with harm reduction, you meet clients where they're at, and you join them in their suffering on their healing journey. Thank you for your time today. Thank you for your support on this comprehensive plan.
Thank you. Next speaker, please.
Good afternoon. Thank you, members of the board and Chair Fletcher. My name is Tara Stamos-Bisig. I am the executive director and founder of the Harm Reduction Coalition of San Diego. Our syringe service program is on point. Last year, we came in front of the Board of Supervisors to lift this ban and walked away a little bit empty-handed. And in the meantime, we were impacted by COVID and overdose deaths continued to uptick. I applied for a grant, went through the state, the California Department of Public Health, received a grant, and since October, we have enrolled more than 1,400 unique individuals into our program. A good portion of those have not accessed any other harm reduction syringe service program, and often we are the only access point for individuals. We're providing safe smoking and safe injecting supplies to people, and we provide fentanyl test strips for individuals and Narcan. My husband and I went up last weekend to LA and picked up 7,000 doses of Narcan in my car, and it's hitting the streets. Last week we distributed more than 300 doses, and there were 40 lives reported being saved just by the doses of Narcan that we provided, minus the help from the county. So just 40 people just from last week are still alive because of the work that harm reduction allows. And I strongly encourage and support the adoption of the county's harm reduction strategy, and I look forward to working with everybody to meet people where they're at, walk people through continuums of care, and help individuals find the ability to find purpose, to turn that pain into passion, and that's going to take something different. We have been throwing treatment at people for a long time, and there's plenty of treatment now. It's time to bridge that gap and walk people back. Thank you very much.
Thank you. Now we will hear from those that requested to speak by phone. We'll be calling speakers by the last 4 digits of their phone number. You'll hear a notification that your call has been unmuted. You will then need to press *6 to unmute your phone. We'll ask you to please state your name for the audio record. I would remind the callers that they should mute their TV or live video stream before they begin speaking. And if you could please identify the first caller.
Our first caller is 2363. 2363, please press *6 to unmute. I can see that you've unmuted, but you may need to unmute your phone as well.
Thank you. Sorry about that. Good afternoon. Lisa Jones, Executive Vice President of Strategic Initiatives on behalf of the San Diego Housing Commission. The Housing Commission supports the proposed county harm reduction strategies. These strategies are essential to connecting with individuals experiencing homelessness who are traditionally more reluctant or unable to accept services. Harm reduction strategies are based on research and evidence-based approaches and will serve as a model of best practices going forward. They focus on reducing barriers to services and housing for this vulnerable population. Making services and housing more accessible to this population is an important part of the Housing First approach to addressing homelessness. Housing First has proved to be an effective approach to creating housing solutions in the San Diego region by identifying the best housing option to meet someone's unique needs and providing the appropriate level of services to reduce challenges and support access to critical wellness and stabilization resources. The Housing Commission looks forward to continuing to collaborate with the county, the City of San Diego, the Regional Task Force on the Homeless, and service providers to address substance use issues among those we are trying to serve. We are committed to continuing to work together to provide the most appropriate resources to people experiencing drug addiction and other health conditions who are among those with the highest needs in our community. Thank you.
Thank you. Our next speaker is 8407. 8407, please press *6 to unmute.
Good afternoon. Well, I guess it was morning and then afternoon, early evening now. Well, good morning, supervisors. This is Jim Taylor, a third generation East County District 2 resident and BHAB member representing District 2. I'd like to state that I'm in favor of item 4, the comprehensive substance harm reduction strategy. Because it seems like it's going to work and we need to do something. I've heard before I became a member of the board from many of my family members, church members, members of the community about how the county was going to install basically a shooting gallery into East County, into our rural community. And once I became a member of the board and I had the chance to listen to what Dr. Bergman had to say and look at the materials, and plus from my own experience, I had a close family member OD, I had a good friend OD, and my brother almost died. And they did it all without needles and without being, well, in my brother's case, he was homeless, but the other two were not homeless, they were not jobless. So it can happen to anybody. And I'm entirely in favor of the adoption of this policy. I think it's going to be great for the community, and anything that we can do to save lives, let's do it. This is not about squandering money. This is about saving lives. So thank you.
Thank you. Our next speaker is 6608. 6608, please press *6 to unmute.
Chair Fletcher, esteemed supervisors. My name is Marissa Ferrand, and I am honored to comment in support of the Comprehensive Harm Reduction Strategy as the chair of the San Diego Alcohol and Drug Service Provider Association. Our diverse coalition represents 36 legal entities and 75 SUD-related programs across all 5 districts that together delivered SUD treatment to more than 18,000 San Diegans last year through contracts with county behavioral health services. While treatment providers have done an extraordinary job providing high-quality clinical services to meet the increasingly complex needs of the clients we serve, we have long known that not all individuals are ready for treatment, and that we have to meet individuals where they are in their process, no matter how long or windy that road to recovery may be. The strategy proposed today provides an important starting point for building out a fuller continuum of care and a stronger safety net that recognizes that cessation of all drug use is not the only criteria for successful interventions and policies. Harm reduction strategies have broad applications, including in various treatment settings before individuals ever seek treatment and in settings that may have never been involved in this work before. From naloxone distribution to communicable disease prevention, from recovery-oriented housing to lower barrier options, from integration into mainstream healthcare to investment in community-based programs, San Diego has both an opportunity and an obligation to develop a more robust toolbox to prevent and reduce substance use, misuse, overdoses, and overdose deaths. As you will hear, an ad hoc subcommittee of ADSPA developed a harm reduction framework earlier this year that both complements and builds upon the vision and strategy proposed today. We look forward to using our expertise and representative voice to participate in this body of work with the county and other cross-sectoral partners, especially as it relates to strengthening on-ramps to treatment as individuals become ready. Thank you again for the opportunity to support this vital work.
Thank you. Our next speaker is 9415. 9415, please press *6 to unmute.
I believe I'm here now.
Yes.
Good. I said good morning in my prepared notes, but good afternoon, early evening, supervisors. I'm Ron Stark. You know me in a variety of roles. But today I'm speaking to you as Substance Use Prevention Committee Chair of the Alcohol and Drug Service Providers Association, known as ADSPA, in general support of the county's proposed harm reduction strategies. As our chair, Marissa Vrange, eloquently stated, we appreciate that the county envisions a community where the impacts related to substance use are seen as a crisis that influences overall health, well-being, and quality of life of individuals, families, and the community at large, and where we realize a community free of substance use-related harms This is in alignment with ADSPA's harm reduction guidelines that I co-chaired the development of with 12 of our providers, where we view harm reduction as a set of policies and practices intended to prevent and reduce substance use, misuse, overdoses, and overdose deaths. The key phrasing in this is to prevent and reduce substance use related harm on the community at large, and especially those who use drugs. ADSPA's guidelines suggest increasing naloxone availability, training, and storage for staff, client, and the general public, thus increasing the overall capacity to reverse opioid overdoses when they occur and ultimately prevent opioid-related deaths. Given the increase of fentanyl overdoses and deaths, ADSPA is encouraged that the county's strategy places emphasis on optimizing and expanding naloxone distribution to the substance use disorder workforce, prevention, the community at large, and to clients who may have family members who are using opioids. Thank you for your time.
Thank you. Our next speaker is 2153. 2153, please press *6 to unmute. 2153.
Good afternoon. My name is Kelly McCormick, and sorry, one moment. I am a resident of District 5, and I run a youth mentoring group, and I've worked as a journalist and a public health educator. If harm reduction is the county's goal, then one of the best strategies would be to prevent the use of marijuana by teenagers and young adults. Doctors categorize substance use disorder as a pediatric onset disease. 9 out of 10 adults with substance use disorder began smoking, drinking, or using other drugs before the age of 18. The earlier and heavier the use, the more likely a person will be to develop later problems with addiction. It's a disturbing trend that the number of teens who vape marijuana has increased dramatically in the past 4 years. According to the California Healthy Kids Survey, use by high school juniors jumped from 2% in 2017 to 17% in 2019. For youth, all substance use is related, which means that using one substance is associated with using others. Preventing youth substance use is vital. As you're likely aware, the brain is still developing until around age 25, and if you influence a developing brain with THC, it will develop differently. I would like to share the words of Dr. Ranit Lev, Director of Emergency Medicine at Scripps Mercy Hospital. Dr. Lev said recently, "I have yet to meet a patient in my ER from a drug overdose who did not start their drug use journey with marijuana, not one." You say the county's harm reduction strategy is informed by community members with lived experience. Have you asked these stakeholders what drug they started with and at what age? Please ask them and let their answer guide your future actions. Thank you.
Thank you. Our next speaker is 3496. 3496, please press *6 to unmute.
Good afternoon, supervisors and staff. Thank you for this opportunity to speak to you today. My name is Jean Duffy, and I have lived in unincorporated San Diego County for 27 years. I commend you for your efforts to create a county substance use harm reduction strategy, and I encourage you to actually make this a comprehensive strategy that not only engages experts in the fields of drug addiction, overdose, and death, but also engages other experts from the public health community. Syringe services, programs, and naloxone distribution only make up one part of an effective harm reduction strategy. You need to include enforcement, education, and especially prevention. Preventing youth access to drugs reduces use, which reduces the cycle of addiction, which has become such a problem in our county. This should include prohibiting marijuana cultivation, distribution, and retail sales, not the promotion of the commercialization of addiction. Show me a fentanyl addict that didn't first start with marijuana. Marijuana use is a pathway to harder drugs, and studies link marijuana use to depression, anxiety, psychotic episodes, and suicide. Harm reduction should not be a standalone strategy. It is a necessary step towards a broader reform Please consider public health and proven data-driven prevention strategies for long-term solutions. Make marijuana and other drugs less accessible to keep them out of the hands of our young people. It's up to us adults and you as our county leaders to protect them. Thank you.
Thank you. Our next speaker is 4917. 4917, please press *6 to unmute.
Good evening. Can you hear me?
Yes.
Yes, you can hear me? Hi, my name is Erica Leary, and I've been a prevention advocate in North County for over 25 years. There is no doubt we are in the midst of a drug crisis, with overdose deaths nearly tripling from 2019 to 2020. And harm reduction strategies such as widespread naloxone distribution and needle exchange programs can be an important part of a public health response. But simply administering naloxone or clean needles without a strong commitment to steer those suffering into treatment and recovery falls short of the county's Live Well initiative of building better health, living safely, and thriving. Treatment and recovery are possible, and helping people achieve it is true compassion. An important tenet of harm reduction is to meet people where they are, but not leave them there. An emphasis on harm reduction without an even stronger focus on preventing substance use in the first place will simply be harm creation, not harm reduction. Decades of research tells us that 90% of those who suffer from substance use disorder started their drug use before the age of 18, primarily with the most accessible substances of alcohol, tobacco, and/or marijuana. It's troublesome that this is not the first time this board discusses the need for harm reduction the day before you discuss the benefits of expanding a marijuana industry, an industry that will target young people with billboards, social media marketing, flavored, highly potent dabbing and vaping products, and slogans like happiness delivered to your door, which is Oceanside's first delivery operator slogan that they send out in the neighborhood. We need a comprehensive approach to prevent and reduce the devastating impacts of substance use. We have the research, the data, the tools, the partners, and the opportunities to implement it. We just need the will of the policymakers to make it happen. Thank you.
Thank you. Our next speaker is 8443. 8443, please press *6 to unmute.
Good afternoon, Supervisors, and thank you for your time. My name is Lahela Maddox, and I am the Chief Operations Officer for the Regional Task Force on the Homeless, also known as RTFH. RTFH is a strong partner in this work, and we felt it imperative that we express our support of the harm reduction strategy presented today. Oftentimes, individuals who are interested in reducing their use, but not necessarily eliminating it, are excluded from programs and services, specifically housing. Harm reduction incorporates a spectrum of strategies that include safer use, managed use, abstinence, meeting people where they are at, and addressing conditions of use along with the use itself. As subject matter experts on best practices in addressing homelessness, our region continues to have an urgent need to provide a support system that also provides services to populations that are traditionally resistant to accepting services or are in need of a broader spectrum of services. RTFH has been collaborating with the city, the San Diego Housing Commission, the county and behavioral health services to identify strategies and best practices and focus on low barrier access to services and viable housing options that align with Housing First policy. Housing First is immediate access to housing with no preconditions, client choice and self-determination, individualized and client-driven supports, and persistent engagement. This means housing is at the center of any plan, and rules are based on behavior, not sobriety. Residents are offered support services, but participation is not a condition of keeping their housing. RTFH remains committed to supporting these efforts to work towards safe and secure housing for all, and believe the harm reduction strategy presented today supports that work. As we all know, housing ends homelessness and improves functioning and overall health. Thank you.
Thank you. Our next speaker is 2708. 2708, please press *6 to unmute.
Good evening. I'm Keely Halsey, Chief of Homelessness Strategies for the City of San Diego. Thank you for providing time today to speak on behalf of Mayor Todd Gloria. The Mayor's Office asks for your support of this item due to its importance to individuals experiencing homelessness. As Dr. Bergman mentioned, in the past several weeks, the city and county staff have been meeting regularly and working closely on how our agencies can best align funding on the critical issue of substance abuse treatment. The concept of looking at our programs through a harm reduction lens is something that comes up in each of our conversations. Your team has provided us information showing that harm reduction strategies utilized properly and applied widely could give individuals experiencing homelessness a better chance of success at accessing programs and accessing and maintaining stable housing. We see people suffering on our streets, and in many cases, our outreach workers, service providers, and law enforcement officers lack some of the tools necessary to provide them the care that they need. An even stronger public health approach using these strategies, coupled with the significant investment the city has made in expanding and strengthening its homeless services system, will give us the best chance to help these individuals succeed. We appreciate the county's focused attention to this important issue and look forward to continued collaboration. Thank you for your time.
Thank you. Our next speaker is 3701. 3701. If you'd like to speak on this issue, please press *6.
Good afternoon. My name is Carissa Shepard. I'm a clinic director with Acadia Healthcare, calling to speak in favor of the substance abuse harm reduction strategy. With the plan presented today, we can reach many more people in need and create a truly continuous and comprehensive system of care. Syringe service programs have shown that new users of such programs are 5 times more likely to enter treatment and 3 times more likely to stop using drugs than those who do not use these services. And in combination with medication-assisted treatment, have reduced HIV and HCV transmission by more than 2/3. We strongly support initiatives for access to care and services to those most in need. Thank you.
Thank you. Our next speaker is 9971. 9971. Please press *6 to unmute. 9971. If you'd like to speak on this item, please press *6 to unmute. We'll come back. Our next speaker is 8807. 8807. If you'd like to speak on this issue, please press *6 to unmute.
Hello, my name is Wendy Vieira. I'm a behavioral health psychologist with over 25 years experience working with individuals with addiction and mental illness. Currently, I'm the Director of Behavioral Health Operations for Neighborhood Health Care, a federally qualified health center that provides comprehensive health services to our community. At Neighborhood, we strongly support harm reduction models for individuals with substance use disorders. We understand the only way to have a lasting impact with these individuals is to meet them where they're at, which you've heard several times today. You need to do this by having low barrier access modes of care in an environment that does not judge and supports the dignity of those we serve. That reduces access barriers by having an integrated model of care with medical, behavioral health, and access to social services in a primary care setting by partnering with our community-based organizations and utilizing evidence-based treatment. There's a wealth of evidence-based data that demonstrates the effectiveness of harm reduction models of care. We need to make sure services are easy and convenient to access, that they are inclusive and stigma-free. I'm very excited to see the county consider implementing a harm reduction strategy for substance use disorders. Syringe service programs have been shown to reduce transmission of HIV and Hep C, increase engagement in treatment services, increase the likelihood of stopping opioids, and decrease the number of disposed needles on our streets. Having a place where people can safely dispose of used syringes and get clean new syringes would provide us with an opportunity to engage them in treatment for their addiction. We would also have the opportunity to provide much needed medical and psychiatry services to this population in a space they would feel safe and welcomed. I'm very much in favor of continuing to expand access to naloxone kits that they can, so that they can be used to reverse opioid overdose and save a life. Having naloxone in hand to provide patients when they are receiving other services removes the barrier of having to go to a pharmacy and pick one up. Removing barriers making service easy and convenient is critical.
Thank you.
Thank you for your time and consideration.
Thank you. Our next speaker is 1665. 1665. Please press *6 to unmute. 1665.
Hi, this is Scott Suka. I'm the Executive Director of the Liver Coalition of San Diego. Our mission is to save lives by improving liver health and preventing liver disease through community-based education, linkages to care, advocacy, research, and other programs. There are over 100 different liver diseases, with hepatitis C being the leading cause of liver disease in the United States. It is with that focus that I'm here today to lend our support of item number 4, the County of San Diego's Comprehensive Harm Reduction Strategy. In November of 2018, the Eliminate Hepatitis C San Diego County Initiative was approved by the San Diego County Board of Supervisors, with the board asking the Health and Human Service Agency to return in 12 months with recommendations. Over that 12-month period from November 2018 to November 2019, community partners and stakeholders met and developed the recommendations report that was approved by the Board of Supervisors on March 10, 2020, with 9 recommendations that would need to be addressed to reach the following overarching elimination targets: an 80% decrease of incidence of chronic hepatitis C by 2030, and a 65% reduction of hepatitis C mortality by 2030. Recommendation 2 was to implement prevention strategies in alignment with current best practices, to increase access to program services and activities to reduce harm, increase availability and ensure access to substance use disorder and mental health treatment. Later this month, we will be returning to the Board of Supervisors with our implementation plan for the Eliminate Hepatitis C San Diego County Initiative. We feel that this comprehensive harm reduction strategy is in alignment with our initial recommendations report and further support the key strategy and tactics in our forthcoming implementation plan. Thank you.
Thank you. Recalling 9971. 9971. If you'd like to speak on this issue, please press *6 to unmute. 9971. Please press *6 to unmute.
Chair Fletcher, we're not seeing any movement with that line. That concludes public comment on the side.
Thank you. I want to thank everyone who called in, and again, my appreciation to Drs. Bergman and Wooten, Nick Machione, and the entire team for getting us here. I'll make a motion to receive the report. That's the only action before us today, and very much looking forward to all of our future actions. Is there a second to that?
I'm happy to second. I also have a couple questions.
Please, Supervisor Wasserman.
Thank you. Very happy to second. I think this is extremely exciting. I think I just wanted to better understand how incarcerated individuals would or would not be benefiting from this program currently designed.
Thank you. So we know that people with justice involvement are at higher risk of harmful substance use. Rates of substance use within our jails is extremely high. We estimate around 75 or 80%. So as people are moving between the jail setting and community settings, this would be a site to which we would aim actively to engage potential service recipients. We also know that people who are leaving episodes of incarceration are particularly at risk of overdose death. I think the numbers there are something like around 70–75% higher risk of overdose death after leaving an episode of incarceration. So incredibly important, and some of this work is already happening to connect those people with naloxone, and then also to connect them with ongoing care. If they are folks with histories of substance use or active substance use disorders.
That's super helpful. But just to be clear, so those are all sort of points of intersection with people who are moving between facilities or being released from incarceration. But as currently designed, this will not actually be a program available to people who are currently incarcerated in our jails.
Well, so elements of it. I think it's fair to say elements of it will be naloxone availability, for example. There are not currently plans to establish clean needle availability within our jails. But naloxone is a key dimension of this, would be. And then, so much of what we've emphasized in this conversation is about access to care. Access to services that improve wellness overall, like primary care. And those kinds of basic need provision services that enable, as one of the callers noted, enable more opportunities for engagement that then lead to these much higher rates of engagement in formal treatment for people who are in harm reduction programs. So it is at that point of intersection where there would likely be the most kind of meaningful opportunity for people.
But what about in the, like, I mean, again, I'm just trying to make sure I've got to understand my head. It's that my understanding is that you need to be particularly trained in medically assisted treatment. So are the people who are in our jails going to be supervised by medical personnel who have this training, or would that need to be sort of an additional action that we would take later to build on this program?
Just one quick thing, Dr. Bergman, before you do that. In addition to Dr. Bergman, we have Dr. Montgomery from the Sheriff's Department on the line who could comment on this as well. Yeah, didn't mean to interrupt. Just want to highlight that. And then also state, as the sheriff stated, in the presently, there's no medication for addiction treatment in the jail. There's also not in the current budget medication for addiction treatment, and that's something I'm interested in as a part of our change process to get medication for addiction treatment by clinicians in our correctional system to provide those services. And I think we'll have to deal with that as we go through the budget process.
That's super helpful. So just to clarify, because I wasn't, so it sounds like it's not there.
Not yet.
But we will make it there.
We are going to make it there.
Great.
Yes.
Thank you.
Thank you. Okay, perfect. Thank you. Thank you. Let me just ask, Dr. Montgomery's on the line. Let me just ask if you have anything you'd like to add.
Yes, good afternoon, everyone. Chairman Fletcher, esteemed members of the Board of Supervisors, thank you for the opportunity to speak. I certainly appreciate it. This was a wonderful presentation. I take this opportunity to applaud the opportunities presented to ourselves. This is a great opportunity to collaborate with our counterparts in HHSA. We are looking forward to continued engagement in this regard. We are currently discussing the development of a medication-assisted treatment / therapy program, MAT, within the custodial sessions. And we are certainly evaluating the logistical and personnel requirements. This is an ongoing process as we develop a more robust program.
Thank you, Dr. Montgomery. And I know we appreciate that. We want that ongoing process to, we got to land the plane here pretty quickly because we have budget deliberations coming up. But I know that's, I know very important Supervisor Wasserman and myself and others, we do that. So thank you. Okay. Anything else, Supervisor Wasserman? You good? Okay. Supervisor Anderson.
I'm all squared away. Thank you.
Okay. All right. We have a motion by myself, seconded by Supervisor Wasserman to receive the report. Supervisor Desmond.
Thank you very much, Mr. Chair. I appreciate all the work that's been done on this issue. However, I fundamentally cannot support a needle exchange program that's inclusive in the update that we're receiving today. There's no doubt that in COVID and in particular the lockdowns that has exacerbated the drug and overdose epidemic. Overdose in the region are at all-time high with a threefold increase in the fentanyl deaths. And I believe we're on pace, unfortunately, to see over 1,200 overdoses here in 2021. The naloxone training and distribution, I think, is very good. And the fentanyl fentanyl overdoses at the all-time high, I think it's very timely. However, though, reducing harm doesn't necessarily reduce usage. And I think giving out needles, in my opinion, promotes the continued drug use. So I'm not in favor of the needle exchanges. However, I am in favor of addressing our drug crisis here in the county. I appreciate all the work that staff has done on this issue, but I cannot be supporting the item. Thank you.
Thank you. All right, we have a motion and a second. Seeing no additional requests to speak, I'll ask the clerk to please call the roll.
Thank you. Supervisor Anderson.
Aye.
Supervisor Lawson-Remer.
Aye.
Supervisor Desmond.
No.
Vice Chair Vargas.
Vargas, aye.
Chair Fletcher.
Fletcher, aye.
That motion passes with Supervisor Desmond voting no, all other supervisors being present and voting aye.
We're now going to move to agenda item 10, Office of Immigrant and Refugee Affairs, an item I'm pleased to bring forward with Vice Chair Vargas. Ask members of the public who wish to speak on this item to call in at this time. And I will go first to Vice Chair Vargas.
Thank you, Chair Fletcher. Primeramente quiero decir que la oportunidad de crear la Oficina de Asuntos Inmigrantes y Refugiados en el Condado de San Diego es algo muy personal para mí. Tuve el honor de servir como la primera directora de la Oficina de Asuntos Migratorios en la ciudad de Los Ángeles a principios de la década del 2000. En su tiempo fue la primera oficina de su tipo en el oeste de Estados Unidos. Fue un honor para mí liderar los esfuerzos de esto entonces y me enorgullece poder introducir esta iniciativa con el presidente de la Junta de los Supervisores, el supervisor Fletcher. Hoy, en el 2021, me gustaría poder decir que las cosas han cambiado para los inmigrantes y los refugiados en nuestro país. Desafortunadamente, eso no es el caso y la necesidad de esta oficina es aún más importante hoy en día. Nuestras comunidades han sido atacadas durante mucho tiempo y las cosas no han cambiado. Los últimos 4 años de ataques dracónicos contra inmigrantes por parte de nuestro expresidente no son nada nuevo. Mi propio activismo político se originó del miedo que provocó la proposición anti-inmigrante de Pete Wilson, la proposición 187, en nuestras comunidades a principios de los 90. Y ahora, como la primera inmigrante parte de esta Junta de Supervisores del Condado de San Diego, me comprometo en asegurarnos que nuestro condado ejerza su liderazgo con principios humanitarios. Estoy segura de que mi historia resonará con la historia de muchos. Como inmigrante de la primera generación, la integración en este país no fue fácil. Después de aprender el idioma y el sistema educativo hasta navegar las instituciones corporativas y gubernamentales, no solo para mí, sino también para mis padres y mi familia. Para muchos niños inmigrantes esto es normal. Somos los traductores, asesores legales, navegadores de salud y asesores financieros de nuestros padres cuando ellos se enfrentan con barreras de idioma y ajustes culturales en general. Recuerdo lo difícil que fue aprender el idioma y luego tener que traducirlo todo del español al inglés como estudiante de ESL cuando era muy joven. Y yo fui una de las afortunadas porque tuve la oportunidad de regresar a mi país de origen cuando muchas personas no tienen ese privilegio. Pero todos estos desafíos se convirtieron en oportunidades para comprender de primera mano cómo funcionaba el sistema. Y es por eso que he hecho todo lo que está a mi alcance para garantizar que sea fácil para otros emigrantes y refugiados. Solo en un país como este, una niña inmigrante de Tijuana abrirse un camino para un día trabajar para el presidente de Estados Unidos y para tener un lugar en esta Junta de Supervisores y para trabajar por el bienestar de nuestras comunidades más vulnerables. En hora de hacer cambio es un sistema que no fue creado para nosotros y hacer que el gobierno trabaje para todos, no solo para algunos. Salud. Muchos de nosotros hemos tenido que elegir un nuevo comienzo debido a la violencia, la persecución política, la injusticia económica o la interferencia del gobierno de los Estados Unidos que ha incapacitado a otros países. Quiero hacer una clarificación. Buscar asilo es un derecho legal en los Estados Unidos, según lo establecido en 1952 por la Ley de Inmigración y Nacionalidad. Y un refugiado es una persona que se ha visto obligada a abandonar su país para escapar la guerra, la persecución o un desastre natural. A través de la Oficina de Asuntos Inmigrantes y Refugiados tenemos la oportunidad de cambiar el relato y elevar la contribución de nuestras comunidades inmigrantes y refugiados. San Diego es uno de los asentamientos de refugiados más grandes del país. Somos una región internacional, multilingüe y multicultural. Es hora de que el Condado de San Diego sea líder en proveer recursos y servicios que ayuden a cubrir las necesidades de nuestras comunidades inmigrantes y refugiados. Así como yo tuve grandes sueños, quiero que todos los inmigrantes y refugiados sepan que pueden soñar y lograr lo que se propongan en su mente y corazón y que nosotros como condado trabajamos para apoyarlos. I just want to mention that creating the Office of Immigrant and Refugee Affairs is very personal to me. I had the honor of serving as the first director of the Office of Immigrant Affairs for the city of Los Angeles back in the early 2000s. It was the first office of its kind in the West Coast of the United States. It was an honor for me to lead the efforts back then, and I'm proud to be co-docketing this item with you today, Chair Fletcher. Unfortunately, as we fast forward to 2021 from those days, I wish I could say that things have changed for immigrants and refugees in our country. But unfortunately, the need for this office is greater now more than ever. Our communities have been under attack for far too long. Unfortunately, much hasn't changed. The last 4 years of draconian attacks on immigrants by our former president isn't anything new. My own political activism stemmed from the fear-mongering that Pete Wilson's anti-immigration Prop 187 caused in our communities back in the early 90s. And now, as the first immigrant serving on the San Diego County Board of Supervisors, I'm committed to ensuring our county leads with humanitarian principles. I'm sure that my story will resonate with many others. As a first-generation immigrant, integrating into this country wasn't easy. From learning the language, the educational system, to navigating corporate and government institutions, not only for myself, but for my parents and my family. For many immigrant kids, this is our normal. We serve as our parents' translators, legal advisors, health navigators, financial advisors when we face with language barriers and overall cultural adjustments. I remember how difficult it was to learn the language and to have to translate everything from Spanish to English as an ESL student when I was younger. And I was one of the lucky ones because I had the opportunity to go back to my country of origin where so many don't have that privilege. But all of these challenges become opportunities for me to understand firsthand how the system worked, and I have done everything in my power to ensure it's easier for those that are coming after me. Only in this country can an immigrant kid from Tijuana work her way up to serve under the President of the United States and let her fight to have a seat at this table to ensure the well-being of our vulnerable communities. It's time to make changes to a system that wasn't made for us. It's time to make government work for everyone, not just some. So many of us had the chance to choose new beginnings due to violence, political persecution, economic injustice, or the interference of the US government that has disabled our countries. To be clear, seeking asylum is a legal right in the United States, and it was established in 1952 by the Immigration and Nationality Act. And being a refugee is a person who has been forced to leave their country in order to escape war, persecution, or a natural disaster. Through the Office of Immigrant and Refugee Affairs, we've had an opportunity to shift the narrative and elevate the contributions of our immigrant and refugee communities. San Diego is one of the largest settlements of refugees in the nation. We are an international, multilingual, and multicultural region. It's time for San Diego County to lead in addressing the needs of our immigrant and refugee communities. 20% of our county population was born in a different country. 68 languages are spoken in this region. We are a vibrant and colorful community that is strong because of the economic and cultural contributions from our immigrant and refugee residents. With the Office of Immigrant and Refugee Affairs, we will further our vision of building healthier and stronger communities by connecting individuals and families to the many services offered by the county. We are, after all, the safety net for the residents of our region. Just like I had big dreams, I want every immigrant and refugee to know that they can dream and achieve whatever they set their mind and heart to, and we will work to support you. I'm grateful to our coalition of 50+ community partners that have been at the forefront doing what's right. I respectfully request my colleagues to support this motion, and in the words of Lin-Manuel Miranda, let's remember, immigrants, we get the job done.
Thank you. Thank you, Vice Chair Vargas, and pleased to join you in bringing this item forward. I want to say a special thank you to the over 80 organizations that are partners in the Invest in San Diego Families Coalition, the San Diego Refugee Community Coalition, San Diego Immigrant Rights Consortium, to name just a few. All of you who have weighed in, support, helped us in developing this policy, and we know will work with us as we move forward into the future. The American story is the story of courageous families who bravely came to America from every part of the world, seeking new possibilities and help to build and strengthen every aspect of our lives. It is so much a part of who we are. We put a statue with a plaque facing outward from our country saying, "Send us your tired, your poor, your huddled masses yearning to breathe free." I happen to believe we meant it when we put that there. And I think as we move forward as a county, this gives us an opportunity to send a message that we welcome those and we stand ready to assist and help. And I'm very pleased to bring forward this item in partnership with Vice Chair Nora Vargas and all those organizations represented. At this point, we're going to go to our public speakers on this item. We have a considerable number of public speakers, and we want everyone to make your voice heard. But if someone has made the point that you would like to make, feel free to just say, I echo the comments of those previously, and support or in opposition to the item, and will help us facilitate through here. But want to make sure everyone has a chance to have their voices heard. So we will go first to our speakers who are in person, and then we will go to those who are contacting us remote, and then we'll return to the board.
Thank you, Chair Fletcher. We have 99 requests to speak on this item, 5 in person and 94 requesting to speak by phone. Also note for the record that we received 251 e-comments on this item. Any members of the public that requested to speak on this item by phone, please dial into the conference line now using the instructions that were provided to you. We'll begin with the in-person speakers, those in favor of the item. I'll be calling the following individuals: Shadia Omer, Humaira Yusufi, Arnolfo Manriquez, Mavash Alami, and Fardosa Osman. If you could please line up on the physical distancing stickers in the hallway and come in individually to the podium. I'll ask you to please state your name for the audio record. You'll have 2 minutes to address the board.
Hello, my name is Shadia Omer, and I'm representing San Diego Refugee Communities Coalition. to support the creation of an Office of Immigrant and Refugee Affairs. I'd like to say San Diego is one of the most diverse counties in the country. Located on an international border, we have folks seeking asylum from all over the world. We are here, a home to a significant refugee community and historic immigrant community as well. Our communities here need real investment from the county to navigate county, state, and federal resources. I also believe this office is needed so that our immigrant and refugee communities can receive accurate information in their preferred language and in a safe and welcoming environment regarding available services and to be informed about their rights. I really urge you to support Chair Fletcher and Vice Chair Vargas's measure to create the Office of Immigrant and Refugee Affairs in San Diego County. Thank you for your time.
Next speaker, please.
Good afternoon. My name is Firdousa Osman. I'm here representing United Women of East Africa. I'm here to urge you to support the creation of Office of Immigrant and Refugee Affairs. The pandemic has been most difficult for our low-income immigrant families that we serve. Our families need additional support to help us recover from job loss, the inability to pay rent, and the loss in support for our children's schools. The county receives millions of dollars that go towards refugee resettlement. These funds are meant to provide employment services, access to language services, and county benefits. However, the refugee community in San Diego is severely struggling to find employment in living wage jobs, can't afford rent, and often are denied benefits that are available because they don't understand the complex applications and processes in accessing these benefits. Relying on federal funds alone is not sufficient in ensuring refugees successfully rebuilding their lives in the United States. Creating an Office of Immigrant and Refugee Affairs that is appropriately staffed and that provides information in their preferred languages will help refugees learn about services available and how to obtain them. So I'm here to, again, urge you to support the creation of Immigrant and Refugee Affairs. Thank you.
Thank you. Next speaker, please.
Hello, Chair Fletcher and Board of Supervisors. My name is Mahfa Shalami. I came to America from Iran, and I'm a licensed psychologist and earned my PhD here in San Diego. I have worked with torture survivors for more than 20 years, and for 10 years I have helped facilitate the healing process for torture survivors as the program manager for Survivors of Torture International. At Survivors of Torture International, we provide trauma-informed psychiatry, mental health therapy, clinical case management, medical case management, and also forensic documentation as important evidence in asylum applications. The County of San Diego helps fund our mental health services. Our clients come from more than 90 countries around the world, speaking more than 60 languages. Many of our clients arrive in San Diego County with literally nothing, and they often don't speak English. Some of them, they may also be pre-literate. They're separated from their family when they left home. For some LGBTIQ individuals, they fled their own family members to find safety. This office will be an important resource to help coordinate services and programs for vulnerable people who need assistance and a friendly face to begin their life in a strange land. Thank you for your leadership in establishing this office and for helping those who are less fortunate. Thank you.
Thank you. Next speaker, please. Final call for Homaira Yusufi and Arnulfo Manriquez. Also note for the record that Carlos Gonzalez Gutierrez indicated their support but did not wish to address the board on this item. We'll now hear from those that requested to speak by phone. We'll be calling speakers by the last 4 digits of their phone number. You'll hear a notification that your call has been unmuted. You will then need to press *6 to unmute your phone. I'd ask you to please state your name for the audio record, and I'll remind callers that they should mute their TV or live video stream before they begin speaking. The callers will have 1 minute to address the board. And if you could please identify the first caller.
Our first caller is 4373. 4373, please press *6 to unmute. 4373.
Hi, good evening. This is Michelle Soleri, and I'm calling to make a comment on behalf of the American Immigration Lawyers Association. This, to have this office means so much for our immigrant community. And in particular, I want to talk about the issues that happen on the legal side of things. When you work with immigrants and refugees, you deal with a lot of individuals that speak various languages, and they're oftentimes taken advantage of, and they fall victim to fraud. And this is something that is reoccurring and we see frequently. And by having an office like this, it would diminish the issues of fraud that we see in San Diego. It will provide accurate information to communities, and we'll see that we'll have a healthier community as a whole. So I urge you to vote in favor of this office, and I thank you for your time.
Thank you. Our next caller is 9399. 9399. Please press *6 to unmute.
9399, 9399, por favor oprima la estrella a 3 para poder salirse de mudo.
9399, please press *6 to unmute.
9399, oprima la estrella 6 para salirse de mudo.
We'll come back.
Vamos a regresar.
Our next caller is 7084. 7084, please press *6 to unmute.
Hi, my name is Claire Henry Ennemark, and I'm calling with the San Diego Refugee Communities Coalition to urge you to support the creation of an Office of Immigrant and Refugee Affairs. San Diego Refugee Communities Coalition organizes 11 ethnic community-based organizations to ensure individuals and families from these refugee and new immigrant communities throughout San Diego are healthy, safe, and thriving. My work as a director of our crisis counseling program, I've seen firsthand how the county's lack of prioritization of refugee and new immigrant populations has unfortunately caused greater suffering during this COVID-19 pandemic. Resources that supposedly are available to all San Diego County residents are inaccessible, unfortunately, to our refugee and new immigrant residents due to these resources not being provided in the languages our communities speak. San Diego County is leaving refugee and new immigrants' families under-resourced. So once again, I urge you please to support Chair Fletcher and Vice Chair Vargas's measure to create this Office of Refugee and Immigrant Affairs in San Diego County.
Thank you.
Thank you.
Thank you. Our next speaker is 3083. 3083, please press *6 to unmute.
3083, favor de oprimir asterisco 6 para poder hablar.
Buenas tardes.
Buenas tardes.
¿Sí me escucha?
Sí, adelante.
Oh, sí. Buenas tardes. Mi nombre es María Flores y soy miembro de ACE.
Good afternoon. My name is Maria Flores and I'm a member of ACE.
Estoy llamando para pedir a los supervisores de la mesa directiva en San Diego para que aprueben presupuesto para tener una oficina para inmigrantes y refugiados.
I am calling to ask the Board of Supervisors today to approve a budget for creating an Office of Immigrant and Refugee Affairs.
Ya que somos familias de bajos recursos y cuando llegamos a necesitar la ayuda legal, necesitamos tener mucho dinero.
We are often families, low-income families, and when we do need legal assistance, we require a lot of money.
Para pagar un abogado que nos oriente o nos dé a saber de nuestros derechos.
In order to pay for an attorney that can counsel us or inform us of our rights.
Ya, en mi caso personal, yo contraté un abogado para un familiar y el abogado solamente me robó mi dinero, no se presentó el día de la corte y tuve que perder mi dinero y perder el caso de mi familiar.
In my personal experience, once I had to hire an attorney to represent a family member, that attorney stole my money, was not present on the court date. I not only lost my money, but I lost, we lost the case that affected my family member.
Y por eso le estoy pidiendo de todo corazón que inviertan para tener esta oficina, para tener los recursos legales cuando se necesite.
It's for that reason that I'm asking you from the bottom of my heart to really invest in this budget, to have this office so that we can have that legal counsel when we need it.
Sin importar nuestros estatus migratorios. Gracias y que tengan buenas tardes.
Without regard for our current legal status. Thank you and have a good afternoon.
Thank you. Our next speaker is 5187. 5187, please press *6 to unmute.
Good evening. My name is Chris Olson, Chief of Staff at Jewish Family Service of San Diego. Thank you, Chair Fletcher and Vice Chair Vargas, for your continued leadership in helping make our county a more welcoming place for the men, women, and children who have fought through countless horrors to seek better lives in the United States. As one of the primary refugee resettlement agencies in San Diego, as well as the operator of a shelter for asylum seekers, we know just how valuable this office will be for providing a hub for immigrants in our region to access the critical services and resources they need to rebuild their lives, and we urge this board's approval. Thank you so much.
Thank you. Our next speaker is 3054. 3054, please press *6 to unmute.
San Diego County is. Hi, my name is Elisa Plata, and I'm a resident of the District Number 4. I am a journalist, member of the press, and an activist for social justice and human rights. Our region's diverse and multicultural and multilingual communities make San Diego stronger and more vibrant. Approximately 21.5% of country residents were born in other countries. Additionally, 68 different languages are spoken through the county. The county should create a fully funded Office of Immigrant and Refugee Affairs with a starting budget of $2 million to ensure all immigrants are welcome and have the resources and services that they need to achieve full social, economic, and civic engagement. In my personal experience, I'm going to make reference. I was living in the city of Houston, Texas, and I witnessed all the activities that this office does in order to navigate immigrants into the right path.
Thank you, ma'am.
It promotes well-being.
Thank you, ma'am. Your time is up.
Dignity and honor. Thank you.
Our next speaker is 5037. 5037, please press *6 to unmute.
Hello, my name is Shireen, and I'm with the Youth Congress at the Partnership for the Advancement of New Americans. I'm calling to urge you to support the creation of an Office for Immigrant and Refugee Affairs. The last 4 years have been devastating for immigrant and refugee families. The Trump administration attacked their communities and created countless roadblocks, but despite this, they're resilient and will bounce back stronger. In addition to the harmful consequences of the Trump administration, the pandemic has been most difficult for our low-income immigrant families who need additional support to recover from job loss, the inability to pay rent, and the loss in support for children's schools. The Board of Supervisors must affirm your commitment to supporting immigrant communities by creating an Office of Immigrant and Refugee Affairs. This is the time to reinvigorate our communities by expanding direct services, providing adequate language access, and ensuring that our communities have access to the Legal Defense Fund that was recently created by the Board of Supervisors. Once again, I urge you to support Chair Fletcher and Vice Chair Vargas' measure to create the Office of Immigrant and Refugee Affairs in San Diego County. Thank you for your time.
Thank you. Our next speaker will be 9803. 9803, please press *6 to unmute.
Hi, my name is Reem Zubaidi with the San Diego Refugee Communities Coalition. I'm calling to urge you to support the creation of an Office of Immigrant and Refugee Affairs. Our members have been on the front lines of providing essential services to low-income disenfranchised refugee families for years. The pandemic has had a disproportionate impact on our refugee and immigrant families and highlighted the inequities they face across all the social determinants of health. As a manager of our team of community health workers working on COVID-19 outreach specifically for refugee communities, I've seen firsthand how important it is to tailor our efforts to reaching refugee communities in their primary languages and in culturally competent ways. Otherwise, they're often missing out on vital resources and information just because they can't speak the language or are unsure of how to navigate the process for access. This office is needed so that our immigrant and refugee communities can receive accurate information in their primary languages and in a safe and welcoming environment regarding available services and to be informed about their rights. Relying on federal funds alone is not sufficient. Once again, I urge the Board of Supervisors to provide necessary support to immigrant and refugees by establishing this office. Thank you.
Thank you. Our next speaker is 5302. 5302, please press *6 to unmute.
5302, por favor, oprima el asterisco y 6 para salirse de mudo.
Buenas tardes, mi nombre es Miriam Goff.
Good afternoon. My name is Miriam Gold.
Soy miembro de ACE y la coalición Invierte en las Familias de San Diego.
And I'm a member of ACE and I'm a member of the Coalition for Investments of Families of San Diego.
Llamo en apoyo de la Oficina de Asuntos de Inmigración.
And I'm supporting the Office of Immigrants and Refugee Affairs.
Necesitamos una oficina que conecte a la comunidad con recursos y servicios.
Because we need an office that connects the community with resources and services.
Independientemente de su estado migratorio.
Regardless of whatever immigration status they might have.
Los inmigrantes necesitan servicios en su idioma para que ellos puedan entender correctamente lo que necesiten.
Immigrants need to have services in their language so they can understand correctly the services that they need.
Muchas gracias.
Thank you very much.
Thank you. Our next speaker will be 2438. 2438, please press *6 to unmute.
Good evening. My name is Esmeralda Flores. I'm the Immigrant Rights and Binational Affairs Advocate at the ACLU of San Diego and Imperial Counties. The ACLU is a proud member of the Invest in San Diego Families Coalition. We're here to urge the Board of Supervisors to create an Office of Immigrant and Refugee Affairs. Supervisor Fletcher and Supervisor Vargas, thank you for leading this important effort. All people in San Diego County deserve a fair, equitable opportunity to achieve full social, economic, and civic engagement. This includes people in our county who are immigrants and refugees. Immigrants and refugees represent more than 20% of the county's population. Additionally, 68 different languages are spoken throughout the county. These diverse, multicultural, and multilingual communities make San Diego stronger and more vibrant. They deserve to have a safe space where they can easily access services and programs to help them succeed in our region. However, immigrants and refugees often face language and information barriers when trying to find resources and services relevant to their needs. San Diego County should establish an Office of Immigrant and Refugee Affairs to serve as a one-stop shop for information and government services, and the office should develop programs that promote adjustment of status, language accessibility, and civic engagement.
Thank you, ma'am. Thank you. Your time is up. Thank you.
Our next speaker is 4884. 4884, please press *6 to unmute.
Hello, my name is Sandy. I'm a student at San Diego State University, as well as the daughter of 2 Iraqi immigrants. I'm calling with Youth Congress at the Partnership for the Advancement of New Americans. As someone who has seen firsthand the diligence and courageousness of our immigrant communities, I'm calling to urge you to support the creation of an Office of Immigrant and Refugee Affairs. My parents escaped persecution and war in Iraq and had to come to a new country, leave behind their homes, family, friends, language, and culture. Yet they are just one example of the millions of courageous immigrants who have not even necessarily come to America to seek a better life, but to wake up from the nightmare into which they were born. Knowing this information and the suffering many immigrants have faced on their journeys here, they deserve a space that will help them find their home here and provide them support as they navigate these extremely difficult circumstances. I urge you to support Chair Fletcher and Vice Chair Vargas' measure to create the Office of Immigrant and Refugee Affairs in San Diego County. Thank you.
Thank you. Our next speaker is 9719. 9719, please press *6 to unmute.
9719.
Sí, hola, muy buenas tardes.
Buenas tardes.
Hola, muy buenas tardes. Soy miembro de ACE.
¿Cuál es su nombre, perdón?
Javier, perdón.
Okay. Good afternoon. My name is Javier, and I'm a member of ACE.
Llamo en apoyo a la de la Oficina de Asuntos de Inmigración.
I am calling to support the establishment of the Office of Immigrant and Refugee Affairs.
Necesitamos una oficina que inserte unos planes de inmigración.
We need an office that can support immigration plans.
Y mi opinión propia es acerca porque tanto como yo soy inmigrante, les quiero dejar saber que es muy importante esto porque necesitamos para que nos traduzcan los papeles porque a veces no entendemos muy bien todo lo que necesitan.
As an immigrant myself, I want to really make sure that you understand how very important it is to us to sometimes have our documents or applications or other papers translated so that we can understand the processes.
Y no solo soy yo, habemos millones.
And it's not just me, there's millions of us.
Y también les quiero dejar saber, ya que nosotros, como somos el blanco de muchas compañías como la de ICE y Border Patrol, somos los que necesitamos este programa, ya que somos el blanco.
Also, I would like to let you know that we really do need this program because we often find ourselves the target of ICE or programs led by CBP, and therefore we really need these programs.
Ya que pues, muchas gracias.
Thank you. Gracias.
Thank you. Our next speaker will be 2732. 2732, please press star 6 to unmute.
Hi, I'm Adela Mason. I'm a resident of District 3. I'm an immigration attorney and advocate, and I'm the director of the ABA's Immigration Justice Project. Immigrants and refugees provide critical support to our community, and they are an integral part of our identity as a city. Given all that immigrants and refugees contribute to San Diego should, in turn, ensure that its immigrants and refugee communities are able to access the services and resources they are eligible for. Creating this Office of Immigrant and Refugee Affairs is a step in the right direction towards making San Diego a welcoming community for all of its residents. Thank you.
Thank you. Our next speaker is 6770. 6770. Please press star 6 to unmute.
Hi, good afternoon. I'm sorry, can you hear me?
Yes.
Okay. Good afternoon. My name is Rick Bates, calling on behalf of Unite Here, Local 30, to urge support for the creation of an Office of Immigrant and Refugee Affairs. Unite Here Local 30 has considerable interest in this issue as an organization that represents thousands of hotel and hospitality workers throughout San Diego County, the majority of which come from immigrant communities. And I can assure you that while we have all been impacted by the pandemic at varying levels, no one has suffered quite like our low-income immigrant families. The immigrant community is historically and inextricably woven into our societal fabric, and our region's economic well-being depends on their contributions. Everything else has already kind of been said, so I'm just going to once again ask that you please support the creation of the Office of Immigrant and Refugee Affairs. Thank you.
Thank you. Our next speaker will be 6789. 6789, please press star 6 to unmute.
Hello, my name is Patricia, and I'm a member of ACE and the Invest in San Diego Families Coalition. I live in the city of Imperial Beach, which is way closer to the border. I'm calling in support of the Office of Immigration and Refugee Affairs. We need an office that will connect communities with available resources and regardless of their status, and to inform us, immigrants, about their rights. And I say us because I'm a U.S. citizen now. But if my parents would have known this 46 years ago, I graduated from Palmer Way Elementary in National City, and being being an immigrant then and a daughter of immigrants, there was times when I didn't even go to school because my parents were so scared that the migra was outside of the door and looking for undocumented people. And it makes me upset that it's taken this long for this help, but we need to continue to do better, San Diego, because we're all multicultural. Thank you very much.
Thank you. Our next speaker is 0950. Please press *6 to unmute.
0950, por favor, oprima el asterisco y el 6 para salirse de mudo.
Buenas tardes, mi nombre es Karen Govedaro y yo soy parte de ACE.
Ok, perdón, ¿me repite su nombre?
Karen Govedaro y soy parte de ACE.
My name is Karen Govedaro and I am a member of ACE.
Yo llamo para pedir apoyo para que tengamos todos los inmigrantes como yo ayuda de parte de ustedes.
And I'm calling to ask for your support so every other immigrant like I am would have all your help.
Yo como inmigrante que llegué a Estados Unidos hace 34 años.
As an immigrant coming to the United States 34 years ago.
Nunca ha existido una ayuda para nosotros.
I've never felt that there has been any help for us.
Y ahora lo único que pido es que por favor aprueben esta oficina para que las personas como yo podamos tener recursos como seres humanos.
The only thing that I'm asking to please open that office so somebody like I am, can have the type of resources that we deserve as human beings.
Muchas gracias por escucharme.
Thank you very much for listening to me.
Thank you. Our next speaker is 5481. 5481, please press *6 to unmute.
Hello, my name is Dalia Mohammed, and I'm calling from the Refugee Communities Coalition. I'm calling to urge the support of the creation of the Office of Immigrant and Refugee Affairs. This office is needed so that our community and refugee communities can receive accurate information in their preferred language and in a safe and welcoming environment regarding available services and be informed about their rights. Once again, I urge you to support Chair Fletcher and Vice Chair Vargas measure to create the Office of Immigrant and Refugee Affairs in San Diego. Thank you.
Thank you. Our next speaker is 8495. 8495, please press *6 to unmute.
Hello, my name is Rahma Abdi. I'm a community organizer at PANA. I'm calling to urge you to support the creation of an Office of Immigrant and Refugee Affairs. The last 4 years has been devastating for our community, especially immigrant and refugee families like mine. Trump administration attacked our community and created countless roadblocks for immigrant and refugee families. Our community are resilient and will bounce back stronger than ever. The Board of Supervisors must affirm your commitment to supporting immigrant and refugee communities by creating Office of Immigrant and Refugee Affairs. Once again, I urge to provide necessary support to immigrant and refugee by establishing this office. Thank you.
Thank you. Our next speaker is 9640. 9640, please press *6 to unmute.
Hi, good evening. My name is Elizabeth Nunez, and I'm calling with the Youth Congress at the Partnership for the Advancement of New Americans. I am calling to urge you to support the creation of an Office of Immigrant and Refugee Affairs. As one of the most diverse counties and heavily used international borders, we are the home for many immigrants and refugees. Though San Diego County receives millions from the Office of Resettlement, this demographic remains underserved. These communities need to be introduced with the necessary resources to transition them into life in the U.S. and combat language barriers encountered when seeking work or housing. The reliance on federal funds alone is not sufficient. Creating an Office of Immigrant and Refugee Affairs and further appropriately staffing these buildings can provide our refugee and immigrant communities with the much needed support to ensure that they have a successful life in rebuilding their lives here. Once again, I urge the Board of Supervisors to provide necessary support to our immigrants and refugees by establishing this office. Thank you for your time.
Thank you. Our next speaker is 8836. 8836, Please press star 6 to unmute.
Hi, my name is Muqsad Abdullahi, and I'm a UCSD student calling with the Youth Congress at the Partnership for the Advancement of New Americans, also known as PANA. I'm calling to urge you to support the creation of an Office of Immigrant and Refugee Affairs. Just like the previous statements, the last 4 years have been devastating for immigrant and refugee families. The Trump administration attacked our communities and created countless roadblocks for immigrant and refugee communities. Our communities are resilient and we will bounce back stronger than ever. This office is needed so that our immigrant and refugee communities can receive accurate information in their preferred language and in a safe and welcoming environment regarding available services and be informed about their rights. The Board of Supervisors must affirm your commitment to supporting immigrant communities by creating an Office of Immigrant and Refugee Affairs. Thank you for your time.
Thank you. Our next speaker is 9713. 9713, please press star 6 to unmute.
Hi, can you hear me?
Yes.
Hi, good afternoon. My name is Eduardo, and I'm a member of ACE and the Investment in San Diego Families Coalition. As a lifelong resident of Chula Vista and a member of immigrant community, I would like to ask the Board of Supervisors to support this. We need a space that provides a physical space for permanent immigration hub, not just having people bounce around from one place to another, from one underfunded HHSA building to the next, or to be, misled or misguided. These are dealing with people's lives. So this office would be something that would provide a great deal of services for our community members and well-being of San Diego as a whole. So please invest in this, and thank you for your time.
Thank you. Our next speaker will be 6634. 6634, please press star 6 to unmute.
6634. 6634, favor de oprimir asterisco 6 para poder hablar.
6634.
6634. Debe oprimir asterisco 6.
Hola, buenas tardes. Mi nombre es Claudia de la Cruz y soy parte de AC. Estoy llamando para apoyar a toda la gente como yo que llegamos a este país hace muchos años y somos inmigrantes. Para poder tener un apoyo para todos nosotros.
Good afternoon. My name is Clara de la Cruz, and I'm a member of ACE. I'm calling to support those like me that came to this country a few years ago in order for us to have this office to support us.
Llegué hace 15 años con mis 2 hijos pequeños y ha sido muy difícil sobresalir en este país sin poder tener los derechos que los demás tienen. Creo que todos somos humanos, merecemos oportunidades, gente que nos gusta trabajar, salir adelante. Quiero que mi familia pueda tener un mejor futuro.
I came to this country 15 years ago with 2 young children, and it has been very difficult to make it without having the same rights as everyone else. I do believe that since we're all human beings, we all deserve the same rights and same opportunities to succeed.
Creo que eso es todo por hoy. Muchísimas gracias.
That's all for today. Thank you very much.
Thank you. Our next speaker will be 7118. 7118. Please press star 6 to unmute.
My name is Patricia Mondragon, and I am the Regional Policy Coordinator at Alliance San Diego. Alliance San Diego supports creating the Office of Immigrant and Refugee Affairs. San Diego County has a long history of welcoming immigrants and refugees, but insufficient infrastructure to do so. 1 in 4 county residents is an immigrant. 50% of the county's children have 1 or more immigrant parents. My own parents were immigrants with a young family in a new country they didn't know how to navigate. Over 50 years later, I speak with immigrants that find it difficult to access services and to understand our complex web of government agencies. Establishing this office will provide a much needed resource and signal the county's support of immigrants and refugees in our region. With input from the community and established best practices, we can implement an office in San Diego County that is responsive to our immigrant refugees and families. Alliance San Diego respectfully asks all supervisors to vote yes on item 10.
Thank you. Our next speaker will be 9364. 9364, please press star 6 to unmute. Please press star 6 to unmute.
Hi, this is Michelle Krug. I'm not going to belabor the point. I really appreciate your opening this Office of Immigration and Refugees. It is a really needed focal point in our county so that people have one place to go for sure. And I just really want to thank you for taking all of these bold steps, this just being the next one, and appreciate the ability for our most vulnerable citizens, as was mentioned by Rick Bates, that the people that need it the most to have an extra layer of protection. Thank you.
Thank you. Our next speaker will be 5953. 5953, please press star 6 to unmute.
5953, 5953, oprime el asterisco 6 para poder hablar.
Sí, bueno, buenas tardes.
Yes, good afternoon. Señora.
Sí, buenas tardes. Mi nombre es Fanny Esquivel y soy parte de AI. Llamo en apoyo a medidas de servicios legales disponibles para la comunidad inmigrante.
Yes, and my name is Tania Esquivel, and I am a member of ACE, and I am in support of the Office of Immigrants and Refugees Affairs.
Esto es muy importante para mí porque yo llegué aquí a Estados Unidos hace 17 años y he podido mirar.
Okay, this is very important for me. I came here to the United States 27 years ago.
He podido mirar cómo nosotros como migrantes se nos han cerrado muchas ayudas de apoyo y quiero apoyar a mi comunidad latina porque todos somos humanos y merecemos el derecho a trabajar y apoyar a nuestras familias.
And I have seen, how many immigrants have lacked the support. And I do want to support my Latin community. So, because I believe that we have the right as a family to also support our families.
Yo juntamente con mi familia y con los demás familias inmigrantes, quiero que nuestras familias vivan en paz porque se preocupan se preocupen por nuestro bienestar, ¿verdad?
Like myself, many other families, we want to live in peace because I think that we all worry about our well-being.
También conozco a algunas personas que les hicieron fraude al buscar ayuda de unos abogados de malas personas, ¿verdad? Que no han podido tener esa ayuda y merecen consejería confiable. Y eso es lo que estamos pidiendo, que haya abogados que de verdad podamos confiar realmente. Gracias. Eso es todo por hoy.
I also believe that we need attorneys that are good people, because I know of some of us that have had bad attorneys, and I think that we deserve that. Thank you so much.
Thank you. Our next speaker is 0463. 0463. Please press star 6 to unmute.
My name is Margaret Baker, speaking on behalf of South Bay People Power. We support creation and full staffing for the County Office of Immigrant and Refugee Affairs. Everyone in our county should have an opportunity to thrive using their unique skills and satisfying their particular needs. But immigrants and refugees often face communication and other barriers when trying to understand our system and find resources that would help them settle in our region. Despite the resilience and creativity of new migrants, these barriers can be insurmountable, as I know from my experience as a volunteer helping individual families to access daily necessities, making appointments, enrolling in classes, using online resources. We need a permanent designated office to support and connect with immigrants as they transition into this new environment, a place where they are heard and understood, a place devoted to outreach and access, a place that ensures that community members know they are welcome and belong here. We urge a unanimous yes vote. Thank you.
Thank you. Our next speaker is 6155. 6155, please press *6 to unmute. 6155, please press *6 to unmute. We'll come back. Our next speaker is 4143. 4143, please press *6 to unmute.
Hi, my name is Kathy Cahill, and I'm a member of the ACLU North County team. San Diego has always been a unique city as the birthplace of California. Let's continue our uniqueness by being the first county to create a fully funded Office of Immigrant and Refugee Affairs to ensure all immigrants are welcomed and have the resources and services they need to achieve full social and economic engagement. Don't forget, these same immigrants will be contributing in tax dollars to help rebuild our infrastructure and replenish the same budget you are creating. Today, this country and our government has made it clear on their stand for immigration while forgetting where their families migrated from. I urge you to support Supervisor Fletcher and Supervisor Vargas's motion to create a fully funded Office of Immigrant and Refugee Affairs and give today's immigrants and refugees the same opportunities bestowed on your ancestors. Don't forget, you would not be here to listen to our testimonies if it hadn't been for your ancestors migrating to America and their hard work to thrive in this country. Thank you.
Thank you. Our next speaker is 3903. 3903, please press *6 to unmute.
Hello, my name is Dilal, and I'm calling with Youth Congress of the Partnership for the Advancement of New Americans. I am calling to urge you to support the creation of an Office of Immigrant and Refugee Affairs. San Diego is one of the most diverse counties in the country. Located on international borders, we have folks seeking asylum from all over the world. We are home to a significant refugee community and a historic immigrant community. Our communities need real investment from the country and county to navigate county, state, and federal resources. The pandemic has been most difficult for our low-income immigrant families. Our families need additional support to help us recover from the job loss, the inability to pay rent, and the loss in support for our children's schools. This is the time to reinvigorate our communities by expanding direct services, providing adequate language access, and ensuring that our communities have access to the Legal Defense Fund that was recently created by the Board of Supervisors. Once again, I urge the Board of Supervisors to provide necessary support to immigrants and refugees by establishing this office. Thank you.
Thank you. Our next speaker will be 6014. 6014, please press *6 to unmute.
6014. 6014, favor de marcar *6 para poder hablar. 6014. Si no, regresamos con usted.
We'll come back to that one. 8842. 8842, please press *6 to unmute. 8842.
Hi, my name is Charlene Atkins. I'm a social worker in San Diego, currently volunteering with the UCSD Student-Run Free Clinic Project. I am in full support of establishing the Office of Immigrant and Refugee Affairs as part of eliminating inequities. Many of my clients are people who will benefit from this office. Please consider the following recommendations for the department's work. Please identify gaps in necessary services and work to fill them through facilitation of connections and/or funded initiatives. Ensure that all know their rights. Be part of distribution of cards such as Conozca dos Derechos that all and many languages as needed. Refer to community agencies, facilitate language resources, and be a safe place for all who need these services with no coordination. Thank you for your consideration of these recommendations.
Thank you. Our next speaker is 1400. 1400. Please press *6 to unmute.
Good evening, members of the Board of Supervisors. My name is Diane Jacoby. I am a resident of District 3. I am also the former director of an agency that provided social and legal services to Central American refugees, and I am now a teacher. The vast majority of my students are members of immigrant families. I have seen firsthand the enormous challenges that immigrant families face when trying to navigate social, educational, and governmental services. A centralized body for assistance, referrals, and advocacy for immigrants and refugees will not only help these families, but will also make San Diego stronger. After one of my students' mothers finally received support to access health care, my students' school attendance increased significantly. As the eldest, she often had to stay home when mom was sick. I have seen many such cases involving health, legal status, and housing challenges. A safe county office is much needed, and I urge you to support Supervisor Fletcher and Supervisor Vargas's motion to help create a fully funded Office of Immigrant and Refugees Affairs. Thank you.
Thank you. Our next speaker is 1121. 1121. Please press *6 to unmute.
1121, 1121. Oprima el asterisco y el número 6 para poder hablar. 1121, oprime el asterisco, el número 6 para poder hablar.
We'll come back to that one.
Vamos a regresar después.
Our next speaker is 7106. 7106. Please press *6 to unmute.
Hi, my name is Gabby Strubakis. I live in District 3, and I'm calling to support the creation of a fully funded Office of Immigrant Affairs for San Diego. The way the U.S. has historically dealt with immigrants coming up, especially from the U.S.-Mexico border, has always been very deeply disturbing, especially so in the past decade. I've never been someone who's directly impacted by immigration policy, but I know that creating a fully funded Office of Immigrant Affairs is the right thing to do. It'll be a great step towards making San Diego a more equitable place to live for everyone who comes here seeking a better life. I look forward to seeing this motion pass today, and I hope you won't disappoint all your constituents who have called in support. Thank you.
Thank you. Our next speaker is 9891. 9891. Please press *6 to unmute.
Good evening, members of the Board of Supervisors. My name is Gian Giacalone, and I'm a resident of District 1. I'm calling in support of the creation of an Office of Immigrant and Refugee Affairs. All people in San Diego County should have a fair, equitable opportunity to achieve full social, economic, and civic engagement. Immigrants and refugees in the county often face language and information barriers when trying to find resources and services that would help them settle into and thrive in their new environment, which is why I urge this Board of Supervisors to not only support this office, but fully fund it, starting at $2 million, so that we can advocate on behalf of the immigrant and refugee communities at the local, state, and federal level, and provide these communities with updates on relevant policy and legislative changes. Having a centralized location for these services will ensure all people are welcomed and have the resources and services they need to succeed in their new home. I urge you to support Supervisor Fletcher and Supervisor Vargas's motion to create an Office of Immigrant and Refugee Affairs. Thank you for your time and consideration.
Thank you. Our next speaker is 9207. 9207. Please press *6 to unmute.
Good evening, members of the Board of Supervisors. My name is Sarah, and I am a resident of District 1 and a volunteer with the ACLU. I'm here today to urge you to support the creation of a fully funded Office of Immigrant and Refugee Affairs. I want to echo what has already been said by many people, as well as emphasize the importance of fully funding this office to ensure immigrants and refugees all have access to the services they need. It is crucial that all can be helped and finances do not impede on this. We continue to see the harm caused when resources are short, such as with the homeless population. We need to end this unnecessary cycle of harm. Thank you for your consideration.
Thank you. Our next speaker is 1243. 1243, please press star 6 to unmute. 1243.
Today, my name is Alina June Nawabi. I'm calling from Council on American Islamic Relations, CARE, San Diego. I'm calling because I want to support the Office of Immigration and Refugee. I think it's really important to have this office. One of the reasons is because I myself and my family, we were refugees when we first came to San Diego. Because of the little bit of resources we had, we managed to finish school. We contribute to society. In fact, I work for a nonprofit organization, and I spent even the rest of my day volunteering, helping youth and community members to engage. I think it's really important to have this office because this will not only help refugees assimilate into society, but also help us to contribute back to our society. And I really commend our Nathan Fletcher, the chair, and Nora Vargas for taking up this amazing opportunity and creating this space for us. Thank you very much, and do urge you to support this office.
Thank you. Our next speaker is 3974. 3974, please press star 6 to unmute.
Good evening. My name is Hamayuri Sufi. I'm the Deputy Director at the Partnership for the Advancement of New Americans. The refugee communities we represent are diverse. They come from all walks of life and from different areas of the world. San Diego receives federal funding to support some initial programs. However, refugees are not able to bring their homes, their networks, or their jobs with them. They come here fleeing for their lives, and our refugee communities need further investment and long-term support to rebuild their lives in San Diego. This would include equitable and robust translation and interpretive services, pro bono and low bono legal services for adjusting their status, as well as navigating the complex legal systems, as well and in language and in-person support in accessing county resources. Further, what's really important for our communities is also access to affordable housing resources, because we know our communities are living in severely overcrowded and cost-burdened housing. We ask the Board of Supervisors to support this initiative that is brought forth by Chair Fletcher and Vice Chair Vargas to create an Office of Immigrant and Refugee Affairs. We hope to work with your offices to continue to expand resources for all of our immigrant and refugee communities. Thanks so much.
Thank you. Our next speaker is 4340. 4340, please press star 6 to unmute.
4340, 4340. Oprima el asterisco 6 para poder hablar.
¿Me escucha?
Sí, señor. ¿Cuál es su nombre?
Ok. Sí, mira, mi nombre es Eduardo Medrano. Soy miembro de ACE y con la coalición de las familias en San Diego es en el tema número 3, pues para la inversión de los 15 millones en servicios legales.
Okay,
y pues estoy aquí para pedir apoyo, asesoría y pues lo importante que es para nosotros sentirnos asesorados y protegidos por las leyes, aunque no estemos bien en el país.
Okay, and my name is Eduardo Bernaldo. I'm a member of ACE, and I'm here wanting to support, this important issue for us, because we need to be protected by the law, although some of us are not here legally. This is something very important for us. Adelante, señor Eduardo.
Sí, ya sería todo. Muchas gracias.
But that would be all. Thank you so much.
Thank you. Our next speaker is 1590. 1590, please press star 6 to unmute.
Hello, my name is Bertha Rodriguez, calling in on behalf of Climate Action Campaign, which is a member of the San Diego Green New Deal Alliance. I'm calling to urge you to support the creation of an Office of Immigrant and Refugee Affairs. This office is needed so that our immigrant and refugee communities can receive accurate information in their preferred language and in a safe and welcoming environment regarding available services and be informed about their rights. And as the climate crisis progresses, we will continue to see more refugees fleeing from their homes, destroyed by hurricanes, economic instability created by climate change, and other climate disasters. We need to be prepared to provide the necessary services for these communities and support climate refugees. I urge the Board of Supervisors to provide the necessary support to immigrants and refugees by establishing this office. Thank you.
Thank you. Our next speaker is 6770. 6770. Please press *6 to unmute.
Hi, good evening, everyone. My name is Katrina Pimentel, and I serve as the Operations Manager for Survivors of Torture International, and I also earned my Master's in Social Work from San Diego State University. I will keep it short since we've heard so many in favor today of this opportunity. So I just wanted to emphasize that the Office of Refugee Resettlement has recognized a meta-analysis of multiple scientific studies that show that at least 44% of the refugees coming to the U.S. are torture survivors. And we also believe this to be around the same for asylum seekers. So this is approximately 35,000 torture survivors living in our county and around 124,000 in California with, multiple traumas they experience at the hand of their state or government through politically motivated torture. That means when we're asking immigrants to access government services, it needs to be a welcoming place with community partners so that they can receive services from their community and feel truly welcome to become our neighbors, coworkers, and friends. So thank you for making this reality. Have a good night.
Thank you. Our next speaker is 3410. 3410. Please press *6 to unmute.
Hi, my name is Nancy. I'm calling with the Partnership for the Advancement of New Americans, and I'm calling to urge you to support the creation of the Office of Immigrant and Refugee Affairs. Imagine fleeing your home country from violence with hope for a better future, only to be met with deteriorating housing, workplace violence, and an inability to communicate your health needs because of lack of translation. This was the reality of my Vietnamese refugee parents and the reality of many of our immigrant and refugee communities in San Diego. This is why the creation of the office is absolutely necessary. It will be able to centralize the location for newly arrived Americans to turn to for assistance. Something that would have eased the pain and worry and confusion of many immigrants and refugees. Please affirm your commitment to serving our refugee and immigrant brothers and sisters by creating this office. Thank you.
Thank you. Our next speaker is 4510. Excuse me, 4514. 4514. Please press *6 to unmute. 4514.
Good afternoon. My name is Elida Chavez. I'm a resident of District 4. I would like to thank all of you for acknowledging that San Diego needs an Office of Immigrant and Refugee Affairs. Our city and our county has the busiest border crossing in the nation, the largest number of Native American nations here, and we have a great multiracial, multicultural population that weaves us all together. The Kumeyaay First Peoples of this sacred land has welcomed all and shared their resources since before 1542. Our city county has been built by indigenous and immigrants to where we are now. I sincerely request that all of you touch your heart, especially if you have ancestors and family that migrated from other countries, and support the creation of this very important Office of Immigration and Refugee Affairs. The Office of Immigrant and Refugee Affairs is of great need in our region. This office will support new immigrants and refugees with resources that will help overcome the fear of starting life in a new environment. The language and cultural barriers will be less.
Thank you.
Thank you.
Our next speaker is 6035. 6035. Please press *6 to unmute.
Hello, my name is Mahasan Abdullah, and I am calling with the Partnership for the Advancement of New Americans. I am calling to urge you to support the creation of an Office of Immigration and Refugee Affairs. The county receives millions of dollars that go towards refugee settlements from the Office of Refugee Settlements. These funds are meant to provide employment services, access to language services, and county benefits. However, the refugee community in San Diego is severely struggling to find employment and living wage jobs, can't afford rent, and often are denied benefits that are available because they don't understand the complex applications and processes to access these benefits. Thank you.
Thank you. Our next speaker is 8288. 8288. Please press star 6 to unmute. Please press star 6 to unmute. All right, we'll come back. Our next speaker is 0294. 0294. Please press star 6 to unmute.
Hello, can you hear me?
Yes.
Hello, yes. My name is Aisha Osman, and I'm calling with the Youth Congress at the Partnership Advancement for New Americans. And I am born to immigrant parents. I am calling to support the creation of an Office of Immigration and Refugee Affairs. San Diego is one of the most diverse counties in the country. It's located on an international border, and we have seen folks seeking asylum from all over the world. We are home to a significant refugee community and a historic immigrant community. Our communities really need an investment from the county to navigate state and federal resources. Once again, I urge you to support the Board of Supervisors to provide the necessary support to immigrants. Thank you for your time.
Thank you. Recalling 9399. 9399. Please press star 6 to unmute.
9399. Favor de oprimir asterisco 6 para poder hablar.
9399.
9399.
¿Aló?
Hola.
¿Me escuchan?
Sí, adelante.
Sí, buenas tardes. Mi nombre es Leticia Cerón.
Good afternoon. My name is Leticia Perón.
Soy residente de la ciudad de Chula Vista y miembro del grupo ACE y la coalición Invest en San Diego para las familias.
I am a resident of Chula Vista, a member of ACE, as well as ISDF.
Les llamo en apoyo de la Oficina de Inmigrantes.
I am calling to support the Office of Immigrant and Refugee Affairs.
Ya que necesitamos esta oficina que apoye a nuestra comunidad con recursos y servicios.
Since we do need this office to help support our community with resources and services.
No importando su estatus migratorio.
Without taking into account their legal status.
Asimismo, que esta oficina sirva como experto en asuntos de inmigrantes y refugiados en San Diego.
We also expect this office to serve in an expert role for immigrants and refugees in San Diego.
Ya que esto es muy importante para nuestra comunidad.
This is very important to our community.
En mi caso, yo tengo familia inmigrante y por la desconfianza de encontrar un buen abogado que no solo les saque el dinero y no les ayude en sus casos particulares, no han podido arreglar su situación migratoria.
And my personal testimony is that I have family members that are immigrants, and because they cannot trust in a lot of attorneys, they have not been able to find a good attorney out of fear that they either won't be helpful or they will charge or just take their money, and so therefore they haven't been able to fix their immigration status. Señora, se le acabó el tiempo.
Por lo tanto, okay. Gracias. Buenas tardes.
Gracias.
Thank you. Our next speaker is 5214. 5214, please press *6 to unmute. 5214, please press *6 to unmute. We'll come back. Our next speaker is 8967. 8967, please press *6 to unmute.
Hi. Hi, can you hear me?
Yes.
My name is Tasia Goss. I'm a student in San Diego. I'm with Mass Pace, and I am in full support of the creation of the Office for Immigrant and Refugee Affairs. This office is important for families like me, and the community around me will benefit from this. Thank you.
Thank you. Our next speaker is 8032. 8032, please press *6 to unmute.
Hello, my name is Shakria, and I'm calling with Youth Congress at the Partnership for the Advancement of New Americans. I'm calling to urge you to support the creation of an Office of Immigrant and Refugee Affairs. The pandemic has been the most difficult for our low-income immigrant families. Our families need additional support to help us recover from the job loss, the inability to pay rent, and the loss in support for our children's schools. This is the time to reinvigorate our communities by expanding direct services, providing adequate language access, and ensuring that our communities have access to the legal defense fund that was recently created by the Board of Supervisors. Once again, I urge the Board of Supervisors to provide necessary support to immigrants. Thank you for your time.
Thank you. Our next speaker is 8362. 8362, please press *6 to unmute. 8362, please press *6 to unmute. We'll come back. Our next speaker is 5273. 5273, please press *6 to unmute. 5273, please press *6 to unmute.
Good evening. My name is Ismahan Abdullahi. I'm the Executive Director of Mass Pace, and I urge the Board of Supervisors to approve of this initiative in establishing the Office of Immigrant Affairs, Office of Immigrant Refugee Affairs. I concur with a lot that has been said from community partners and different coalitions as part of the Invest in San Diego Families Coalition. So I won't belabor the point, but this is an exciting moment for us to lead, and I hope we lead in the right way. Thank you.
Thank you. Recalling 1121. 1121, please press *6 to unmute.
Se vuelve a llamar 1121. 1121, por favor, oprima la estrella y el número 6 para poder hablar.
1121.
Sí, buenas tardes.
Good afternoon. Sí, señora, ¿su nombre, por favor?
Mi nombre es María González. Soy parte de ACE aquí de San Diego.
My name is Maria Gonzalez, and I'm an ACE member here in San Diego.
Estoy hablando para apoyar a los servicios para que abran una oficina para ayudar a los inmigrantes.
And I'm in support for to open an office that can help immigrants.
Porque yo he tenido problemas, más bien temor, porque yo he estado hice una demanda con el papá de mi hija sobre child support y tengo ese temor a veces de ir al centro a la corte. Tengo el temor de que haya migración.
And I have had problems basically with child support with the father of my child. And you know, sometimes I fear going downtown to the immigration court because, you know, the immigration is going to get me.
Y también pues sí, estoy hablando para hacer porque pienso que mucha gente también tiene ese temor de ir más que nada al downtown a las cortes, y me gustaría que pues si se viera esta oficina la abrieran cerca de
nuestras comunidades más cercanas para no tener ese miedo.
And I think a lot of people have fear of going downtown to the courts. I think that it would be a good idea to have that office that is closer to our communities, you know, because we are afraid.
Y también otro comentario también porque mi niña pues es nacida aquí, yo pues estoy legalmente acá. Ella me pide también que salgamos a pasear a varios lados como a Disneylandia, para conocer otros estados, pues por lo menos aquí el estado de California.
Yeah, and
y pues yo le digo,
she is a citizen, and sometimes she wants me, you know, I'm illegal here, and sometimes she wants me to go to Disneyland and other places, so. Se le terminó el tiempo, señora, disculpe.
Está bien, gracias.
Thank you.
Thank you. Our next speaker is 0567. 0567, please press *6 to unmute.
Hello, my name is Nao Kabasma, Executive Director of the Karen Organization of San Diego and a member of the San Diego Refugee Communities Coalition. I am calling to urge you to support the creation of an Office of Immigrant and Refugee Affairs. Every single day, I'm working with a refugee from Burma and Myanmar. All of them are here now because they were forced to flee their beautiful homelands due to civil war, which has been going on for more than 70 years. And they are now here as new San Diegans with memories of torture and violence. I've been seeing many refugees struggling to survive even after many years living, working hard, and continue contributing to the society in San Diego because our system are so complicated and it is so hard to navigate them without language support, navigation support, and without truly understanding your rights. Once again, I urge the Board of Supervisors to provide necessary support to immigrants and refugees by establishing this office. Thank you.
Thank you. Our next speaker is 3904. 3904, please press *6 to unmute.
Hello, can you hear me?
Yes.
My name is Mohammed, and I'm calling with Youth Congress at the Partnership for the Advancement of New Americans, also known as PANA. I'm calling to urge you to support the creation of an Office of Immigrant and Refugee Affairs. The last 4 years have been devastating for immigrant and refugee families. The Trump administration attacked our communities and created countless roadblocks for immigrant and refugee communities. Our communities are resilient, and we will bounce back stronger than ever. The Board of Supervisors must affirm your commitment to supporting immigrant communities by creating an Office of Immigrant and Refugee Affairs. This office is needed so that our immigrant and refugee communities can receive accurate information in their preferred language and in a safe and welcoming environment regarding available services and be informed about their rights. Once again, I urge the Board of Supervisors to provide necessary support to immigrants and refugees by establishing this office. Thank you.
Thank you. Our next speaker is 5362. 5362, please press *6 to unmute. 5362, please press *6 to unmute. We'll come back. Our next speaker is 9971. 9971, please press *6 to unmute. 9971, please press *6 to unmute. We'll come back. Our next caller is 3717. 3717, please press *6 to unmute.
Hello?
Hello.
Hi. Hi, my name is Abia Hassan, and I'm 19, and I'm also the daughter of 2 immigrants from Pakistan living in District 5. Let me paint a picture for the supervisors who don't understand the importance of language access. I was 8 or 9 years old, and my dad was at his job. My mom hands me 2 papers littered with big words and asks me what it says. I tried my best, but I'm not sure if I was correct. This ended up being an experience that didn't just impact me, but numerous people I've met, including some of my closest friends. This is why language access is so important. Children who barely learn how to read themselves should not be doing the job that the county can fund. This is why we need the Office of Immigrant and Refugee Affairs. If we cannot create and fully fund this office and help our immigrants and refugees that risk their lives to come here and search for a better life, then the American dream is just as false and unlikely as an oasis in the desert. So much incremental change has begun on the local level that asking for leadership on the federal level first to do this is just code word for being too complacent to really listen to the dozens of callers sharing similar difficulties today and understanding them. This is not always something that we want, but something that we need. If we have the ability to meet this need in the great county of San Diego, then wouldn't it be immoral not to do so and let our immigrants and refugees continue with this minimal guidance? Thank you so much.
Thank you. Our next speaker is 1223. 1223. Please press *6 to unmute. One, two, two, three.
Salam alaikum. Hello?
Hello?
Yeah, that's my number.
Oh, go ahead.
1 second. I don't hear anything. 1 second.
She's not going to hear anything.
Ma'am, we can hear you. We're ready when you are.
We'll come back to 1223. Our next speaker is 2556. 2556. Please press *6 to unmute. 2556. Please press *6 to unmute.
Hello, can you all hear me?
Yes.
Hi, my name is Juan Vargas, resident of District 3, calling on behalf of North County Immigration Task Force, and I'm calling in support of this Office for Immigrant Affairs. I think it's an amazing resource if we're able to staff it properly, and I think it'll be a great asset to our immigrant community, something that is very much needed here in our region. So thank you, Board of Supervisors, for your leadership and wanting to establish something like this. That it's amazing to be able to support our community this way. So thank you.
Thank you. Our next speaker is 6014. 6014. Please press *6 to unmute.
6014. 6014, favor de oprimir asterisco 6 para poder hablar.
¿Aló? Bueno.
Hola, buenas.
Buenas tardes. Mi nombre es Cecilia Solares. Soy miembro de AS.
Un segundito. ¿Cuál era su nombre, perdón?
Cecilia Solares.
Cecilia Solares. Good afternoon. My name is Cecilia Solares. I'm a member of ACE.
Sí, buenas tardes. Mire, yo llamo en apoyo de las medidas de servicios legales disponibles para la comunidad migrante.
I'm calling to support the measures to provide legal services to the immigrant communities.
Esto es importante para mí porque, pues, en sí yo he pasado por casos de que me han robado. No he tenido mucha ayuda. Yo he tratado de arreglar. Soy madre soltera y he tratado de arreglar. Y sí, hay abogados que sí te dicen te vamos a ayudar, y en sí no es la realidad. Me han robado a mí, y yo quisiera que tuviéramos a alguien que nos orientara, que sí nos sintiéramos apoyados, o sea, que nos dieran alguna ayuda.
So I'm calling, and this is to support the legal services for immigrant communities because it's important for me. I've suffered a lot trying to get things done. I'm a single mom, and I have seen lawyers trying to help me, but instead of helping me, they've just stolen my money. And so it's very important for us to have a place where we can get good counsel and we can feel supported and that they can have resources for us.
Y pues sí, yo estoy de acuerdo, quiero apoyar a mi comunidad. Sí, porque pues somos humanos y merecemos el derecho a trabajar y apoyar nuestras familias.
Gracias, se le terminó su tiempo. So I would ask for your help and support in our community because we are all humans and we all have the right to, should have the right to work and to be able to support our families. Gracias, señora.
Thank you.
Gracias.
Our next speaker is 5793. 5793, please press *6 to unmute.
Hi, my name is Sag Abdullahi, and I'm with Smash Pace. I'm just calling to support the proposal of the creation of the Office of Immigration and Refugee Affairs in San Diego County. I think given our location near the border, it just makes sense to have this office to help other people, and I think it'll make our community a better place. So I ask all the supervisors to vote yes in support of the creation of this office. Thank you.
Thank you. Our next speaker is 6155. Recalling 6155. Please press *6 to unmute. 6155. Please press *6 to unmute.
Hello, do you hear me?
Yes.
Hi, my name is Teresa Perez. I'm organizer with San Diego Organizing Project, SDOP, and SDOP is part of the ISDF. I'm a resident of District 5, and I urge you to support the fully funded Office of Immigration and Refugees Affairs. As SDOP, a faith-based organization, I work in congregation and with a lot of immigrants, and I noticed that when they need any resources, they ask the relatives or the friends trying to find any resources or organization. So just for hear the testimonies is an office can give accurate resources. Also, I'm a volunteer coordinator with a hotline for the rapid response, and we got calls from immigrants, asylum seekers, refugees, then they are looking for resources. So having this office, we can have a place where they can get this information. Thank you, and please, I ask you to support.
Thank you. Our next speaker is 5214. Recalling 5214. Please press *6 to unmute. 5214. If you'd like to speak, please press *6 to unmute. Recalling 8362. 8362. Please press *6 to unmute. 8362. If you'd like to speak, please press *6 to unmute. Recalling 5362. 5362. Please press *6 to unmute.
Hi, good evening. My name is Judith Howell. I'm an employee of Planned Parenthood of the Pacific Southwest and a proud member of the Invest in San Diego Families Coalition. I'm also the daughter of immigrants and a resident of District 4. I'm urging this board to support Supervisor Fletcher and Supervisor Vargas's motion to create an Office of Immigrant and Refugee Affairs, which is very long overdue. Immigrants and refugees should have a fair opportunity to thrive in our region. We are a binational town that has long neglected our neighbors. The county should create an Office of Immigrant and Refugee Affairs to ensure people have the resources they need to achieve full social, economic, and civic engagement. Thank you.
Thank you. Recalling 9971. 9971. Please press *6 to unmute.
Hello, everyone. My name is Savina Zama. I'm the director of the CARE San Diego office. This office is very important for it to be funded properly and to have equitable and robust translation services available is so necessary for the integration and establishment of our new immigrants. I remember as a new immigrant, I was given the yellow pages and I had to find my own school, find the space to go get my social security number, vaccinations. And fortunately, I had the skills, the language skills to be able to do that for myself. But so many of my friends and my relatives are not able to navigate through the system and get proper services so that they have an easier way of making their way to school, to find employment, and get on with their life. And many of our refugees come from war-torn spaces.
they do not need more trauma to continue with their lifestyle, so they can find a new home and be comfortable and settled. So I encourage you to vote yes on this resolution and fund it properly. Thank you.
Thank you. Our next speaker will be 8827. 8827, please press *6 to unmute.
Hello, can you hear me?
Yes.
My name is Patty Medina. I live in District 8. I am a member of ACE. I support this proposal, item 10. This proposal will give funds to help families to integrate into a new country without risking deportation or get lost within the system for not having funds to get the correct and fair help. The immigrants need help with their primary language to be channeled to the proper agencies and one resource office to make the process easier and faster to learn the rules, regulations, and requirements to get integrated into their own new life. Also, they need immigration lawyers for the court proceedings to make sure they have access to the proper legal team. Thank you for your time.
Thank you. Recalling 1223, 1223. If you'd like to speak, please press *6 to unmute yourself.
Hi, my name is Muna. Hello, you guys hear me?
Yes, go ahead.
Yeah, my name is Muna. I am calling to support the Office of Immigrant and Refugee Affairs. I'm so happy to be calling you guys and invite me in there. Thank you.
Thank you.
That concludes public testimony on this item, Chair Fletcher.
Great, thank you to everyone who called in. I'll go ahead and make a motion, and then we'll go to board discussion to approve the item with the second from Vice Chair Vargas to approve the recommendations in item 10. Let me ask my colleagues if they have any comments at this time. Supervisor Lawson-Remer.
Yeah, just briefly, I mean, I think I want to echo what so many of the people who called in to testify shared. But in addition, wanted to thank my colleagues for a really thoughtful and well-conceived kind of office that I think will be functional and serve a really important need in our county in an operational way that I think will make a lot of sense. So in addition to advancing good values, I just want to appreciate the effectiveness and the strategic nature in which this initiative will advance those values in our community. So thank you.
Thank you. Supervisor Desmond.
Thank you very much, Mr. Chair. And, my heart really goes out to the many people who called in and the people who come here to this country and need help and efforts to, help them navigate and all the services and things like that are available. But to me, this is clearly a federal matter. And we as the county representatives, we've got our own jobs to do and responsibilities on the public's behalf as the county. We already have actually refugee staff on hand at the county. I could see bolstering those efforts, the refugee staff to help and assist with refugees, or getting that advertisement out that we actually have these people already on staff. It seems like many people don't even know or realize that they are already there. I think this would be about number 7 or number 8 on the number of departments, new departments that we've created at the county here recently. So I'm not so sure do we need a full department? I think a department for Immigration and Refugee Affairs, I wouldn't mind seeing us bolstering our efforts there with our current staff and maybe getting word out that they're available. So I can't support the item because I think this is clearly a federal matter. But thank you very much.
Thank you. Any additional comments? Supervisor Anderson.
Thank you, Mr. Chair. Is there any federal money reimbursement? Can we ask staff if there's going to be any reimbursement from the federal government?
Sure.
Thank you, Supervisor. We do receive some level of federal funding for refugee services. we'll certainly pursue as much as we can. I don't know if Andy Pease is still in the building. If he is, perhaps he can join us. He has the specific numbers of what we have. I'm just not sure whether he's still here this evening or not. Andy, are you available? We can get you that information, but I can assure you we will draw down anything that we possibly can in this regard. Thank you.
Thank you very much. You know, I'm San Diego City has this set up. I'm really uncomfortable moving forward when it's the federal government's responsibility. I understand with the old president that he wasn't great on borders, but this new president has solved all the border issues. And I just don't see why we're going to do a job that the federal government's supposed to be taking care of. So I'm not going to be able to support it today. If I knew for a fact how much money was being reimbursed, I certainly have no problems implementing what the federal government's going to pay for. But, you know, it should be nice if the vice president would come out and take a look at San Diego one of these times. So I'm just really reluctant to do the federal government's job. Thanks.
Thank you, Supervisor. All right, we have a motion by myself, seconded by Vice Chair Vargas, to approve the recommendations in item 10. Ask the clerk to please call the roll.
Thank you. Supervisor Anderson?
No.
Supervisor Lawson-Remer? Aye. Supervisor Desmond?
No.
Vice Chair Vargas?
Vargas, yes.
Chair Fletcher?
Fletcher, aye.
That motion passes with Supervisor Anderson and Supervisor Desmond voting no, all other supervisors being present and voting aye.
Thank you. We're going to go to agenda item 11, service delivery, a board letter brought forward by Supervisor Lawson-Remer and myself. If you remember the public who wishes to speak on this item, please call in at this time. We'll start with Supervisor Lawson-Remer for some comments.
Yes, so I just would like to thank Chair Fletcher for working with me on this initiative. It's really been a pleasure to work together on the fiscal subcommittee that we established earlier this year. And this is a piece of the work that we had promised to bring back to the full board. Today's action outlines a framework to make county service delivery more strategic, transparent, streamlined, comprehensive, and outcomes-oriented. To put this item in perspective, almost 1 out of every $4 in the county's yearly budget, which is about $7 billion this year, is used on contracted goods and services. So we wanted to take a careful look at how that money is being spent. For decades, the county's approach to services has been better, cheaper, faster. These are important goals, but certainly not the only goals worthy of consideration, especially when it comes to public services. This mentality has led to a race to the bottom and an outsourcing of functions that are a core part of our operations. The county outsources about $1.3 billion in core county services, including behavioral health, public health, and emergency services. So we wanted to take a step back and ask, what are the right policies to be driving this approach? What is the right strategy to be thinking about contracting? Making price the most important factor crowds out other vital policy considerations, including high-quality employment standards, local hiring, cultural competency, the building of sustainable staff, and economic justice. The previous approach of the board mirrored a broader trend in public sector practices where simple cost reduction is now giving way to careful, strategic, long-term decision-making. So today, we want to start a conversation about shifting to a broader framework that asks, how do we strategically approach service delivery to ensure the best services are delivered to lead to better life outcomes for all San Diegans? This will move us towards a service delivery model that is more strategic, transparent, streamlined, client-focused, community-centered, and outcomes-oriented. Organizations and businesses that contract with the county are integral partners and share in our commitment to building healthy, safe, and thriving communities. As the third largest employer in the region, our actions play a key role in our local economy. Therefore, our policies around contracting and service delivery must be a force for good in our community. We must leverage our size to promote high-quality employment standards, robust local hiring, outcomes-based monitoring, reporting, data-driven performance, and a deep commitment to transparency and accountability, with good jobs that pay competitive wages, offer fair benefits, and provide good working conditions. This board letter is also a call for a stronger community engagement process to listen to all stakeholders, service providers, and impacted individuals, to develop new policies that can be refined over the coming months with significant stakeholder input, and finalize policies to come back to the full board for consideration in the 2022 to 2023 fiscal year. Today's actions request the CAO to develop a community engagement process to seek input on the draft service delivery framework documented in this letter. This framework is a tool that the county can use to guide strategic decision-making when determining the best service delivery model. It includes asking questions like, can service be performed well or better by county staff, or would it make sense to recruit county personnel to perform the services for the period we need it? This is about accountability and public transparency. This action also directs the Department of Procurement and Contracting to develop a digital platform and regular reports that are easy to access by the public and searchable. Following this vote, the Fiscal Subcommittee will work with the CIO to refine the community engagement process and then take steps to implement and incorporate feedback from stakeholders, service providers, and impacted individuals into a report to the subcommittee. Ultimately, we look forward to a final policy based on all these inputs so the board can adopt a new strategic approach that aligns with our values and our vision for the 21st century. Thank you very much, Chair Fletcher, for your partnership on this endeavor, and I look forward to community comments.
Thank you, Supervisor Wasserman-Reamer. I'm pleased to join you in this effort and appreciate all the work that's gone into it and the really significant work we have ahead, and it's a good step. Let me ask the clerk if there's any requests for public comment on this item.
Thank you, Chair Fletcher. Yes, we have 2 requests to speak on this item, one in person and one by phone. Both individuals appear to be available, so I'd like to invite forward David Lagstein. You'll have 2 minutes to address the board. And then we'll go to the individual that requested to speak by phone.
Sorry, just I forgot to make a motion, so
Got
I'd like to do that.
Motion, and I'll make a second.
Good morning. I'll say good evening, Chair Fletcher and the Board of Supervisors. My name is Dave Lagstein. I'm proud to represent the members of SAU Local 221. I'm really pleased to be here in person and seeing this multi-hour meeting of public servants in action. I have to begin by thanking Chair Fletcher, Vice Chair Vargas, and Supervisor Lawson-Reamer for supporting employees not just with words but with actions. We're just sick and tired of people saying, I love you, public employees, but we're not going to take action to support you. So thank you for standing up for workers. I also want to be clear that county employees will remember that Supervisor Desmond held his nose when he took that vote, and he voted against telework and reimbursements for 8,000 county employees. So I'm going to keep moving with 1 minute and 20 left. For this item, this board knows the county has a massive budget and spends well over $1 billion a year in contracting out services. For too long, the county's taken shortcuts and seemingly cheaper contracts that cost more in the long run because residents are left behind, and to the bottom line when operations suffer or lawsuits make them more expensive later. SEIU 221 supports this board letter wholeheartedly. We thank Chair Fletcher and Supervisor Lawson-Reamer for bringing this forward. We always need to start by asking if our county workforce has the capacity to deliver a particular service to our community. If it must be contracted out, we support policies and standards around wages and benefits, retention, as well as diversity and inclusivity. In addition to articulating these values that support our working families, we support the board letter because it creates a process for input from stakeholders and focus on performance, transparency, and accountability. We understand that this is a first step, and our members are excited to engage in this process. They have a lot of stories to share about contracts that hasn't worked, how the community has suffered, and where we need to make changes going forward. We urge you to vote yes on this item, and we look forward to the implementation. Thank you.
Now we'll move on to the individual that requests to speak by phone. Last 4 digits, 5261. 5261. Please press *6 to unmute your line. And please state your name for the audio record.
Yes, hello supervisors. My name is Dr. Derek Robinson, and I'm calling on behalf of the Center on Policy Initiatives and the Invest in San Diego Families Coalition, as well as a District 4 resident. We want to thank Supervisors Lawson Raymer and Fletcher for their efforts to strengthen the county's delivery of services and improve contracting with today's letter. The County of San Diego should ensure everyone has quality services, that there is a public accountability and input regarding services, and that public funds go towards good jobs and equity in pay and opportunity. This framework will help advance those economic justice and strengthen racial equity. The development of each area of this framework should include that strong community engagement process, including stakeholders, service providers, and impacted individuals. This is the type of collaboration communities have been advocating for, and the ISDF Coalition looks forward to engaging in this process collaboratively with the county. The Service Delivery Assessment Tool will help guide the county's contracting decisions to ensure quality services, quality jobs, and public accountability. The county should adopt responsible contracting policies because contractors must maintain high worker and workplace standards. All workers deserve to be paid good wages, to work in safe workplaces, and to know they have protections. With the county being one of the largest employers in the region, managing 2,200 service contracts worth over $11.7 billion, this important policy will have a large impact on workers and services in the region. Thank you, supervisors, for your time.
Thank you, and that concludes public comment on this item. Also note that we received 2 e-comments.
Thank you. Supervisor Desmond.
Thank you, Mr. Chair. Appreciate the presentation here. I got a question, I guess, for Helen. You know, I heard the term better, cheaper, faster was the you know, the byline, I guess, for the county before for giving out contracts. And it sounds like cost is about the only thing the county considers when I read the board item when we're awarding a contract. So Helen, what all goes into the process when we do contract out services?
Thank you, Supervisor Desmond. We certainly do consider cost, but we most of our procurements are our best value, and so we put a statement of work together, and then we do have a criteria as to how the proposal ratings would be. Each one is unique depending on the particular service that we are contracting for, but we do a best value in most of those cases. There are occasions where there is an RFP that's put out and it does go to the lowest bid, but the majority of our procurements, and Jack is here, Jack Pellegrino, our Director of Purchasing Contracting, but the majority of our procurements are best value. But let me be very clear, the past Board of Supervisors did have a philosophy that was used to outsource to business practices, contracting out as often as possible. And cheaper, better, faster was certainly something that was a policy that they did stand by and promote. And so that certainly was a consideration in the procurement policies and the methodologies that were used. But we did use best value. And there's also a requirement for an economy of efficiency that is required for all procurements that go outside where they have to compare bids. We also have a robust managed competition manual that we follow in anything that is contracted out where employees have a chance to bid as well. So there's a variety of procurement methods. That's probably a little bit more information than you were asking for, but it gives you a little bit of a background. Jack, is there anything else that you'd like to add or any further questions that you have, Supervisor Desmond?
I don't know if Jack's got a comment. It just so it's not always price that we're going for. But yeah, I guess the previous board did have that policy of contracting out as much as possible when they could. I don't know, Jack, do you have anything else?
Yes, thank you, Supervisor, and for the opportunity to make a couple comments. And as Helen mentioned, in the past, we have used best value. We can always improve things and look at the considerations of those best values. The times we do use price-only bids is when required by state law. And over the years, we've continued to expand our portfolio to look at best value and more importantly, to make sure that all of our contractors are performing up to contract standards. As you may recall, a couple years ago, we did a contracting work group which put in a very strong policy for debarment, which we had never had before. So that's one of the additional measures that we've added in recent years to assure high-quality services are delivered for the public dollars that we're spending.
Okay, thank you. You know, I do want to point out, though, that the previous board, which I was on for a couple of years, you know, they all came on and they spent like 20, 24 years in their jobs. When they came to the county was in dire straits. The county had overspent. The county did not have strong reserves. The county was you know, really in kind of poor shape. And they turned that around. And the reserves, the very strong reserves, and the good, solid foundation that we enjoy today, and you know, spending a lot of the dollars and reserves that they put in place, and we're enjoying that. And so it's not always bad, I don't think, or you know, when we go back and bash the previous boards for what the condition we're in. We're actually in very good financial condition, and I want to, you know, say thank you to those previous boards for that. You know, I'm not going to be supporting this item. I think the onus that this language puts on small businesses is going to make it incredibly difficult to be in compliance and competitive in the contracting process. You know, I prefer to let staff do the contracts based on who's going to do the best job for the best value. I think for the sake of protecting taxpayer dollars, we should be focused on the best service for the best cost and the best value. So I'm not going to be supporting this item today. Thank you very much, Mr. Chair.
Thank you. With that, we have a motion by Supervisor Lawson-Remer, second by myself, to approve the recommendations in Agenda Item 11. Not seeing any additional requests to speak, I'll ask the clerk to please call the roll.
Thank you. Supervisor Anderson?
Aye.
Supervisor Lawson-Remer?
Aye.
Supervisor Desmond?
No.
Vice Chair Vargas?
Vargas, yes.
Chair Fletcher?
Fletcher, aye.
That motion passes with Supervisor Desmond voting no, all other supervisors being present and voting aye.
We're going to move to Agenda Item 14, Standardizing Board Procedures. This is a board letter brought forward by myself. This really is an opportunity as we continue to evolve and change as a board, particularly in the term limited era, to codify some really helpful guidelines around how we docket things. After decades with very little turnover and change, we are in a new era with each of us very engaged, very motivated, and we are undertaking a record number of policy changes. In the past 5 months, there have been 120 board-initiated policy proposals directing the CAO to implement new policies and programs. These come with corresponding changes to staffing and operations. I think this is a great thing. I think it is a vibrant and active and engaged Board of Supervisors that is responding to the needs of the community. And so I applaud all that we are doing. And I, for one, like working late, and I think it's good. We're doing a lot of good things every single board meeting. But in order to ensure both public transparency and operational efficiency, I think it is appropriate that we come in and standardize some of the procedures around the process in which we operate. Many of these processes already exist in some format, but codification of the principles in a board policy will help ensure that supervisors know and their staff know exactly what the process is around board letters. It will help better equip new supervisors when they come in and take office. And it'll also provide some ability to ensure we're doing proper evaluations. So some of the changes in here include clear docketing schedules, ensuring that we have the appropriateness for staff review timelines, county council, clerk of the board, department subject matter experts, the appropriate time for the fiscal review, for the legal review, for the history around the issue. It'll streamline our process on proclamations and provide some technical cleanup. So I think this is a part of our continued evolution as a board, and I would request your support. And with that, I'm happy to make a motion to approve the recommendations in item 14.
I'm happy to second the motion.
We have a second by Vice Chair Vargas. Let me ask the clerk if we have any requests for public comment on this item.
Chair Fletcher, there are no requests to speak on this item from the public.
All right, let me ask my colleagues if they have any comments or questions on this item. Supervisor Desmond.
Thank you very much, Mr. Chair. You know, I think it was a good idea to do this. Overall, the updates are good. I like the clarification on schedules with the board letters, the clear timelines. I like the committee reports. I just had a couple issues that I think are worth noting. One of which, on late dockets, and I know, you and I and many of us have all been guilty of late docketing, and I don't mind the requirement that the chair approve the late dockets. I'm just wondering if there's a possibility for maybe a second avenue, and that would be aside from the chair's approval for late dockets. That's it. If the board letter of the late docket is submitted by two or co-docketed by two county supervisors. We all, we're all equals. We all got, same status. We'd have our chair and vice chair, but I'm kind of hearkening back to my days as a mayor. We used to have it where it would take two council members to bring an agenda item to a docket. So I'm just wondering if in the times that we're in, where data is just up to the minute, and you can get news from around the world constantly and comes quick and fast, and where a lot of us are drinking from a fire hose. Sometimes the late docket's legitimate, and I'm fine with the chair's approval, but I just wondering if we'd have another avenue for a late docket of two board members co-docketing a late docket, and then wouldn't have to require the chair's approval.
Yeah, thank you, Supervisor Jasmine. And on the notion of two folks docketing, that was actually a suggestion that was raised for all board letters. Maybe it requires two people to co-docket. I didn't really think that was fair. Sometimes you have supervisors who tend to go their own way by themselves repeatedly, and I don't think those voices should be excluded from the process. And so we didn't consider that in board letters requiring two people to co-docket. And I understand where you're coming from. I don't actually think in practice this change is going to be that significant. We've already had guidance around what is a late docket and what's not a late docket. There was just no mechanism to actually enforce that. So if someone docketed something late that clearly was a violation of the rules, there was no mechanism to do that. I certainly will not be the chair forever, but I think the intent is if it meets the threshold that is outlined, then it should be docketed. And I think at the discretion of the chair is probably sufficient at this point. But if it becomes an issue, obviously 3 members of the board could always change it with a different board letter to change it. So I don't anticipate this really being a very significant issue. It's outlined what qualifies for a late docket, and that really is in keeping consistency with the open government requirements on local government of giving the public time. So I think at this point, I think the way it's written will probably suffice.
Okay, then well, that was more of a suggestion. The other item that I have here that really is concerning to me is that you've reduced the public comment times by 1/3 to where individuals, instead of getting 3 minutes to speak, they're only going to get 2 minutes, and groups only from 15 minutes to 10 minutes. And these are the people's meetings. This isn't just our meeting. These are the people's meeting. This is their time to speak and their time to, to talk to us and come in front of us. And, if somebody comes from Alpine or somebody comes from Fallbrook and, takes the time to, take the hour drive and come down and to speak, even 3 minutes is pretty fast when you're standing at a podium. I can't support this portion of the item. I think we should have done, more outreach. At least this should have gone through the transparency committee. This is kind of a big thing too. And I applaud you. You do a great job, especially when we got, several speakers, and you say, okay, we're going to do it all in 2 minutes or 1 minute. I think, that discretionary tools should remain in place, and you do a great job with that. But decreasing the public speaking time by 1/3. I know it's late here at night, and but I just think that needs a little bit more massaging, little more input. I'd like to see it go through the transparency committee before this is enacted. So you know, the rest of the item I think I'm fine with, but the reduction of the speaking times, I can't support at this point in time.
Thank you, Supervisor Desmond. We routinely fluctuate these down or up based on what's happening, and certainly we want to make sure people's voices are heard. And I do appreciate your commitment to being here in person, to hear people in person who take the time to come down and meet with us. That is noted and appreciated. And we can certainly provide more time for speakers when we have a complex issue. You know, remind everyone, the Gettysburg Address was 2 minutes long. I think you can say a considerable amount in 2 minutes. But nonetheless, we always can increase time, and maybe at a future board meeting, we will increase it significantly to see how it goes. But the flexibility remains. It's just reassessing what the standard is. But certainly if complex matters and people have things to heard, we want the public to be heard. And I think our board has done a very good job in the last 5 months of hearing from the public on these issues. But thank you for that. Supervisor Lawson-Remer?
I just wanted to express my support and appreciation for, you know, bringing forward something to standardize process. And it's those kinds of expectations and standard expectations that allow for public to participate in a reasonable way. It's very hard to comment or engage on items if you don't even know when they're coming and everything's late docketed and it's a confused process. So I think this will go a long way towards improving transparency and participation and public accountability, and I very much appreciate the work on that. Just on the Supervisor Desmond's comment around the length of time, you know, when you have meetings that are so long that that some people don't get a chance to speak, you're crowding out voices, and I think that's really been a challenge where we've actually crowded people out who have not had a chance to speak. And so I look at this endeavor as increasing the opportunity for participation. I'm ensuring that every voice can be heard because you don't have just a few voices crowding out others. So again, I know that the chair will retain the discretion, and if it turns out that some items have fewer speakers and we need longer comments, I trust that those time will be extended accordingly. But I do think it's helpful to create a process that actually allows the efficiency to make sure every voice does get a chance to be heard.
That is a great point. Thank you. All right, we have a, okay, Supervisor Desmond.
Sorry, I just want to follow up a little.
Sure, of course.
And you know, your comment about Gettysburg Address as being short, you know, that was Abraham Lincoln. That wasn't common folks that, you know, when they come and speak, they're nervous, they're tense. They you know, land use issues aren't always very well, you know, they're not very well versed at it. I don't know. I'll support the item, but with you know, I guess my non-support of the reduction in time as the standard. I think 3 minutes is the standard, you know, for people, and I don't know. I don't want to touch this until it is vetted more. So I appreciate the extra effort to letting me speak some more on it.
Absolutely. Thank you, Supervisor Desmond. Nothing in here will ever limit board members' time to talk. We wouldn't do that. All right, we have a motion by myself, seconded by Vice Chair Vargas. Ask the clerk to please call the roll.
Thank you, and I'll also note that that includes the corrections that were noted in the errata that I described during the formation of the consent calendar. With that, Supervisor Anderson.
Aye.
Supervisor Lawson-Remer.
Aye.
Supervisor Desmond.
Aye, with the note that I do not support the reduction of the public speaking time.
Vice Chair Vargas.
Vargas, yes.
Chair Fletcher.
Fletcher, aye.
That motion passes unanimously with all supervisors being present and voting aye.
We're now going to go to agenda item 16, and we're going to get a brief presentation from Mr. Strong, who is here, and then we will hear from any public speakers in this item and come to board deliberation. So with that, we will turn it over to Andrew. Thank you.
Chair Fletcher, Board of Supervisors. The Office of Equity and Racial Justice is working to lay a solid foundation of structural and systemic change that started with the January 12th board action that declared racism as a public health crisis. We're engaging community voices in a more intentional manner across the enterprise. We're creating an equity and racial justice lens on all of our operations, and we're enhancing our data analysis to find disparities and root out systemic racism. We'll be working to operationalize our work using the Government Alliance on Race and Equity's 6-part strategy based on normalizing, organizing, and operationalizing the work. We normalize by using a racial equity framework. The key is intersectionality. We start with race and focus on intersectionality, such as gender, sexual orientation, religion, socioeconomic conditions, among others, and consider how our actions impact our populations. We operate with urgency and accountability to our actions, and then we organize. We organize by building capacity, hiring activists, leaders, change makers, and training our staff on what structural racism and systemic racism is and how certain processes, policies, and/or programs have perpetuated racism over time. Considering history and what constituted racism and structural racism, like redlining, Jim Crow laws, mass incarceration, we partner with other institutions and communities to do this work as well. We operationalize by implementing racial equity tools and being data-driven. Today's action helps us move this work forward to implementation. When your board declared racism a public health crisis, you directed staff to develop and implement an action plan to ensure that in making decisions, the county is promoting health equity, basing decisions on equity data, and engaging our communities in a participatory process. On April 6th of this year, the board received a report back on the action plan that included steps to update the county's strategic plan by creating goals and performance measures that focus on the concepts of belonging and equity 2.0, also known as targeted universalism. Targeted universalism is a framework developed by the Othering and Belonging Institute at UC Berkeley. It means that setting universal goals pursued by targeted data-driven processes to achieve those goals. Within this framework, universal goals are established for all groups concerned. Strategies are then developed by using data analysis to achieve those goals by focusing on what is needed by the different groups situated within those structures, culture, and across geographies to obtain that universal goal. The county's operational plan, also known as the budget document, will contain the focused strategies needed to accomplish these goals. Development of these goals and strategies will take place throughout the summer and with the anticipated completion of strategic plan updates by November of this year. In November of 2020, the county contracted with the Urban Policy Development and the Othering and Belonging Institute to work with the Leon Williams Human Relations Commission to develop the Office of Equity and Racial Justice mission statement, roles, and responsibilities. Today's request will ensure the feedback that we gain from community stakeholders during that process will be put into action through practical application. Today's action is requesting the board authorize the director of the Department of Purchasing and Contracting to enter into negotiations on behalf of the Office of Equity and Racial Justice with the Urban Policy Development Consulting firm for training, technical assistance, and coaching on using targeted universalism principles and frameworks that address structural racism for county departments. If approved, this will allow the county to gain continued support and technical assistance to ensure successful completion and implementation. There are 3 areas of focus: targeted universalism and structural racism training for county departments, Office of Equity and Racial Justice strategic planning and goal development, and lastly, county department equity strategic plan trainings and coaching. Subject to your questions, this completes my presentation.
Thank you, Andrew. I appreciate the work, and I'm happy to make a motion to provide this authorization. I want to mention, we talked about this in our budget hearing a little bit, that the job that you were tasked to do is to deal with, at times, things that are uncomfortable. And the reality is structural racism is uncomfortable if you are a victim of that. And addressing issues of implicit bias and addressing these types of challenges and issues requires us to do something different than we have always done them. And when you do things differently, that can be challenging and difficult, but we know how important it is. And I fully support what you are doing in the office. I fully support this effort. And our county government will be better because of what we are doing. And so I commend you for the work, and I'm pleased to support this. Vice Chair Vargas.
Thank you, Chair Fletcher, and thank you for the presentation. I'm happy to second the motion. Changing structural racism is not easy, and one person alone can't do it. I think to have experts in the field to come in and help us in this process, and more importantly, help us become transformational leaders in this field is going to take a lot. I've done this work before, and change is not easy. And so I think I appreciate the fact that they're looking at coaching, that they're looking at opportunities for people to come together and really begin to think about, reimagining who we are as a county. So I am really excited about this and the work that is going to be done. And hopefully, I will say that I hope they also include training and work with the elected officials who are at this dais, because we set the tone for the future of our communities. And if we don't understand what our implicit bias is in our own, perceptions and prejudice, then it's hard to make a change in an institution, and we need to lead by example. And so I'm happy and proud to support this initiative and this motion.
Thank you. Thank you. Supervisor Lawson-Remer?
Yeah, so first of all, I just really want to thank you for all the work. This is a really important proposal. It's vital that the county's operations are structured to remove barriers that stand in the way of any of our residents succeeding, including people of color, women, people with disabilities, immigrants, youth, and our LGBTQ community. I had the opportunity after seeing this board letter to actually look through the work and the approach of this institute, and I think it's really promising. That they bring a deep expertise to help your office fulfill the promise of removing barriers and creating the best outcomes for people who have for too long been marginalized and excluded in our community. So I think this is really a wonderful approach. It's going to be a long journey. This is not something that happens quickly. And I think I'm committed, and I think my colleagues are committed to us staying the course over the coming years to begin making the changes step by step that we need to make. So thank you for your leadership.
Supervisor Desmond. I believe you're muted, Supervisor.
I'm sorry, I didn't put my hand up yet. I saw Supervisor Anderson's hand up.
Oh, okay. Supervisor Anderson.
I was very pleased with the presentation. I just had a quick question. We know in the last census that many people from the Middle East were told when they took the census to mark that they were Caucasian, but we know that they're not Caucasian. And I just wondered, as we move forward, are we addressing that, and how are we addressing that?
Strong, would you like to comment on that?
Sure, yeah. And absolutely, Supervisor Anderson. One of the things that we're including in this proposal is work with data and how to disaggregate data in some of our populations, and not just with our Middle Eastern population, as they were included in the white category in the census, but also within our gender category and disaggregating the gender statistics. So we're looking at all those facets and how we could actually do that work across the enterprise, and not just within the Office of Equity and Racial Justice. We're also working with HHSA. They already do some of that work with some of their data, but we're looking across the enterprise of how do we work to use that data to do better analysis and make better decisions.
Well, let me just say, for the record, I really appreciate you being there, and I think that you're tasked with a very difficult charge, and I just really appreciate having you on it and working through it. So thank you.
Thank you, Supervisor Anderson. Supervisor Desmond.
Thank you. Yeah, I had something came to mind. One of the things that as we go through this process, and I realize it's going to be difficult, and I voted for and said that racism is a public health crisis, and I think racism should be eradicated wherever it may lie and however it may be. But I've been concerned about some of the training out there that I've seen in the news, and some of our own county employees are taking. And quite frankly, some of that training was offensive to me. So I'd like the Board of Supervisors to be able to review any of the training that before it's administered to our departments, to make sure it's sensitive. It's a tough topic, and I realize it's not comfortable, but I would like to see be able to review that information, see what it is, before it goes out and it's public. So I'd like that to, I was wondering if that'd be a friendly amendment to the motion that the Board of Supervisors would get to see the training before it goes to the departments.
I don't think we need to have the whole Board of Supervisors get every training that's done out there across the board in the county. I think it's a lot of training's going to be offensive to folks. We're talking about uncomfortable and difficult things, and uncomfortable and difficult things will at times make people uncomfortable. I do think, Supervisor, that if you asked a department to show you or let you join perhaps in the training, that might be enlightening. They would certainly be willing to do that. But I'm not inclined to accept your friendly amendment, but thank you.
Okay.
All right, with that, we have a motion by myself, a second by Vice Chair Vargas to authorize the actions in this item. Ask the clerk, please call the roll.
Thank you. I also know that we had one request to speak in favor of this item. That individual did not dial into the conference line. With that, Supervisor Anderson.
Aye.
Supervisor Lawson-Remer. Aye. Supervisor Desmond.
Aye.
Vice Chair Vargas.
Vargas, aye.
Chair Fletcher.
Fletcher, aye.
That motion passes unanimously with all supervisors being present and voting aye.
We're going to go to our final agenda item today, agenda item 20. This is a second reading of the ordinance for our Office of Evaluations, Performance, and Analytics. I believe we have a few speakers on this item. Why don't we hear from our speakers, and then we can come back and work on this as a board.
Thank you. There are 3 requests to speak on this item, all by phone. So those individuals that requested to speak on item 20 by phone, please dial into the conference line now using the instructions that were provided to you.
And while we wait for the speakers, I'll clarify, we have item 21 as well after we do 20. All right, I'll make a motion to approve agenda item 20. Thank you. Motion and second. Any comments or questions from my colleagues? All right, we ask the clerk to please call the roll.
Thank you. Supervisor Anderson. Supervisor Anderson? Oh, you're muted.
Yeah, sorry about that. Aye.
Thank you very much. Supervisor Lawson-Remer?
Aye.
Supervisor Desmond?
Aye.
Vice Chair Vargas?
Vargas, yes.
Chair Fletcher?
Fletcher, aye.
That motion passes unanimously with all supervisors being present and voting aye.
All right, our final item for today is agenda item 21, our routine appointments. Let me ask if there's any requests for public comment on this item.
Thank you, Chair Fletcher. We have one request to speak in person. I'd like to invite forward Reginald Carroll. You'll have 2 minutes to address the board.
Good morning. This is primarily to, I guess, Supervisor Fletcher. One of the problems I sit there and have is that I've been on the board for, I've been involved in the process for almost 20 years, and both of the candidates, actually, the candidate you've actually recommended for being replacing the chair and the actual chair, I met them both about 20 years ago. And one of the problems I sit there and have is that your particular candidate, however, has been in and out of the process, and as a matter of fact, he's only been part of the current process for the last 2 years, even though we actually became we actually reformulated and we became a advisory board in the current form 5 years ago. And that's my concern, is that the current chair there's a misconception that he has termed out. That's not true. What happened was the original chair actually quit. And then this person, who was actually a consumer, like I am, actually stepped up and was placed into the chair seat. And because of the change in the supervisors, because at that time it was Diane Jacobs who actually appointed him, they decided not to automatically sit there and put his name forward. And so it's been in limbo since last September, when I guess it would have normally sit there and gone through. The new person has just come on, and now he also tried to do it before to become chair, but like I stated before, he's fairly new to the process, has no idea of some of the changes we sit there and made, and that's part of the process. I sent out an email last month about racism in the process, and the racism has been available since I first sat there and started in there. And I used a phrase, no racism in the HPG question mark, because they literally keep telling me that there's no racist problem. It took me literally more than 10 years to get them to actually have a cultural competency from a Black perspective. That just happened in September. And so there is a problem. But my main concern is that I would strongly suggest that you actually give and allow HPG itself to, when we have more than one candidate, to make a recommendation that, and give you a recommendation as who we think is the most qualified person instead of just appointing the chair. Thank you.
Thank you, and thank you for hanging with us all day today. We do appreciate it. I'll make a motion to approve the appointments in item 21.
I'll second.
A motion by myself, seconded by Vice Chair Vargas. Not seeing any requests to speak on this item, I will ask the clerk to please call the roll.
Thank you. Supervisor Anderson. Supervisor Anderson?
Sorry about that. Aye.
Supervisor Lawson-Remer?
Aye.
Supervisor Desmond?
Aye.
Vice Chair Vargas?
Vargas, aye.
Chair Fletcher?
Fletcher, aye.
The motion passes unanimously with all supervisors being present and voting aye.
That concludes the business before the board today. I will move our adjourn in memories to tomorrow. And with that, we stand adjourned.